Tabling of documents. Dépôt de projet de loi émanant du...
Introduction of government bills.
Statements by ministers. Rapport de...
Reports from interparliamentary delegations.
Presenting reports from committees. The Honourable Member for Coquitlam, Port Coquitlam.
Thank you, Mr. Speaker. Mr. Speaker, I have the honour to present in both official languages the second report of the Standing Committee on Health in relation to the motion adopted on Friday, November 27th, 2020, regarding the instructions to the Law Clerk and Parliamentary Council. Thank you, Mr. Speaker.
Dépôt de projet de loi émanant des...
Introduction of private members' bills.
First reading of Senate public bills. Motion.
Motions.
Presenting petitions. The Honourable Member for Saanich Gulf Islands.
Thank you, Mr. Speaker. It's an honour to present a petition. It's petition 108-65888. Petitioners asked this House of Commons to look at the situation, particularly on Wet'suwet'en territory and lands, in relation to the United Nations Declaration on the Rights of Indigenous Peoples. They point out that the Coastal GasLink project, which is being built across Wet'suwet'en lands, does not have the approval of Wet'suwet'en Nation, and specifically that the project, Coastal GasLink, will involve the release of vast quantities of the methane, of the greenhouse gas methane. They call on the House to move quickly to bring into law the Canadian compliance with the United Nations Declaration on the Rights of Indigenous Peoples. Thank you, Mr. Speaker.
Presenting petitions, the Honourable Member for South Okanagan Kootenay.
West Kootenay, but thank you, Mr. Speaker. And I rise again to present a petition from young people in my riding and the neighbouring riding of Kootenay-Columbia that these young people are concerned about climate change and that uncertain future. They point out that Canada has endorsed the Paris Agreement to keep our world climate warming below 2 degrees Celsius. And so they ask the government to take meaningful steps to ensure a good future for young Canadians by making a detailed climate action strategy that includes legislated science-based targets and implement a steadily rising national carbon price, eliminating fossil fuel subsidies, and redirecting those investments into renewable energy systems, energy efficiency, low-carbon transportation, and job training. Thank you.
Presenting petitions. Présentation de pétitions.
Presenting petitions.
Questions on the order paper. The Honourable Parliamentary Secretary to the Government House Leader.
Thank you, Mr. Speaker. I would ask that all questions be allowed to stand at this time, please.
Great. Orders of the day.
Government orders, business of supply, study of a motion to acknowledge the extraordinary work of healthcare workers in the name of Mr. Blanchet. Mr. Blanchet, seconded by Mr. Terrien, moves that the House, A, acknowledge the extraordinary work of healthcare workers, including doctors, nurses, and orderlies during the COVID-19 pandemic, particularly with seniors, but also with the general public.
B.
B, recognize the courage and sacrifices required from them and their families in order to be on the front lines. C, highlight the work of Quebec and the provinces in responding to the health crisis, and note the direct impact on their respective budgets. And D, call on the government to significantly and sustainably increase Canada healthcare transfers before the end of 2020 in order to support the efforts of the governments of Quebec and the provinces, healthcare workers, and the public. The Honourable Member for Belleuil-Chambly.
Monsieur le Président.
Mr. Speaker, I want to thank you. There is not much fate in this, and I think that our motion of this morning deals essentially with the compassion that we must feel for those who not only are victims of the disease, but also the people who are on the front lines day after day. And throughout the Christmas period or the holiday period, they will continue to focus all their efforts and expose themselves without taking into consideration the risk that they run. It's no coincidence. We're the day after fiscal update from the government, and the Liberal government tabled this update, this economic update, and it's like a big dose of cod liver oil, and they're shoving the huge deficit down our throats, and they say, don't worry, we'll pay tomorrow. And usually when you say that, we'll never pay, because you think that something is going to happen later that will free us up from us. But in the case of this government, they won't be there. This government will create a debt that perhaps in some ways is justifiable, but in others is not. And simply to say it, you're shoveling forward. And just imagine that if you shovel the snow forward, it's other people who will have to then take up the shovel. What are they doing? They're saying, immediately we're going to pass this deficit. And in the spring, once we start to distribute and administer the vaccine, people will forget that they will have had 6 or 8 or 12 weeks later than the others. They'll be less afraid, and then there'll be the deficit that is while they're afraid, so that it's justifiable. But when the budget comes in the spring, they will announce gifts, my friends, that will make no sense. The Christmas that we won't have on December 25th, well, watch out. At the end of March, it's going to fly in every direction. And we understand, obviously, but there are analysts other than me that are saying that this is an election kind of play. If in walking in provincial areas of jurisdiction, perhaps it's like an election campaign. If the government thinks that they're dealing with various issues, it's like an election. The government thinks that it's an election campaign, but I have some news. We are going to stand up. We are going to always call on preservation of Quebec's areas of jurisdiction in the areas of health. I was saying to a journalist earlier that if we urgently need $10 and you have $5 and I have $5, but it's your area of jurisdiction, well, I'm going to give you my $5. And you're going to save both of us because you have the expertise in that area. And a federal government that does not administer the hospitals, it doesn't manage the nurses or the doctors. It's not the one that hired the orderlies. It doesn't have the expertise when it comes to managing the healthcare system. Not only is it keeping its own $5, but it's keeping the $5 of the other guy. And they think it's normal to do that, to use it for political purposes and monger fear. We can never say enough because there is something purely human about this. Since March, we have been in a pandemic. People are fragile. They are the most exposed, if you will, in terms of their health. Of course, obviously, those people who risk the most from this, who risk dying if they are exposed to the coronavirus. We're talking here about seniors, people who haven't seen their purchasing power increased. Beyond those who are sending us letters and who said, I got 61 cents and it's taxable. 61 cents, taxable. Those who have seen their purchasing power cut the most because groceries, electricity, and everything costs more. We're talking here about the seniors, those who are suffering the most from isolation. We're talking about seniors. Mental health issues and distress are not just the realm of teenagers moving into adulthood. Rather, there are mental health issues that affect seniors as well. What additional assistance is being given in the economic update to seniors? In money? Zero. That's not nothing. but it is nothing. And in terms of healthcare, the government is saying we're going to give $1 billion out of 300 and something million for later. That'll be during the election campaign, so $1 billion out of the total. If the provinces give their jurisdiction up and lay it on the feet of the Prime Minister and say, you're the boss here in the healthcare area. Asterix wouldn't like that. But this is the principle. Give up your healthcare jurisdiction and we'll cut you a check. That doesn't make any sense, but that's the plan. And I saw people say, well, but it's an economic outlook that's from the heart. My eye. If there was heart in this, they would take care of the most fragile and vulnerable people. It wouldn't be lower level politics playing with the necessary resources for the healthcare system and the minimum quality of life for our seniors. They are going to spend Christmas alone in front of the TV. It doesn't make sense. I think it's serious. Let's talk a little bit about healthcare. We had heard that December 5th there would be a meeting between the Prime Minister of Canada, the Premier of Quebec, and the provincial premiers, and they would talk about healthcare transfers. The Prime Minister through his Deputy Prime Minister, and we already thought the Deputy Prime Minister would bring the Prime Minister to some better considerations, but we see the opposite occurring. And the Prime Minister announced that I'm coming empty-handed. I just want to talk about all kinds of things, and to be sure that I won't get criticized later, I'll bring it to the end of the session in Ottawa. How fortunate. The opposition parties, therefore, won't have the opportunity to question the government on the fact that they won't be represented in a meeting of the premiers and the Prime Minister, who is coming empty-handed. And they should be getting the money. This is money they are owed. This is the instrumentalization for political purposes of a serious crisis, and it will hurt people. Why? To open a window for a future election where it'll be Canada against Quebec. It's already worked in the past. It could work again. We're here, and it might not work. We have to talk about the economic recovery. And yesterday's economic plan talked about economic recovery later, at some time. Why? Because right now, we're going to announce the bad news about the deficit. It had already been kind of known in advance. And they're saying, well, interest rates are low. It doesn't matter. Fill up your credit cards. Use Quebec's credit card and the provincial credit cards, and we'll go to Costco and we'll fill up our baskets and we'll build ourselves an election program with the money from Quebec and the provinces. And once we get to the end, we'll table a budget in which we'll announce, well, it will be crazy what's going to be announced. The problem is that it doesn't work like that. Economic recovery requires a number of things. I will name 3. And you won't be surprised. I will talk about support for seniors. Why? Because in the Quebec regions, and I assume it's the same thing across the country, seniors are spending their money every day, even if many of them don't have enough. All of that money will quickly be injected into the regional economy, which will help for the rapid economic recovery of the regions. And we will know that we were getting out of this crisis. If you're a senior and you can't do it, well, be careful. If you can't do it, it can't do the calculations, but it is money that will be invested in the recovery. Even money that is invested in healthcare for the provinces in Quebec is money that will go into the recovery, because if there's $200 million from the federal government, that is the province's money that is, and send it to Quebec, Quebec will have to take that money from somewhere else, and the $200 million that Quebec will have to take from elsewhere to invest in the healthcare system will not be used by Premier Legault and Fitzgibbons to support companies in Quebec to help Quebec companies emerge from a crisis that has been disastrous. So the healthcare money has to be freed up in order to ensure that Quebec can contribute to its own economic recovery. And of course, there is the classic economic renewal. We will inject significant amounts of money. And we will do that to stimulate economic activity. The basic principle is the same. Every person who works is one expenditure less for the state and additional fiscal income. So it's a 4-point game in hockey. You have to bring people back to work in tourism, hotels, but also in industries, public services, restaurants. These are a lot of people who instantly will go back. But in order to do this, it has to be predictable. If people don't know the nature of the economic recovery plan that the government will take part in, they cannot prepare themselves for it. It's that simple, except that the government seems to want to keep it in order to have a budget later to say, look how great we are for businesses. We're coming out of COVID because people who are fragile, who might lose their lives, are going to get vaccinated, et cetera, et cetera. A lot of the work will have been done later in the U.S., later in Germany, but it will be done later. But it'll be good news during an election window. But in the meantime, businesses don't know what to do, how to organize. 25 million is 15 billion for the wage subsidy, but it's 10 billion in other measures, which are very good, support for electric vehicle purchasing, etc. So I think there's a lot of measures, but 10 billion out of 4 will understand that most measures aren't budgetary.
Alors, Madame la Présidente.
Madam Speaker, the fear that we have, and we see the situation for our seniors, the situation they're facing, what we fear is that the Liberal government is opening up an election window on this issue. If their plan is to affect the situation in Quebec, to adversely affect seniors, well then, Quebecers may well clearly state that they don't support the plan, and we'll be there to respond to it. Thank you very much, Madam Speaker.
Questions et commentaires, questions and comments. L'honorable député d'Argenteuil.
The Honourable Member for Argenteuil, La Petite Nation. Well, thank you, Madam Speaker, and I'd like to thank my colleague opposite for his remarks. As you know, he is comparing Quebec with Canada, but we have the entire country to manage. He's used funding, or he's using fear to make people afraid of the situation, but we're making people aware of the risks of the pandemic. He is comparing the Prime Minister Asterix, he's making fun of them, having a great deal of fun making a speech. Well, he likes talking about seniors, but he needs to bear in mind that seniors with Quebec, and this is bad news for the member opposite because there are negotiations with Quebec that are well underway and going well. We've got some 740 million earmarked for seniors and for helping seniors, $400 more for seniors. We've supported them. Can the member opposite tell us whether seniors have had enough from the federal government during the pandemic? Thank you, Madam Speaker. The Honourable Member for Belleuil-Chambly. Oh, of course I can. I can easily say no. No, that seniors are writing into us and saying they got a 61-cent increase. You can't even buy a package of gum with that these days. 61 cents? Don't be surprised, dear colleagues, distinguished colleagues. Don't be surprised that I distinguish Quebec from the rest of the country, because the last time I checked, I was the head of an independentist party in this place. Oh, what was that reference? He said asterisk. Yes, that's one. Well, I was the one with the wings. I'm not comparing the Prime Minister to Asterix, because Asterix is sympathetic, is nice. I'd like to be compared to Asterix. I was comparing the Prime Minister to Jules Caesar, Julius Caesar, and the historical references with that. So I'll stop with those comparisons. And seniors are not being properly supported by this government. Questions?
L'honorable député de...
The honourable member for Rosemont La Petite Patrie. Thank you, Madam Speaker. I'd like to thank the member for Belleuil-Chambly for his remarks. He'll be happy to hear me say that the NDP has always been calling for changes, more help for the seniors ever since Stephen Harper made so many cuts, and based on what the Liberal governments have done since they came to power in 2015. I agree with the motion put forth today to thank workers for all the sacrifices they've made, for the extraordinary work healthcare workers are doing. But I'd like to draw his attention to asylum seekers who are working in our healthcare system. Since August, they've been told that they would be able to regularize their situation. They wouldn't be deported. But yesterday we learned from Border Services that deportations could start. So there are some people who have documents that could be submitting them shortly, but the member for Saint-Jean is doing excellent work in that, his colleague, and I acknowledge that. But how can those asylum seekers who've helped us in our healthcare system, how should they be treated in the views of the honourable member? That troubles me. That's too many good words. There must be something hidden there. But on a very important issue with respect to asylum seekers, the Bloc Québécois, through the member for Saint-Jean, on many occasions, has expressed a great deal of compassion. I have a great deal of compassion for people who are leaving a difficult situation, who've said, I'm going to go somewhere else, I'm going to go there. And they get there and they say, I'm going to help the society. I'm going to invest myself in that society. And we've seen people expose themselves to difficult conditions. They weren't very well treated in many cases. They have taken those risks. And the government has said, well, our focus must be on the pandemic with respect, except for their election preparations. But it seems to me that we shouldn't be not focusing our attention on those people and deporting them. With the exception of some rare circumstances, we need to invite these people to become members of our society and to establish themselves in Quebec, provided that they have a minimum knowledge of French. Now, transfer for health is also a very important issue, and also we need to see a transfer of additional funding for daycare spaces for seniors through the healthcare transfer to Quebec, and for pharmacare. Now, the member for Rosemont La Petite Patrie, who has made these important comments.
L'honorable député d'Argenteuil.
The honourable member for Argenteuil La Petite Nation. Well, thank you, Madam Speaker. I'll continue the question that I started earlier. Now, my colleague opposite knows full well what we've done for seniors, Madam Speaker, 20 million. And the Quebec Party has earned a great deal of had a great deal of help for that. 100 million for food banks, for example. There's another example. There are many more. But my colleague opposite keeps talking about a 61 cent, or mentioned a 61 cent increase. Does he know that the 61 cents is a tax exercise that takes place every month and not an increase? He's misinforming organizations. That is a false information. It's a tax adjustment. The honourable member for Belleuil-Chambly. We've looked at this now. Well, the other aspect, Madam Speaker, is 61 cents times 12, even if it's a monthly exercise. Well, that's still not very much. That's not a lot. It's what? How much is it? $7, $7.50. So that's not enough. well, the Prime Minister can answer this question, but why not legitimately increase spending power? Why are they using such an odd approach when they say we're going to send money to families? Well, it's fine to send money to the families, but if they say, here's the money, go and buy some peanut butter. But with seniors, we say, well, no, we gave some money to this other organization, and then those organizations send out letters to say how lovely the Liberal Party is. But what's good for one should be the same for the other. The Honourable Member for Jonquière. Joliette. It's Joliette, Madam Speaker. Thank you, Madam Speaker, and I'd like to thank my leader for his excellent speech and for the motion that's before us here today. It's very important to say thank you to our frontline workers, the nurses, all of the people working in long-term care facilities, in hospitals for the past 8 to 9 months. They're making miracles. There's a shortage of funding in the system. They're doing humanitarian work, and we say hats off, bravo. My question for the leader is this. In long-term care facilities, the Minister of Health here, just last week in her remarks before the committee, said we're going to be establishing standards for long-term care facilities. But when the Army arrived, they said there are enough standards. The problems are the lack of resources and a shortage of staff. In the economic update, they said yesterday $1 billion will go to that's they're going to be investing that money, except that they're going to be putting in place standards and they're going to interfere in an area of provincial jurisdiction. The Honourable Member for Belleuil-Chambly. When my colleague speaks, it's as if I'm speaking myself. I don't need to add to anything he said, but I could simply reiterate that we could put ourselves in the place of people who day in and day out go into the healthcare facilities and expose themselves, not to the virus, but to this difficult situation, the distress people are facing. And that needs to be a consideration. The quickest way of helping those people is by not stubbornly imposing conditions, and it's by transferring funding to the provinces so that hiring and treatment and support for seniors can be as best as it can be. Resuming debate. The Honourable Government House Leader. Well, thank you, Madam Speaker, and I'd like to say that I'll be sharing my time with my colleague and friend, the member for Laurier-Sainte-Marie. Madam Speaker, thank you for this opportunity to speak, and as I've always said, health is too important to play politics with. We need to collaborate, work together for the well-being of Quebecers and Canadians. And the best way to do that is by setting aside time for discussion, holding these discussions, and by working together. Madam Speaker, as we've all said, the health and safety of Canadians has been at the heart of our concerns since the start. It has been and will continue to be our top priority. As I said, and to reiterate once again, we will always be there to protect the health and safety of all Canadians. Now, before going any farther, I'd like to commend our healthcare workers for the work they're doing, for the sacrifices they've made during the pandemic. I'm thinking about doctors, nurses, orderlies, caregivers. They are the cornerstone of our healthcare system. We have to thank them from the bottom of our hearts. The same way, I want to highlight the work done by the others who we see less often, who we talk about less because perhaps they're in the shadows, but cleaners, all of the support staff that keeps our healthcare system working. They're in the shadows, but we can't forget about them. So we need to think about them as well as part of this debate and these discussions. Now, they are giving up time that they could be spending with their families to look after our loved ones, with our grandparents, and they're endangering their own lives to protect others. So, to all these healthcare professionals, all professionals working day and night from sea to sea, I say from the bottom of my heart, thank you. I also, Madam Speaker, wanted to mention the work done by our armed forces. I want to underscore the contribution that they made in our long-term care facilities in Quebec, in Ontario, as well as the work done by the Red Cross, which is still active on the ground to lend a hand to the men and women working with our seniors. They're doing exceptional work on a daily basis to help and accompany our parents, our grandparents. And I've said this often, helping our most vulnerable fellow citizens is not a question of jurisdiction. Helping our seniors is not a jurisdictional issue. It's not a line or a paragraph in the Constitution. They are our seniors, the people who built our society, and it's our duty to be there for them. And I find it unfortunate that the Bloc wants to pick a fight instead of working together for Canadians. It's really unfortunate. They're trying to create false squabbles with Quebec where there are none. We agree. We're working together. We're talking on a daily basis through the various offices, ministers, political staff, MPs. We have worked well with provinces since the start of the pandemic, and we continue to do so with the provinces, including Quebec. But it's not what the Bloc wants to hear, but that is the reality, and it's working well. Is it perfect? No. But we are able to work together because we have put the interest of Canadians first. So what's important to point out is that we are here for the provinces. We were there at the start. We are here today, and we will continue to be there for them in the future. And that's why we earmarked 41.9 billion for the provinces and territories this year, and 235 billion over the next 5 years for this pandemic that is difficult. But one positive thing that will come from it is this willingness and ability to work together. And that, for example, is how we succeeded in making historic investments of $19 billion with the Safe Restart program to help the provinces. And that includes, for example, just a few examples, $700 million to support the healthcare system, $500 million to help people who are facing mental health issues, addiction issues, who are homeless, $740 million to control and prevent infections in long-term care facilities, for home care, for palliative care. So those are very tangible examples of what we've done. And that's in addition to other investments that have already been made in healthcare during the pandemic, including $500 million for critical care in healthcare, $240 million for virtual care, and many digital tools that are playing an increasingly important role in the healthcare system. So what does that mean for Quebec in concrete terms? Well, it means $675 million for testing, contact tracing, and data management, which are all essential to dealing with the pandemic. It means $270 million to help the healthcare system weather this crisis. $166 million for our most vulnerable, and $670 million for PPE. $675 million for personal protective equipment. And we know just how important all of this equipment is for healthcare workers. It's fundamental. $675 million for Quebec.
On peut penser aussi à tout le reste.
And then let's consider all the rest: childcare, sick leave, public transit. All of these services have become particularly important during the pandemic, and that is why we've put nearly $1.5 billion on the table. We're talking more than $3 billion transferred to Quebec in having to do with the health and safety of Quebecers, and that's in addition to the regular health transfers. Only yesterday, the Deputy Prime Minister announced new investments which show our concrete commitment to the health and safety of all Canadians. I'll name a few of these announcements. $1 billion to improve the situation in long-term care. That means more money for ventilation, hiring more employees, better infection control. That is all crucial in fighting this pandemic. More money for tests, rapid tests, PPE. Also, of course, vaccine purchases. Madam Speaker, we have reserved 10 doses per Canadian, the equivalent of that, more than any other country on a per capita basis. We're working with the provinces on vaccine distribution. So when I hear the Bloc Québécois talk about health funding, well, I think I can say that we have been there. We have stood up for the provinces, including Quebec, is what I would say to my friends from the Bloc Québécois. Thank you, Madam Speaker. The Honourable Member for Drummond. Thank you very much, Madam Speaker. I'd like to thank my colleague across the way for his speech. I'll say almost, let myself be carried away by his melodious tone when he was talking about taking care of seniors. And he tried to lull us into a sense of security by talking about working with the provinces and territories. Well, my question is, when the First Minister's meeting happens, if the provinces and territories premiers tell the Prime Minister that they don't want more interference in provincial jurisdiction and that they want health transfers to be increased, which has been requested unanimously by Quebec and the provinces, then what will the government do? Will it say, well, we're there for you and we're going to keep working with you? If someone tells me, you're not invited to this party, well, then I leave. And if they ask me to give them money that I owe them for setting up the party, then I give it to them. Now, my colleague has said that we're not doing anything to help seniors, and that the federal government has done a great deal to help seniors. But I would say, what was in the economic update that's really about concretely helping seniors? I did not see concrete numbers on this, and I looked everywhere. The Honourable Government House Leader. Thank you, Madam Speaker. I'd like to thank my colleague for his compliments on my melodious tones. Now, I would say that we've been working with the Quebec and all provinces on these topics. When it comes to seniors, we have offered a great deal of direct assistance to seniors in long-term care through the Army, through the Red Cross, through direct funding, PPE, contact tracing, and so on and so forth. We have cooperated directly with the government of Quebec, Madam Speaker. It's not about arguing with the provinces. We're all working together. We're working with the members of the National Assembly who represent the same citizens of Quebec. We have the same objective, to get through this crisis as quickly as possible and save as many lives as we can, while keeping our economy as strong as possible.
For Vancouver Kingsway.
Thank you, Madam Speaker. One of the reasons I'm a proud New Democrat is because the New Democratic Party is the party that invented and pioneered public health care. We did it in the 1940s in Saskatchewan, and of course the NDP played an instrumental role in the 1960s with the Liberal government of Prime Minister Pierce at the time to create the structure of today's healthcare system. Now, at the time, the original bargain of healthcare was supposed to be a 50-50 split between the federal government and the provinces. Since then, however, though, successive federal underfunding has resulted in the situation today where the federal government pays only about 22% of the total health care bill. And also, of course, the Harper government capped federal health care spending at 3% in 2017. The Liberals promised to address that, and instead they adopted that. The result, Madam Speaker, is that we have health care costs growing at 5.4% in this country, federal funding growing at 3%. Canadians can do the math. There's only one recipe, and that's for long-term fiscal disaster and cuts. So to my honourable colleague, does he not agree that the federal government should reverse the long-term slide in federal funding and start reversing that so that the federal government starts to honour its original commitment of paying half the cost of health care in this country as it originally promised?
Honorable leader du gouvernement à la Chambre.
The Honourable Government House Leader.
Thank you, Madam Speaker. I want to thank my colleague for his question. I do agree with him that we have to be there for the health of all Canadians. We have to be there to collaborate with all provinces, and this is exactly what we have been done. Like, if he's asking me to defend the system put it in place by the Conservatives, I won't do that. I will let the Conservatives defend their own system. But what I can tell you is that since the beginning of this pandemic, we've been there for Canadians across the country through all kinds of measures and supports. Our intention is to keep working with provinces to help them go through this pandemic and work on the long term. And actually, as you know, Madam Speaker, the Prime Minister is meeting with his counterparts on December 10, and they will be discussing this and other topics.
Reprise du débat. L'honorable...
Resuming debate. The Honourable Minister of Canadian Heritage. Thank you very much, Madam Speaker. I am very pleased to speak today in this important debate on the Canada Health Transfers and healthcare funding. Our government has committed to supporting the healthcare system so that it may meet Canadians' needs today and in the future. Our system needs to adapt with the goal of offering better care and better affordable results, given the aging population, the increase in rates of chronic disease, and financial pressures related to new drugs and new technologies. Since the beginning of the coronavirus pandemic, our government has continued to play a proactive leadership role and to communicate with provinces and territories to support them in their efforts to respond to this crisis. More specifically, the Government of Canada has invested more than $19 billion to help the provinces and territories proceed to a safe economic recovery. That includes $500 million to guarantee that healthcare systems will be ready to face future waves of the virus, $740 million for vulnerable Canadians, including individuals in long-term care and palliative care, and those receiving home care who may suffer more serious cases of COVID-19. As well as $500 million to support and protect people facing mental health difficulties, as well as addiction or homelessness. This government is also supporting virtual care and other virtual care in order to reduce the pressure on emergency departments and to favor social distancing. We have invested $240 million to develop virtual care tools and mental health tools to support the provinces and territories. And that's in addition to the $500 million from the COVID-19 response fund, which was given earlier this year to the provinces and territories in order to help them respond to the critical needs of healthcare systems and support mitigation measures. These funds were a one-time addition to the Canada Health Transfer, which is the main federal funding mechanism to support Canada's healthcare systems. It provides predictable and long-term funding to provinces and territories. In 2020-2021, the federal government will provide nearly $42 billion to the provinces and territories through the Canada Health Transfer. That is on average 23% of the health spending projected by provincial and territorial governments. In 2020-2021, Quebec will receive $9.4 billion under the Canada Health Transfer. The Canada Health Transfer increases each year as a function of the growth of the economy, with a minimum increase of 3% a year. Over the next 5 years, Canada Health Transfer funding to the provinces and territories will exceed $200 billion. These funds are allocated on a per capita basis, which enables all Canadians to be treated comparably regardless of where they live. The Canada Health Act establishes the criteria and conditions that provinces and territories must meet in order to receive the full financial contribution under the transfer. Apart from the Canada Health Act, the Canada Health Transfer is unconditional and gives the provinces and territories the flexibility they need to decide on the best way to use these funds and meet the health needs of their residents and communities. Madam Speaker, I'd like to take a little time to discuss the history and evolution of the Canada Health Transfer. The current global flexible funding arrangement in the Canada Health Transfer is different from the original regime of subsidies that existed at the beginning of healthcare. Before 1977, the federal government would match up to 50% provincial and territorial eligible spending for doctors and hospitals. However, this spending only represented, or rather, the spending on these areas only represented 3/4 of the total health spending of the PTs. So these agreements before 1977 for matching funds did not cover other healthcare expenses like pharmaceutical products, home healthcare, mental health, and other related health services, which were representing more and more of the health spending of provinces and territories. And these costs have only increased over the years, whereas the portion that is spent on doctors and hospitals has decreased and now represents less than 60% of the provinces and territories' health spending. Even during this first period, where eligible expenses were matched, federal transfers never really represented 50% of the expenses on doctors and hospitals. It represented less than 37% of the provinces and territories' total spending. As the health system evolved, all parties decided that a more flexible funding system was necessary to help the provinces and territories meet their own priorities in healthcare and not just to contribute to paying the bill for doctors and hospitals. Under a 1977 agreement on established program funding, the federal, provincial, and territorial governments agreed to leave behind the 50-50 matching subsidies and instead use a more flexible system of block transfers or cash transfers. That means that instead of having the federal government match provincial and territorial spending on hospitals and doctors, the provinces and territories would receive a cash transfer that they could spend on a broader range of priorities in healthcare. Even more important in the current context, this agreement included a provision which stated that the federal government would permanently transfer a tax margin or points to the provinces and territories. This meant that this transfer of tax points meant that the federal government would reduce its tax rates permanently, while the provinces and territories would increase theirs by the same amount, which had no ultimate effect on the taxpayers' tax bill. And so more specifically, 13.5% of individual income tax, personal income tax, and 1% of corporate income tax was transferred to the PTs. And so instead of the federal government gathering these taxes and then transferring the money to the territories, the provinces and territories, these can now gather the money themselves and spend it the way they want. In 1977, 1978, the value of these transfers or tax points transfers equaled about 22% of provincial and territorial spending on hospitals and doctors. whereas the cash health transfer represented 33%, so a combined total of 55%. The cash transfer proportion represented 25% of the total health spending of the PTs. This is the threshold that is the benchmark for the federal cash transfer contribution, which until recently was recognized and had been recognized for a long time by the provinces and territories themselves. As I mentioned, the Canada Health Transfer currently represents more than 23% of the total health spending of provinces and territories. But federal health spending for the provinces and territories is not limited to the Canada Health Transfer. A large portion of COVID-19 funding, including the funds in the Safe Recovery Agreement, which will be used specifically for health, will be transferred directly to provinces and territories. Apart from the extraordinary measures that the government has taken to help the provinces, territories, and all Canadians to face the coronavirus pandemic, the federal government will be bringing additional support and ongoing support for healthcare. For example, the investments made under the previous mandate. I'm sorry, Madam Speaker, I'm having a small technical problem. I'll go ahead. Under the previous mandate, in August 2017, all the provinces and territories agreed on federal funding of $11 billion over 10 years to improve home care and mental health care. These funds alone brought federal contributions to provincial and territorial health spending to nearly 25%. The government also provides major direct funding in healthcare through its responsibility for protecting and promoting health, including regulation. The government supports public health, health research, and pan-Canadian health organizations, as well as healthcare service delivery to specific groups such as Indigenous populations, as well as direct federal spending and tax transfers to the provinces and territories. The government also offers assistance to individuals and businesses through the federal tax system. Now, our health system does need to be improved in certain areas. However, the past shows us that these improvements cannot be realized by simply adding more money. Canada is one of the countries which spends the most on health, and yet we are not getting the results that Canadians need and deserve. Thank you very much.
L'honorable.
Questions and comments. The Honourable Member for Thérèse de Blainville. Thank you very much. The government House leader's speech just now practically had me shedding a tear. And as for this one, I'm left wondering how I can possibly have enough time to respond to this 101 course on all the federal health transfers over the years. Well, I would simply say that over the years, I've had the privilege of being on all sorts of boards on health funding, including the Romano Commission. Now, what I would simply say is that there was an agreement to guarantee to Quebecers and Canadians universal, free, and accessible health care throughout Canada. There was a pact, an agreement, that the cost would be shared 50-50. The other part of the agreement was that the provinces would have control over organizing this health care. In my colleague's speech, we've just heard a great many numbers over a lengthy historical period. But my question is the following. Does my colleague think that these sums, which are given on a periodic basis for specific reasons, are they really sufficient when it comes to meeting the benchmark and allowing the provinces to offer health care? Does it really offer predictable healthcare funding, which is what we see in our motion? I would just remind the honourable member to direct questions through the Speaker, the Honourable Minister. Thank you very much, Madam Speaker. I would like to thank my honourable colleague for her question. In my speech, I simply tried to show that at a certain time there was a 50-50 level of cost splitting, but that ultimately that 50-50 cost splitting only represented part of the cost for provinces and territories, and that over the years, through agreements between the different levels of government, that ultimately that formula was altered, going from a 50-50 cost-splitting arrangement, which ultimately didn't actually cover 50% of provinces' expenses, to a more flexible formula, where now all sorts of different types of spending are now taken into account in calculating the transfers. The opposition tries to make it sound like we've gone from 50 to 23%, and like the federal government has ultimately withdrawn from the healthcare system in the provinces and territories. That's simply not true, Madam Speaker. Moreover, I would say there is certainly predictability in these agreements. But with COVID, it was urgent to take action on a specific basis because of the crisis. And I think that the opposition would not have been pleased if the federal government hadn't offered that support. Questions and comments? The honourable member for Rosemont-la-Patrie. Thank you very much, Madam Speaker. I feel like my honourable colleague has given us everything but the kitchen sink in his speech. Under the Stephen Harper Conservatives, the 6% increase of health transfers was reduced to approximately 3%. This deprived the provinces of $36 billion over about 10 years. And the Liberal government decided to extend this conservative formula. So I would ask the question again. It's not simply by offering periodic individual programs that the structural problem can be addressed. When there are 5.4 yearly increases in health spending, how can the provinces and territories cover that when the federal government is only offering an increase of 3%? We've heard a lot about sustainable development. What about making the health system sustainable? The Honourable Minister. Thank you very much, Madam Speaker, and I'd like to thank my colleague for Rosemont-la-Patrie. And I'm very pleased to be asked about the environment, since, as we know today, through science, we know that there is a strong link between healthcare costs and pollution. And that is why, since 2015, our government has been addressing the issue of pollution as no prior government had done. We will succeed in reducing pollution in the country, whether it is air pollution or whether it comes to addressing waterway pollution. The more our planet, country, and population are healthy, the more we'll be able to reduce the pressures on the healthcare system throughout the country. Thank you very much, Madam Speaker.
Resuming debate, the Honourable Member. Oh, it's you, the Honourable Member for Bellechasse et Chemin-Lévis. Thank you, Madam Speaker. Thank you for giving me the floor to speak, and I will be sharing my time with the member for Kamloops, Thompson, Caribou, Madam Speaker. Of course, I would have liked to have asked my colleague, the Minister, the Liberal Minister. This is during a pandemic, and the environment that we're living in is upset. And I would like to say that the government can transfer funds, but also can do things to help the provinces, and he could have done so as well. Today, we're here to debate a motion that was introduced by the Bloc Québécois. And the first three parts stress the efforts of the healthcare workers and the courage and sacrifices that they have made. And I can only add my voice to that of all other parliamentarians. I'm sure I'm speaking on their behalf and saying that we are proud of the work that they're doing in the hospitals. I was on a visit on Hôtel Dieu in Lévis on the weekend, and even the security staff on a daily basis, they come into contact with the virus. Yet they do their work. And this, of course, is a significant challenge to them. And my financial advisor has a wife who works with the Sisters of Charity in Quebec, another outbreak site in Quebec. She herself was affected, so she was in isolation. I'm thinking of the people who work in our seniors' homes, like Au Royal in Saint-Anselme. It's demanding to work in this kind of field where there are basic services being provided, and even more so when there are restrictions. So I salute all of those individuals. And goodness, we have such admiration. We hope that Father Christmas will come and give them a gift, even if it is a time that is very busy for these people. So first of all, I want to tell my colleagues and those listening that I'm very proud of having been part of a government that even during an economic recession improved healthcare transfers. So in fact, we can be quite clear, Madam Speaker, the federal government has a significant role to play to support the provinces in their efforts to maintain the healthcare system. And we are in favor of the motion that is being introduced today by the Bloc Québécois to ensure that the federal government will continue to provide to the provinces significant and sustainable healthcare transfers in health. Madam Speaker, obviously we appreciate the work that's being done, and I mentioned in the beginning of my speech that this is a very special time, a unique time, and there are two things that are very important. And for those listening, we are asking the government pretty much at every opportunity, when will Canadians have access to the vaccine? It's important. It's important because we know that this is the second wave. There is a great deal of uncertainty for the holiday period. It's important for Canadians, for businesses, such as in the tourism sector, for restaurants that are closed, to have hope, to have a timeline. And at present, it is complete darkness. There is no sign from the government. All we know is that there is a lot of vaccines. So I think we'll have some for every part of the body, but we don't know when. But what we're humbly asking the government on behalf of Canadians is, could you please tell us at what time will the vaccine begin to be distributed in the country? It's important, Madam Speaker, because people expect, or are waiting rather, for this in order to be able to resume their normal lives. And of course, the rapid testing. We can find out later if we are a carrier, if we've had it, if a loved one has had it, but we do want to know. And it's very slow in the deployment of rapid testing. We mentioned it, that other countries have access and have had access to rapid testing for quite some time. But when it comes to the vaccines, we know that Mexico, and we're very proud for our Mexican friends, we have trade ties with them, but what we want is to know when we'll have access to the vaccine like the Americans do and many Europeans do, and as I would say, hundreds of millions of people around the world. And Canadians are also entitled to have access to that vaccine. It's clear that the Liberals at present must make a special effort with regard to rapid testing, with regard to personal protective equipment. Unfortunately, we have seen the government do the opposite and deplete stocks and even sending them at the beginning of the pandemic abroad. These are things that we condemn. We have also seen the Liberals, unfortunately, I'm from Bellechasse and I'm thinking of the Alma municipality. We had a hospital there, that hospital, and when the Liberals wanted to balance the budget, they cut healthcare transfers. The Conservatives increased healthcare transfers during the economic recession, and we still managed to balance the budget. Unfortunately, these are two things that the Liberals seem to have a lot of difficulty doing, that is, having a financial plan, a balanced budget, and at the same time, not pushing off the problems to the provinces as they did in the area of healthcare by cutting healthcare transfers. And this has had consequences today even, because there is no more hospital in the region I was talking about. The Liberals cut, and what is the corollary? We have seen an economic update. We see this morning. It's in the on the front pages of all the papers, and the figures are very important when it comes to the deficit. And if you talk about a deficit, well, when their spending party is over, we'll have to pay it back. And we've seen it in the past. We've seen the Liberals cut transfers, healthcare transfers to the provinces. And what did we see yesterday? We saw an increase in taxes Digital services will be taxed, so it's beginning. The government has spent so much that is what it is wondering how it's going to balance its budget. And it doesn't seem to be a concern because we haven't seen a budget target, no pandemic plan, no plan to manage public finances. The government is coming out with a plan for sustainable development and the environment, but in terms of sustainable development, there is the economy and the environment, and the two must be done in a sustainable way. And we see that presently the government is dragging us into a wall. And this is important. This is what's in the motion today. The risk is that they won't be able to honor their commitment because they will have put us on a financial trajectory that is quite dangerous. At present, not only is Canada have an unemployment rate that is among the highest in the G7, we are the only country that doesn't have an economic recovery plan. And why is that important? Well, in order to support our healthcare system and social transfers, we do need, Madam Speaker, to have an economy that is working well, and we don't have that right now. What is of concern is why are we in this situation? It's because the Liberals ultimately could have done things to take the pressure off the healthcare system. The best money we can invest is the money we don't spend. If we look at one of the government's responsibilities, it's to protect the border. In the beginning of the pandemic, we heard there was a problem in China, and they allowed 50,000 people from China to come here. And then, of course, we saw the result. The virus spread. At the same time, Madam Speaker, we did not properly communicate with customs, and people came back in the springs, and we saw the consequences this had, particularly on health in Quebec. This is a mismanagement, but it had repercussions on health. 16 tons of essential equipment was sent to China at the beginning of the pandemic, when just a few months later we were saying, well, wear the masks. Now we have to wear them. Even there are fashion designers that make them. There are many, but there was a time when it would have been very useful, and we know this is something that is quite effective. In conclusion, Madam Speaker, we will support the motion, but what we are asking the federal government is to act and to tell us when will we have the vaccine and help the provinces provide rapid testing, particularly the support that must be provided to the provinces in the management of the long-term care homes. And we will be here to ensure that we play our part as the federal government to support the healthcare system. But it requires budgetary targets, and we want to see the Liberal government put things back in order. Questions and comments? The Honourable Member for Argenteuil-Petite-Nation. Thank you, Madam Speaker. I want to thank my colleague for his speech. My colleague opposite says that he is in favor of the significant and sustainable increase. Is $42 billion in healthcare transfers, $200 billion for the next 10 years. The Conservative government also had set aside that money in the last year of its previous mandate. Crisis management is being done for the people of Canada and Quebec. Is it normal for the Conservatives to be concerned with budget, balancing the budget and the increase in healthcare transfers that are insufficient for them? The member for Bellechasse, Chemin-Lévis. Thank you. I see that he was listening carefully to my speech, and as a Conservative, we supported the measures to support people during the pandemic. However, there are measures that the government put in place because it did not consult Parliament. It prorogued the House, and it ensured that we could not be productive. Like me, I'm sure my colleague who was a restaurant owner had difficulty finding staff this summer because the government put in place poorly targeted measures, and there was an artificial shortage of workers, like the summer job program, which could have been improved to allow people to work this summer, and unfortunately, the government did not improve that amount of funding. So to respond to my colleague, Madam Speaker, what I want to say to him is this. The Liberal government has the responsibility. It's not the money that was invested before. It's starting now. How do we look forward? The money that we're injecting in the healthcare system, but also the measures that we can take to reduce pressure on the healthcare system. It requires a vaccination and rapid testing.
Strathcona.
Madam Speaker, and I'd like to thank the member for his comments. Je suis désolée, je parle anglais.
I'm sorry to have to speak English.
I will learn. My question is around the supports for our essential workers. We know how much they have done during this pandemic, how important they have been. But one of the problems that we're having in Alberta is our provincial government won't actually take the money that the federal government has allocated to top up wages for essential workers. And so knowing that there are provinces that are not willing to even take the funds, well, I think we're the only province, but I'm wondering if the member could speak about the impacts of provinces not working well with the federal government in this way.
The Honourable Member for Bellechasse, Les Échemins, Lévis.
For a question, and one certainly a vision that we have as conservative is we don't like the approach of Ottawa knows best. Actually, we believe that the expertise is in the provinces, just as it is in Quebec, in Ontario, or elsewhere in the country. And we feel that provinces are best placed, since it is a constitutional responsibility of taking care of health, that they are there to support the system, and they are facing many challenges, but we believe that provinces need to be strongly supported by the federal government in order to put the response to the first responder, so that they can be there for them. Merci.
The Honourable Member for Pitt Meadows, Maple Ridge.
Thank you very much, Madam Speaker. I'd like to thank the member for those comments. He spoke a lot about the lack of vaccines. We're a country with a Liberal government, and we're really behind. And it is very important. My question is this. Could he please elaborate with regard to the lack of the vaccines and the impact this would have on seniors' homes and on them and the general population? Thank you. The Honourable Member for Bellechasse, Les Échemins, Lévis. I want to thank my colleague for the question, my colleague from BC, with whom I sit on the Official Languages Committee. It is a pleasure to have a Francophile like him sit on the committee, and he is ensuring the vitality of the language communities across the country. This is the time when we're in a tunnel, the second half of the tunnel. As long as there is no vaccination, the tunnel gets longer. And Canada, like all other countries around the world, once we have access to the vaccine, this will allow us to get our head above the water and see the light at the end of the tunnel. That's why we're asking the government to provide us with a plan so we can know when we will have this vaccination in Canada. Resuming debate.
The Honourable Member for Kamloops, Thompson, Caribou.
Thank you, Madam Speaker. And certainly I want to thank my colleagues from the bloc for this very, very important motion today. And it's really quite fitting. It's December 1st. We know we're heading into the holiday season for many. And we also know that we are heading into some extraordinary challenges. So hopefully this measure of support from all parliamentarians will mean something and will matter. Of course, more importantly would be the action of getting rapid testing in place, getting vaccines in a quick and timely way, so that end of the tunnel is much shorter than longer. This motion is moved into three parts, and so I'll talk a little bit about each part of the motion. And so the first part, of course, is acknowledging the extraordinary work of the healthcare workers, and then it talks about the nurses, the doctors, the orderlies. I do want to actually note that there's many more who actually keep our healthcare system going. So I think, it is also extended our appreciation to the folks that are, doing the laundry, the folks that are doing the cleaning, the folks that are playing so many critical roles, working in the laboratories to keep our system going, and who are, again, also doing extraordinary work during extraordinary challenges. And it also talks about both seniors and the general public. So, we know in our homes that there's many challenges and some tragic outcomes in both from the first wave, and unfortunately we didn't learn from the first wave in terms of being as prepared as we should be for the second, but also the general public. Also, our public health care workers who are now overwhelmed with the testing, the contact tracing that has to be done, that in some provinces they've actually not able to do what they originally needed to do. So I think we have many healthcare workers, and I think it's not like a marathon where you know how far you need to go. They are having to put in these extraordinary efforts, and they don't know when the end point is, and it's certainly starting to take a toll on them. And so again, I think we do need to note the extraordinary work. We're also getting to a stage where there's very many difficult decisions that are having to be made. At the beginning, it was around how do we keep our PPE, and which were much limited in their resources. Canada likes to think that we're doing very, very well compared to our neighbors in the U.S., but there was some recent work done by a healthcare institute out of Washington who thinks that by mid-December, Canada's per capita numbers are actually going to be worse than the United States. So, I'm not sure that we can be as proud of how we've responded to this crisis as when we compare it to the U.S. and we were looking at the numbers, and now we're actually not looking near as good. We just read yesterday in Alberta, people sort of see the oxygen that comes from the wall in hospitals, and they believe it's unlimited, but there was a memo that went out, and it's talking about having to start to be very conscientious about how you use the oxygen because it's in limited resources. So originally, we had a lot of conversation about ventilators, but I don't think there was much in terms of the oxygen that's available. The ICU capacity, again, as we are hitting these extraordinary numbers in December, there might be in some provinces, in some hospitals, some very challenging issues that people have to deal with. The second part of the motion recognizes the courage and the sacrifice of the from the frontline workers and their families. And, I am a former nurse. I've mentioned that before in this house, but I have both, friends, colleagues, and family members who are still involved in the healthcare profession. So I'll just give you one personal example of some of the challenges that our healthcare workers are facing. I have a son that works up north, and he's a nurse, and he does medical evacuations. And he just headed up north today, and for the next 5 weeks, unless he is involved in an emergency, he has to stay in isolation. So he's up north where it's dark all day. He's not allowed to leave the house because, of course, they need to protect the workers or the communities that he goes into. So goes into communities, but when he's not working on call, we'll spend 5 weeks sitting in a house waiting for calls. And of course, we all know that intranet is not even a resource that's easily available up north. His wife will be working through the Christmas holidays, and not only dealing with or his girlfriend, the extraordinary challenges of working in an emerge, working in an ICU in a small community, and having your friends and family that come in. Up in 100 Mile House, we have workers who want to protect their families. And so what they have been doing is they've been staying in hotels so that they're not going home. They don't have rapid testing in a way that they need. And so what they're not wanting to expose their grandmothers, their parents, their children. And so they're spending many, many nights in hotels. And then, of course, who has not read or seen the stories of nurses holding up FaceTime so family members can say goodbye, doctors phoning, patients having someone with fully masked and gowned and having to say their goodbyes and hold their hands. It's extremely, extremely challenging, and truly, when Canadians are asked just to stay home and to wear a mask, that's what we need to do. We need to wear masks. And you know what? Even if it only protects a little bit, it is not a big deal to put on a mask when you're going into into stores, when you're in public areas. So quite frankly, you look at what healthcare workers have to deal with, what they have to wear, and to ask Canadians to wear a mask, to me, is certainly not too big a deal. So, finally, it talks about the work of the provinces, and of course the provinces are responsible for healthcare, and they need to have sustainable funding, long-term resources. One thing I want to note from the economic fiscal update from yesterday that is a concern, the $1 billion for long-term care, I'm sure is going to be welcomed by many of the provinces. But that money would have been much more appropriate to have been between the first wave and the second wave. What they would have been able to do is they could have done improvements, infection control measures, some capital investments. So really, $1 billion, important. It will be welcome. But is it not a little bit late? We could have used that money. So the government is typically behind the 8 ball. $1 billion should have been between the first and second wave. Vaccines, they should have actually, instead of that partnership with China, who has not been a reliable partner for many, many years, they could have been looking outside of China. We know the failure of that particular partnership. And of course, we now know that Canada is going to be behind many, many other countries in terms of when we're going to have the vaccine. The rapid testing issue, and it's not a perfect answer, but it's a tool in the toolbox. And so again, our healthcare workers, why can't they maybe have a rapid test and then the policies reflect the results of the tests? It's not perfect, but it's certainly a solution to make their lives more livable right now. So, Madam Speaker, I think everyone in this Parliament hopefully is going to support this motion, is going to recognize both the extraordinary work, the extraordinary courage, but more importantly, we have a job to do, and what our job is to get that vaccine and really be prepared. And to be frank, this government, I think, has failed Canadians in many ways in terms of their approach, whether it was the global or health surveillance system, whether it was telling Canadians it was low risk for too long, whether it was refusing to close the borders, whether it was being slow with rapid testing, not even considering home testing until recently, or whether it's been vaccine deployment. Our numbers are starting to look very, very challenging, and we need to move forward for the sake of our healthcare workers and for the sake of Canadians. Thank you, Madam Speaker.
Commentaire. L'honorable député de Longueuil-Saint-Hubert.
The honourable member for Laurier-Saint-Hubert. Our Liberal colleagues' opposite since the start of this is that healthcare is provincial. Now, what we're calling for are healthcare transfers. During the campaign since the start of the pandemic, we've called for two things from the federal government. Two simple things: to close down the borders, get it and buy a vaccine when it's available. 9 of them have been achieved. Now we're calling for healthcare transfers. This is simple because it's provincial jurisdiction. All provincial premiers in Canada agree with the federal government sending money to the provinces to help weather the crisis. My question for my colleague from the Conservative Party is simple. In the event that there were an election tomorrow morning and the Conservative Party were to win, the deficit for health is something that was built up. It didn't just miraculously appear over the past month. The deficit in healthcare transfers has been there for years, for decades. So does my Conservative colleague agree that it would be important to do what the premiers are calling for and to increase funding from the federal government to the provinces as part of the healthcare transfer up to 35% from 22?
Thank you, Madam Speaker. And certainly our party has always believed in long-term sustainable funding to the provinces and also not interfering in provincial jurisdiction. What the needs are in Quebec versus the needs in Prince Edward Island versus Newfoundland versus British Columbia. We believe that it is the provinces, both constitutionally and in practice, who are best set to deliver health care. And, certainly if I look at the current federal government government's record, if they can't manage to plant any trees when they committed to $2 billion, them sort of getting into the jurisdiction of provinces would certainly end up in a disaster.
The Honourable Parliamentary Secretary to the Leader of the Government.
Yes, thank you, Madam Speaker. In many different ways, I disagree with a number of the comments that the member has put on the record. Whether it's the vaccination, and I believe that the government has done an excellent job in working and listening to experts and listening to the Vaccination Advisory Committee, working with provinces and other stakeholders to ensure that Canadians' interests are, in fact, going to be taken care of when the time is right and we're receiving the vaccines. The question I have for my friend is that there is widespread, I believe, definitely in Winnipeg North, I can assure the member of that, support for a federal government that understands the importance of the Canada Health Act, and to recognize that the federal government does have a role to play. And if we take a look at the monies that we've invested, even in recently, whether it's for mental health, home care services, and so much more, does the member not recognize that many of her constituents would want to see a presence at the health care that goes beyond just handing over a bunch of cash?
For Kamloops, Thompson, Caribou.
First I want to start with the preamble to that question. And the preamble is, they talk about vaccines. It is true that they spent their eggs in the basket of China. Procuring multiple doses per Canadians is important, and Health Canada approval is important, but what's the most important is when we are going to see vaccinations into people's arms. And again, I need to compare that with Australia, where you can look at a plan that is clear, that is transparent. I went last night to look at Canada's plan, and I went to look at Australia's plan. No plan for Canada. Australia, it was simple, it was easy. That's all Canadians are asking for, is a transparent view of how we're going to get to the end of the tunnel.
One last question, the Honourable Member for South Okanagan, West Kootenay.
Thank you, Madam Speaker, and I'd like to thank my colleague from Kamloops, Thompson Caribou, for her speech. She rightly, I think, highlighted some of the tragedy that has unfolded in our long-term care homes. And just quickly, I'd like to ask her through you, Madam Speaker, would she support the NDP's proposal to bring long-term care into the Canada Health Act so that the provinces would have a proper funding source to maintain those homes, to care for our seniors in a proper way, because now they have standards, but they don't have the funding to meet those standards of care?
The Honourable Member for Kamloops, Thompson Caribou, 10 seconds.
The biggest tragedy is that $1 billion that is for later, as opposed to not between the first and second wave. That money could have been well used by the provinces in terms of preparing for the second wave, training their staff, infection control measures, capital improvements, and so.
Resuming debate, the Honourable Member for Rosemont La Petite Patrie. Thank you, Madam Speaker. I'd like to start by saying that I'll be sharing my time with my colleague, the member for Vancouver Kingsway. Madam Speaker, I was quite pleased to hear the last colleague from the Conservative Party who, in her remarks, talked about what was at the heart of the motion, because in other speeches, the subject matter has been strayed from a bit. Now, we're here to talk about healthcare workers for 9 months now, have been working diligently, tirelessly to take care of us, to try to save lives, to save the situation. They get up every day, sometimes at night, sometimes in the evening, to be there treating people with COVID. They are making incredible sacrifices, and they're there for us. Madam Speaker, I think that as parliamentarians, we must ask ourselves if we're there for them. Have the past Conservative and Liberal governments been there for healthcare professionals, for workers in our healthcare system? And I'd like to come back to that because that is a fundamental issue where the federal government has a role to play. Now, these workers are people who are on the front lines, who literally place their own health in jeopardy. They're the ones who are caring for people who are sick with COVID. They can catch the virus, get sick, pass it on to their spouses, their families, and we've seen that happen in the past. I'd like to take a moment to draw our attention to a very specific category of these workers. The ones we referred to as our guardian angels are a group of asylum seekers and refugees who voluntarily signed up to work in long-term care facilities and clinics and hospitals to help care for people. There are lots of stories of these asylum seekers, Madam Speaker, who fell ill, who took the virus home to their families, whose spouses have died from it. There are cases like that that are absolutely heartbreaking. And we worked very hard to help them achieve their status of permanent residency. This work has been done, but the program was announced last August, Madam Speaker, yet today nothing has been done. There seems to be a blockage somewhere. We want it to cover all essential workers in healthcare, in pharmacies, in grocery stores, but people in hospitals who are working in the kitchens, in the cleaning, in other areas. And the program needs to be in place. Now, yesterday, something very serious happened. It was a day of the economic update. The Canadian Border Services Agency announced suddenly that they were going to be resuming removals and deportations. So that means there are people who we promised or implied that they would be obtaining a status. They might well now be deported when they came here and helped us in our long-term care facilities, in our hospitals, and that is shameful. Madam Speaker, during a pandemic, we should never deport anyone, especially not those who came here to help us. Having said that, going back to the healthcare workers and professionals, have we done enough to support them? I think that we gave them work conditions that were absolutely deplorable. When you look at salaries made by orderlies, for example, nurses, the amount of work they've been asked to do, the overtime hours. We didn't create a situation which would attract people to those professions. And what we've seen during the pandemic is a shortage of staff. If the provinces, if the Quebec government, for example, had had the means to treat those people better, perhaps we would have had fewer problems retaining staff. And it would have been perhaps easier to attract people. If the working conditions are difficult and you're earning $12 or $13 an hour, well, not many people want to do the work. The provinces were unable to provide good working conditions, and that, Madam Speaker, is because of the cuts to health care transfers to the provinces, in part. And that's a area of shared jurisdiction, or shared responsibility, rather, by the Liberals and the Conservatives in the past. Now, I asked a question of the member for Laurier-Sainte-Marie about the issue. Now, since the Conservatives under Stephen Harper, healthcare transfers, which were going up 6% per year, were cut to 3% per year. So there was a $36 billion shortfall that the province faced over a 10-year period. Despite all of their lovely promises by the Prime Minister of the day, they renewed the same agreement with 3% increases per year. My colleague, the member for Vancouver Kingsway, pointed out earlier today, the real cost in the healthcare system is 5.4% per year. So the numbers aren't compatible. It's not sustainable or viable. We need to give provinces the capacity to provide services to their citizens. It's the federal government's responsibility to increase transfer payments. It's essential, and we cannot afford to not do that. Otherwise, we will not be living up to the support we should be providing frontline workers. There needs to be an increase in transfer payments. Now, Madam Speaker, you're going to say 6% per year for the public purse is perhaps not sustainable. So what do? Well, this is where the NDP has proposals that are unique, attractive, and we said, well, what about the crazy idea of going to get the money where it is? There are some people who have so much money they don't know what to do with it. Now, we're the only party saying that we could have perhaps a wealth tax. So people who have more than $20 million in assets could contribute a little 1% surtax per year, for example. That's not too much, 1%. And that way we would bring in several $100 million, if not $1 billion. A welcome wealth tax, then why not? Those people can easily afford it. There are also some companies that have made disproportionate profits during the pandemic. Why not, perhaps temporarily, have a special tax on excessive and profits made by companies that line their pockets? Like web giants, Netflix, Amazon, the profits have exploded. So, an anecdote, if I may, about Amazon, Madam Speaker. Oxfam recently pointed out that if Jeff Bezos gave a $105,000 bonus to each employee, he would still be as rich today as he was before the pandemic. So that shows how much some companies have made since the start of the pandemic. And what the NDP is saying is that we could have them contribute. Now, I'll wrap up on another important point. I was very disappointed in the economic statement yesterday when it comes to the approach for web giants. The government has said that it's going to make them pay the GST. Well, that's a good thing. We've been calling for that. And it's only fair. But charging GST means charging it to consumers. So the end users are the ones who are going to be paying the GST. Well, that's fair, but it doesn't cost anything for the web giants because the users and the subscribers are the ones paying for it. So this isn't going to happen in January either. It's 13 months down the road. So they've got another 1-year break to where they won't have to pay taxes to Canada. And we don't even know if they're going to pay taxes here because the Minister of Finance has said if necessary. So they haven't paid taxes for years in Canada. It's an absolute scandal.
This Liberal government claims it's helping, but it's not doing anything. We in the NDP are taking this seriously. We need to go get that tax revenue. We need to fund health transfers, and we need to take care of those who are taking care of our seniors and those most vulnerable. I take my hat off to them, and I think we need to do better. And with the NDP government, we will do better. The Honourable Member for Argenteuil-La-Petite-Nation. Thank you very much, Madam Speaker. I'd like to thank my colleague for his speech. My colleague asked, not once, not twice, but 3 times, if, whether as a government, as parliamentarians, we've responded appropriately to Canadians' needs during this crisis. My colleague knows very well that Canadians are generally very satisfied with the management of this crisis. Since the 11th of March, we have been responding to this pandemic. Does my colleague agree that since the 11th of March, without any kind of roadmap for this unprecedented pandemic, we've done right by our workers, our industries, our businesses, our youth, our workers, and everyone who's been having trouble during this pandemic, Madam Speaker? Thank you. The Honourable Member for Rosemont-la-Petite-Patrie. Thank you, Madam Speaker. I'd like to thank my colleague for his question. Some measures have been quite good. And generally, that's been because the NDP has pushed the government to get these measures in place. There wouldn't have been a 75% wage subsidy without the NDP. There wouldn't have been a $2,000 a month CERB without the NDP. Freelance workers wouldn't have been included without the NDP. There wouldn't have been a student benefits without the NDP. But what we have to see now is whether all those measures are going to end in June without any kind of future system in mind, without knowing what the health system is, and this health crisis is going to be at, where it's going to be at that point. The government needs to make a plan and keep helping people. Questions and comments?
The Honourable Parliamentary Secretary.
Yes, thank you, Madam Speaker. I'm wondering if the member could just expand upon how the New Democratic Party talks a great deal about it would support a national pharmacare program. It talks a great deal about home care services and the potential federal government involvement. And I'm wondering if the member could just provide his further thoughts in regards to the importance of the Canada Health Act and what role that plays in society today from his perspective.
The Honourable
Member for Rosemont-la-Petite-Patrie. Thank you, Madam Speaker. Well, you know, when the Liberals promised child care for the first time, I was 20 years old. Now my daughter is 20 years old. The first time they promised pharmacare, I was 24 years old. I'm not going to say what my age is now, but I will say that it was a long time ago. Yes, we favor a public universal pharmacare system. As all Quebec unions, as well as the Quebec Consumers Association are asking, it would save a lot of money, and it's an excellent idea, and the NDP has been asking for that for a long time. All of that, of course, in the context of a constructive dialogue between the federal and provincial governments. We need more than words. We need action. Questions and comments?
The Honourable Member for Edmonton Strathcona.
And I'd like to thank my colleague for his comments today. He is a strong voice in our caucus. He is a leader representing the people of Quebec, certainly in this House. My question today that I have for him is in terms of long-term care. So we have seen critical conditions, devastating conditions across the country in terms of long-term care, and we have seen too little action happening from the Liberal government. Could he share with us his thoughts on the NDP platform on long-term care and what we would like to see that would make sure that our seniors are taken care of and are protected as we head into the second and potentially the third wave?
The Honourable Député de Rosemont-la-Petite-Patrie.
The Honourable Member for Rosemont-la-Petite-Patrie. Thank you, Madam Speaker. I'd like to thank my colleague for Edmonton Strathcona for her important question. And I think that collectively we need to have objectives for quality of care for our seniors. There's a lot of work to be done, as well as the matter of transfers, to assist the provinces and help them get through this crisis. What happened in our long-term care centers was horrifying. We don't want that to be repeated. But the NDP is the only party that is saying that private sector companies shouldn't be involved in long-term care, in healthcare in general, but most importantly, senior care. We saw that with a private long-term care center in Dorval, where the situation was a horrifying nightmare. So ultimately, we shouldn't be using our credit card to get healthcare. It should be a universal right, and we should work together to be able to meet those high quality standards while respecting our seniors who have worked so hard throughout their lives. It's the minimum, the very least that they deserve.
For Vancouver Kingsway.
Thank you, Madam Speaker. I am so pleased to stand in the House today to speak to this important motion that I think is so timely and so needed right now in our country. This motion does a number of, I think, critically important and profoundly worthy things. It has us acknowledge the extraordinary work of healthcare workers, including doctors, nurses, and all allied health professionals and workers during the COVID-19 pandemic. It calls on us to recognize the courage and sacrifices that have been required from all frontline healthcare workers and their families as they tend to the very important health services that so many of us are counting on. It highlights the work of all of the provinces in respect to the health crisis. And it calls on this government, the federal government, to significantly and sustainably increase Canada health transfers starting before the end of this year. Now, I want to begin by acknowledging the extraordinary work and sacrifice of healthcare workers in British Columbia. I'd like to start with the top doctor in British Columbia, Dr. Bonnie Henry, BC's Provincial Health Officer, Dr. Henry, has been widely praised, frankly, around the globe for her response to the COVID-19 outbreak leadership. In particular, she's been recognized for her ability to convey complicated health information in a clear way that doesn't talk down to people. Under Dr. Henry's direction, BC has led the way in implementing a testing strategy, physical distancing, and control measures at long-term care facilities faster than every other province in this country. Dr. Henry's leadership, expertise, and genuine care about the safety of British Columbians have also instilled a sense of trust that has helped foster public cooperation throughout the pandemic, something that I think is critically important at this time. When Dr. Henry declared an official health emergency on March 17, she ended her initial statement with a phrase that has been heard countless times throughout BC since. This is our time to be kind, to be calm, and to be safe. Now, under Dr. Henry's leadership, of course, are the tens of thousands, perhaps the hundreds of thousands of healthcare workers and their families who have done so much to keep Canadians and British Columbians safe. In British Columbia, I want to particularly highlight the work of the healthcare unions as well, who have played such a leadership role during this crisis. Now, nationally, according to the Canadian Institute for Health Information, 19.4%, almost 1 in 5, of those infected with COVID-19 in Canada as of July 23rd were healthcare workers. This was twice the global average. According to the BC Nurses Union, 40% of nurses are reporting serious depression and 60% are on track to have post-traumatic stress disorder. According to Christine Sorensen, the president of BCNU, she says our nurses are not healthy right now. They are overtaxed. They're emotionally distressed, trying to manage all of the personal and professional implications of COVID that all of us are managing. Plus, they need to go to work and be exposed daily to COVID. Now, by the way, I believe that that description of the stress and danger that are affecting nurses in British Columbia is true across this country in every province and territory, in every community. Dr. Kathleen Ross, president of Doctors of BC, says that physician burnout was an issue before the pandemic and it's gotten much worse. She says we need to continue to recognize as we head into the second wave that many of us are still recovering from the first wave. The pandemic has required all frontline providers, including physicians, to step up to the plate and access our surge capacity, that ability to step forward and work harder. Now, it's not just health professionals shouldering the burden, Madam Speaker. Critical frontline health sector workers like personal support workers, cleaning crews, and maintenance workers, administrative staff have made tremendous sacrifices to keep the healthcare system operational throughout the COVID-19 pandemic. Now, I want to recognize in particular care aides, not only in long-term care centers, but in our hospitals. These workers do incredibly important work. They take care of our loved ones at their most vulnerable. This is skilled work. This is compassionate work. This is difficult work. And it's also underpaid and undervalued work. I want to, at this point, single out the particular strong and early recognition of these facts by the British Columbia NDP government, and under the tutelage and leadership of, I think, the best provincial health minister in the country, Adrian Dix. What did the British Columbia government do early on? Well, they were the first province in the country to ban the practice of care aides shuffling between care homes, sometimes having 2 to 3 part-time jobs, and of course, not only this being very difficult on them to raise their families with no benefits and the difficulty and precarity of that situation, but also them being vectors of transmission. Backing up this move with money, the British Columbia NDP government poured $10 million per month to raise the wages of care aides so that they could create full-time jobs, so that they could, this is not only better for workers, but better for patients, so that workers could actually have full-time jobs with benefits in one single place and give the kind of care that that their residents needed, and also them, the workers, the security that they needed. The BC NDP government tore up the Liberal legislation that created the crisis in the first place. This was called Bill 29, which was passed in 2002 by a provincial Liberal government in British Columbia that attacked healthcare collective agreements and unions. Plus, the BC NDP government added more care hours, fewer shared rooms for seniors, more nonprofit ownership of long-term care centres, and more inspections of long-term care homes. This is the kind of work and leadership done by a provincial government, a New Democrat government, that actually puts a priority on health care. On March 23, 2020, the BC government also approved a $5 billion pandemic contingencies allocation to support its response to the COVID-19 pandemic. This funding has supported a number of initiatives to hire contact tracers, to provide additional funding for long-term care facilities, to support mental health initiatives, to increase funding for long-term care, and to, as I said earlier, provide more care hours for residents, have fewer shared rooms, and have more nonprofit facility ownership in the long-term care sector. These were initiatives done by the province of British Columbia starting last spring. This federal government has yet to actually act on those very important measures. I was disappointed to see in the economic statement yesterday that we're still waiting for national guidelines on long-term care homes. Now, this motion also calls on this government to significantly and sustainably increase Canada health transfers before the end of 2020. Now, when Medicare was first established in Canada, the federal government agreed to assume 50% of the costs incurred by provinces and territories. At a First Ministers' meeting in 1976, Prime Minister Pierre Trudeau proposed replacing the 50-50 cost sharing with a new regime of block grants that exposed the provinces and territories to unilateral federal cuts over the subsequent decades, which successive Liberal and Conservative governments in fact did. Today, the federal share of overall healthcare spending in Canada has plummeted from that original 50-50 share to approximately 22% today. Now, seeking re-election in 2011, Stephen Harper pledged to negotiate a health accord with the provinces and territories. However, no negotiations ensued. Instead, Finance Minister Jim Flaherty announced that when the 2004 accord expired in 2014, the Canada Health Transfer escalator would remain at 6% until 2017 and then grow for the next decade no higher than 3%. The Liberals under this government promised to address that, and instead they adopted the Harper cuts. Now, the impact of that, Madam Speaker, is clear. Healthcare costs in this country are rising at an average of 5.4% per year. If the federal government is increasing spending at 3%, clearly that's a recipe for long-term fiscal problems and cuts. Now that we have the COVID-19 pandemic, the Conference Board of Canada estimates that total healthcare expenditures will actually rise between 6.5 and 8.4%. So today, Madam Speaker, it's more important than ever. It's time for this federal government to put its money where its mouth is, to reverse the long-term slide of federal funding and healthcare transfers, start getting it back up towards the 50% so that we can bring pharmacare, dental care, long-term care, mental health care, eye and ear care coverage for every Canadian in this country.
Questions et commentaires, questions and comments. The Honourable Parliamentary Secretary.
Nice, thank you, Madam Speaker. And I can understand and appreciate a number of the comments that my colleague has made. And for me, I take a look at it in terms of what we have seen over the last number of years, whether it's record amounts of health transfers to provinces. In this year of the pandemic, we have seen hundreds of millions of allocated tax dollars from Ottawa going to the provinces, with emphasis on issues such as mental health, home care services. We've seen a commitment, an ongoing commitment, and I know the NDP like to say, well, it's been 20 years, 25 years. This government has been in office since 2015 towards the establishment of a national pharmacare program. And my question is that he talked a great deal about what's happening in BC, Madam Speaker, with the NDP and their progressive attitudes towards health care. Does he know if the province of British Columbia, because I'm sure the member agrees with me, the best way to have a truly national program is to have the support of provinces. And where does the province of BC stand on a national healthcare, a national pharmacare program?
Honourable member for Vancouver Kingsway.
Thank you, Honourable colleague, for that question. I would point out that the Liberals have been in power for 18 years since 1993, 16 of that in majority government. So they've had lots of time to address these structural problems. I want to just quote from a letter that was written yesterday by the President of Canada's Medical Association, Dr. Ann Collins. She says, "I share my deep concern about the state of Canada's health systems, which were stressed before the pandemic and now have reached a critical tipping point. Many of my physician colleagues are exhausted, facing burnout. They're under immense pressure while they tackle the second wave of this pandemic. Today's federal economic update should have offered healthcare providers hope of relief and a glimpse of the federal leadership required to keep our health system afloat, but instead it fell short. The reality is that our healthcare system is on the verge of crumbling." Madam Speaker, this is what the head of Canada's doctors are saying. Pharmacare, to answer my honourable colleague's direct question, is something that all provinces will join if the federal government puts sufficient money on the table and plays a leadership role so that we can expand pharmaceutical coverage to be the exact same as any other medical service, from hip replacement to cataract surgery to broken arms. It's long overdue, and this government should play a leadership role like they continue to say they want in every throne speech but fail to act.
Questions et commentaires. The honourable member for Edmonton Strathcona.
Thank you, Madam Speaker, and I would like to thank my colleague for his excellent intervention this afternoon. One of my questions is around the Canada Health Act, and I know that my colleague is extremely knowledgeable about the Canada Health Act. When the transfer payments to provinces become so low like they are now, and increasingly get lower and lower and lower as we go forward, how does that impact our ability to ensure that Canadians across the country can access the same level of care, and that different provincial jurisdictions don't privatize some services and don't chip away at that very cherished public, universally accessible system that we have in Canada?
The honourable member for Vancouver Kingsway.
Well, I'd like to thank my honourable colleague from Edmonton Strathcona and thank her for her excellent work in standing up for a strong public healthcare system in the face of, in her own province of Alberta, a Conservative premier who's attacking the very notion of public health care and actually floating the idea of privatizing parts of our system. Canadians value and cherish our public health care system. They know how important it is that every Canadian can get access to the medical care they need, regardless of their wealth or their social status. It's something of which Canadians are most proud. And of course, to make it work, we need a strong federal government as an equal partner at the table who is meeting its fiscal obligations and also enforcing the Canada Health Act, which has 5 principles that we count on for the federal government to make sure that any province that's violating those principles is immediately addressed. And frankly, I've seen successive federal governments, both Conservative and Liberal, fail on that front. We have privatized MRI services in Saskatchewan, private surgical ideas floated in Alberta. We have the New Brunswick government failing to make sure women have access to reproductive health services. We need the federal government to get back in the game, to exercise its jurisdiction, fund the healthcare system properly, so that Canadians can not only have the healthcare system they're used to, but we can expand our healthcare system to make it more comprehensive and deliver healthcare in the most efficient way, because we know public healthcare is the best, most efficient way to deliver.
Reprise du débat.
Resuming debate, the honourable member for Joliette. Thank you, Madam Speaker. First of all, I will advise you that I will be sharing my time with my esteemed colleague from Thérèse de Blainville. It will be a very interesting speech, of course. Madam Speaker, the motion that the Bloc has introduced today seeks to say a huge thank you, first of all. Thank you to the workers, mainly women, who are on the front lines during a pandemic. And they're working in our healthcare system, be it hospitals, long-term care homes, anywhere else. The conditions are very difficult. There is great insecurity. People are being told at the last minute, well, you're going to have to work a second shift. We don't have enough staff. And you will have to work directly and be directly exposed to COVID-19. all of the insecurities that these people have, may they consider whether they'll be infected by COVID. Will they infect their families? We raise our hats to them and we say from the bottom of our hearts, thank you very much. You are making a real difference. What the pandemic, which is a drama that we're living through, has shown us is that our healthcare system is fragile. Our healthcare system has been made fragile by decades of underinvestments by Ottawa, no matter what party was in government. But it's always been the same way of underfunding, of funding less and less. This has threatened the healthcare system. And there is a lack of resources, particularly in the long-term care homes. And this explains to a great extent the drama that has occurred during the pandemic there, particularly in the long-term care homes, as I mentioned. In downtown Joliette, the long-term care home of Saint-Eusèbe had very difficult times. And we want to thank the workers who are on the front lines and who are making a difference. Mr. Speaker, I have no words to describe the government's attitude, the attitude we see here in this House. And it is an attitude of some arrogance and contempt for the provinces in Quebec by saying, well, if things are going badly, it's your own fault. You did not do your job, so we would have done better. So we will continue to centralize and take responsibilities and powers away from you, all at a time when the federal government's own roles and responsibilities have been poorly dealt with. We can think about vaccinations. It's very poorly managed compared to others. We'll have to talk about the border controls. At the beginning of the pandemic, there was none. And an economic update. And we're being told that these interferences in areas of provincial jurisdiction will continue. At the same time, there is no more funding in healthcare. I was expecting the economic update to tell us that there would be a serious catch-up, that we would finally find out after 25 years Ottawa has been withdrawing and not doing its fair share, and that we would catch up. But what we had was a promise of $1 billion for long-term care homes when the deficit is now $382 million. So 1/400th, if you will. And imposition of standards. That's the Minister of Health. No later than last week, in the speech given in Committee of the Whole in the House one evening, came and said, we will impose our standards in long-term care homes, pan-Canadian standards, as if this is what was missing in healthcare centers and long-term care homes was additional standards. I would remind you, Mr. Speaker, that we know with the first wave and the crisis that did occur in the long-term care homes, there were the soldiers who had been deployed. And there was a report, and in the report by the Canadian Armed Forces, following their time in the long-term care homes in Quebec last spring, they said that there are many standards in place and rules. That's not the problem. It was the lack of resources. Why a lack of resources? Well, because the healthcare system was weakened. And why was it weakened? Because Ottawa said, and has said for the past 25 years, well, how are we going to resolve the deficit? Well, we're going to cut funding to healthcare. And too bad people can go and complain to Quebec and provincial governments. Jean Chrétien said that at a G7 meeting. And a counterpart said, well, we'll impose austerity measures. And there were lots of demonstrations in front of Parliament. And Chrétien said, I don't have that problem. I'm cutting funding to the provinces, and people will demonstrate in front of the National Assembly in the different provinces. And he laughed about that, except that essential services were cut. The healthcare agreement, originally until the end of the 70s, was half of healthcare expenditures would be funded by Ottawa. This was a very logical criteria. When taxpayers pay their taxes, they pay approximately half to Quebec and the provinces and the other half to Ottawa. So it's normal for healthcare to be funded from half of each. To resolve the deficit, Ottawa said, well, we're not going to do this anymore, and now it's gone down, and now we're at 22 or 21.2%. It's not enough, and the fiscal capacity, the surplus and flexibility is here in Ottawa. Ottawa uses this flexibility or this margin to invest in programs that make it look or give it better visibility, and it tells the province or the people that our concerns is healthcare. Ottawa is refusing to give the money to the provinces, no matter what party is in power. It's contemptible. Mr. Speaker, in the economic update we heard yesterday, the government is bragging and saying during the pandemic, for every $10 that was injected into the pandemic to get out of the crisis, there were 8 of the $10. 80%, therefore, of the effort is coming from the federal government. And it's really patting itself on the back for that. But what it doesn't remember is that this will go into the debt. So ultimately, it will be the taxpayers who will have to pay it back. And what it's also not saying, and this is what I find particularly insulting, is that in healthcare, it's exactly the opposite. Ottawa provides barely 20% of the funding for healthcare. So it has flexibility, and now it's saying how great we are, how great we handled the pandemic. But the margin is here. The needs are in the healthcare system. Our workers are making miracles happen in difficult conditions, and to make up for this. And this government has an attitude of saying, we're going to show you what's good. We know what's good. And it shows contempt for Quebec, contempt for the provinces. This is unacceptable. It has to change. I expected it to change in the economic update, but obviously there was a surprise. Perhaps it will change on December 10th, where there will be a meeting with the provincial premiers. It was announced today that this meeting would be held on December 10th. We've almost finished a sitting, so we won't be able to question the government about that meeting. But I hope that there will be a serious catch-up that will occur. Earlier this morning, the Minister of Finance in Quebec commented on the economic update from yesterday, and obviously he said to what extent he was disappointed when Ottawa has imposed standards on the provinces. He finds it quite unacceptable. It does not show respect for areas of jurisdiction. It has to change for the December 10th meeting. This is an opportunity. It should not be a missed opportunity. Even the Prime Minister said that he'd already done quite a bit for healthcare. In his mind, the provinces are funded sufficiently in the area of healthcare. The Minister of Intergovernmental Affairs tweeted that in any case there would be many other subjects that would be addressed during the meeting to dilute the importance of healthcare funding as an issue. And what Ottawa will do, as usual, is to say we'll start with the provinces. When the provinces are in financial difficulty, well, there are some that will agree and to lower their standards. And Quebec will be weakened and the healthcare system will be underfunded. It's time for that to change. Thank you, Mr. Speaker. Questions and comments. The Honourable Parliamentary Secretary to the Minister of Seniors. Seniors, yes. Thank you, Mr. Speaker. I want to thank my colleague for his speech. My colleague opposite stressed a great deal the measures that our government has taken during the pandemic and has criticized us and found it insulting that the Canadian government has put 8 out of 10, every $10 invested in the pandemic. My colleague tell us that if these people in his riding are opposed to the measures taken by the government that we invested in during the pandemic to save people's lives, to save seniors, to save people's homes. The Honourable Member for Joliette. Thank you, Mr. Speaker. First of all, saving seniors when We're talking about them getting an extra 61 cents that's taxable. That's not acceptable at all. Not at all. The Parliamentary Secretary to Seniors, Mr. Speaker, asked his question, and now I have the time to answer. I don't agree with the Minister, and I would explain to him if he would let me respond. It's not the fact that the government spent during the pandemic, but rather that it's boasting and saying, we're better than the provinces. It has this arrogant attitude towards the provinces. Why? This fiscal capacity and flexibility is here because they cut healthcare transfers. The Liberal government did it in the 80s. And this has put pressure on the healthcare system. During the current pandemic, we see how fragile the system is. And they should take this opportunity during the pandemic to correct the situation and improve the healthcare system. Thank you, Mr. Speaker. Questions and comments? By video conference, the honourable member for Hamilton Mountain.
Thank you, Mr. Speaker, and I appreciate my friend's intervention on this. Well, I guess my question becomes: is what I've been hearing lately on this is that healthcare is a provincial jurisdiction. We do the administration, but we need more federal funding, which I agree. But on some of those provincial jurisdiction, I'm going to take the long-term care, and we found out that they had atrocious conditions, and this wasn't done by COVID-19. This was exposed by COVID-19. So does my friend feel that more money should be coming with more federal standards to make sure that our seniors have the proper health care and the dignity they should have, and not just privatization where money goes into the pockets of the privatized people, and should all this stuff go with public health care?
The honourable member for Joliette. Thank you, Mr. Speaker. I want to thank my colleague for his question. It doesn't take more federal standards for the long-term care homes. People are saying what is missing are resources, funding. Standards are there. They report from the military. The military served in the long-term care homes in the spring, and they said in the report that there were enough standards. Some people have said that having pan-Canadian standards would resolve everything, but this is not true. The Constitution is clear, Mr. Speaker. Healthcare is an exclusive jurisdiction of Quebec and the provinces, except when it comes to military hospitals, Aboriginal health, supply of drugs, and quarantine. Ottawa plays a role in funding healthcare, and the provinces which have the expertise are responsible for managing the healthcare system, including long-term care homes. We have the time for a very brief question and response. The honourable member for Laurentides-Labelle. Thank you very much, Mr. Speaker. I will be very brief. In fact, I'd like to ask my colleague, when I go back to my riding in Laurentides-Labelle, what should I say to my constituents when, after all of the provinces that have been asking for healthcare transfers to increase, what is it going to take for the government to understand? Not only is it urgent, but it has to be done now. The honourable member for Joliette. Thank you, Mr. Speaker. Before the throne speech, the provinces got together and asked together for Ottawa to fund more than 21% of the healthcare transfers. And it's not even a sentence in the economic update. And my esteemed colleague from Laurentides-Labelle could tell her colleagues that on December 10th, the premiers of the provinces and our Premier Legault is going to meet with the Prime Minister. And they can ask, will Ottawa fix the mistake of the last 25 years and fund health care? This is something we need to follow up. We are here to put pressure and to respond to the concerns of our constituents. Thank you, Mr. Speaker. Resuming debate. The honourable member for Thérèse de Blainville. Thank you very much, Mr. Speaker. In introducing our motion, I was proud because I said that our motion ultimately is that we must consider others. It is well-meaning and it ensures recognition. And I would say, who in this House, as a parliamentarian, could be opposed to this? It's well-intentioned and it recognizes the staff in healthcare, our healthcare workers in all our healthcare centers, and also because it recognized the courage and the sacrifice of these workers, but also because it highlights the work done by Quebec and the provinces to respond to the pandemic, an unprecedented crisis. And it's very important to notice the direct impact on their budgets. So it's quite opposite than pointing fingers and talking about mismanaging a crisis. What the fourth part of this motion asks is that once and for all, the government should recognize that the governments of Quebec and the provinces have full jurisdiction over the provision of healthcare and healthcare services, and to recognize that these provinces and Quebec must be funded significantly and sustainably based on real needs of the healthcare systems in each of the provinces and Quebec. So there are 4 recommendations in this motion which testify to what should be done to recognize the work of healthcare workers. Mr. Speaker, healthcare workers, most of whom are women, because they're nurses, RNAs, doctors, ambulance workers, medical technicians who do tests, and those who analyze the tests. We're talking about support workers, in maintenance workers in healthcare centers, psychologists, physiotherapists, occupational therapists. So I'm talking about all of the staff who on a daily basis have to take care of people who are on the front lines and who remain on the front lines despite the fact that all of the needs are resting largely on their shoulders. We're talking about workers who are convinced of the need and who make the distinction and yet who suffer because they fear for their lives, the lives of their loved ones as well. They are exhausted. We have statistics to show this. They are exhausted and they won't have holidays or time off over the holiday period. But they are on the front lines, and they will remain on the front lines. And I would even say this. I am a nurse by training. I was a practicing nurse for about 10 years, and I'm the critic. And I was very proud of the work that I did. And I represented the workers in the area of healthcare. And what we did was to recognize them, recognize their work and their expertise, and even if we call them the guardian angels, we recognize their contribution and their expertise.
In the healthcare system, like in Quebec, 80% of expenditures go to human resources. People who provide services. And if we want to improve the quality, or if we have good quality of service, it's because of them, and they deserve our respect. And we should respect them even more because they are exhausted, but they remain on the front, calling for better conditions, and they need to be acknowledged for that. Now, what we need in order to face this situation is to recognize, and this is what various governments have done over the past few years through the healthcare transfers, when we cut off funding for the provinces, reduce their ability to provide good quality healthcare services and to guarantee public health services, then we put them at the mercy of the spending power, the federal government's spending power, which is being used at the expense of the provinces. Now, just take a minute and imagine this. For just a minute, if we had respected, if that was signed at the time, to provide 50% of healthcare costs, we wouldn't be here today calling for the government to explain why there is 19 billion here and 600 there and masks, etc., because you know people wearing masks who have visors, who have gowns, and who have gloves, all they need is to have the funding necessary so that they can provide care to the people they're caring for. They don't need a bunch of numbers. These are people from our ridings, our constituents who, like us, also need care and expect good quality care. And that's the responsibility of the federal government. Next week, on December 10th, if you've forgotten to mention it in the economic update, the provinces, and this is unanimous, so I don't know why anyone would disagree with it, but they have said that they need sustainable, predictable funding that they can count on. They don't want to have to come back each and every time. But what's the government going to do to help us so we don't have to come back and beg for money? Because it's our money to begin with. It's our taxes. So it's money that is owed to us, Mr. Speaker. And next week, there's going to be a chorus of voices calling for the necessary funding, the means to take action. And that's what we need to be able to count on. The last federal meeting on transfers was deemed a half victory. For once, for the first time, we were able to sign a bilateral agreement. We called the divide and the government went with the divide and conquer mentality, and everyone came out worse off. But every province is currently underfunded, significantly underfunded, when it comes to being able to offer healthcare services. Nature abhors a void. Now we talk about privatizing healthcare services. We can denounce it, and we do in the provinces as well, because it might have to be done. But there are choices, cuts that were made because of a lack of funding and a lack of political will from the government to honor their commitments. And so our message to the government is this: it's now 2020. These maneuvers must stop. With recognition and goodwill and a focus on the health and safety of citizens, then we need to give them the ability to take act and not act in a piecemeal approach. Thank you, Mr. Speaker. Questions and comments? The Honourable Parliamentary Secretary to the Minister for Seniors. Thank you, Mr. Speaker, and I'd like to thank my colleague opposite for the second half of her speech by the bloc. According to my colleague, healthcare transfers, Mr. Speaker, will resolve everything in the pandemic. The pandemic is unprecedented. There was no instruction manual, and they seem to be trivializing transfer payments, be it for PPE. She only mentioned a mask, as if transferring masks would be helpful, without talking about ventilators, other equipment that has been provided. The presence of the Red Cross, our soldiers. Do you think, Mr. Speaker, that a transfer payment would have helped, would have been able to bring in the Army, ventilators, the Red Cross, and others? The Honourable Member. The Army came in to help out in the long-term care facilities. The Army is a federal jurisdiction. If it had to be brought in, then perhaps we need to ask ourselves why Ontario and Quebec requested it. It might be that before the pandemic, that particular need wasn't there. But these issues of workers equipment, etc. If the provinces had had sustainable funding, and I think that's where we don't agree. You keep saying, oh, the provinces need this. We've responded, 600 million there, 19 billion there. When I talked about masks. I talked about people who were wearing the masks, not the masks themselves. I talked about people wearing all of that equipment. And if 20 or 25 years ago we had maintained sustainable funding and it hadn't been played with a yo-yo and had it go up and down and up and down, we wouldn't be talking about this piecemeal approach to funding that we are today. Questions and comments? The honourable member for Aurora, Oak Ridges, Richmond Hill. Well, thank you, Mr. Speaker. I'd like to thank my honourable colleague for her remarks. Clearly, this pandemic is very difficult to fight, and the provinces are doing a very good job. But the federal government doesn't have a plan for rolling out vaccination. And that is causing problems for the provinces with respect to how they can fight the pandemic in the future. Does my honourable colleague, or can my honourable colleague, explain to this House how or what she thinks about the absence of a plan to roll out vaccinations against COVID-19? The honourable member. It's very difficult, but since the outset, what we have deplored is a lack of vision and a lack of a plan. Since the outset, we have been reacting, trying to heal instead of prevent. There was a large portion of time, almost 2 months, when the House was prorogued. We could have expected them to prepare a vision during that time. What is happening now is deplorable. We have time for a brief question. Virtually, the honourable member for Fredericton. Thank you, Mr. Speaker. I just want to say is that I agree with the increases to federal transfer payments to the provinces. The Atlantic provinces have a unique situation and they need additional support. And that it was before the pandemic began. Supporting the provinces and territories is important. And I would like to say to my colleague, I agree with you. The honourable member for Thérèse de Blainville. Thank you very much for your comment. I will take this opportunity to say that I did forget to mention something earlier. In the health transfers to the provinces, there's an aspect that's not being considered. It's a per capita funding model, and it's not taking into account the aging population. In Quebec and Ontario, more specifically, demographics are changing and the population is aging, and that needs to be taken into account because the population is more vulnerable. Resuming debate, the Honourable Parliamentary Secretary to the Minister for Seniors. Thank you, Mr. Speaker, and I'd like to start by saying that I'll be sharing my time with the honourable member for Châteauguay-Lacolle. Mr. Speaker, I want to thank everyone for raising this important issue in the House and give it national attention. This affects me personally because I'm the Parliamentary Secretary responsible for seniors. And we have worked very hard throughout the pandemic. And this pandemic has been particularly difficult for everyone, but even more difficult for those who are on the front lines, those who are fighting daily to help people and to save lives. Without question, healthcare workers have gone to the front lines with one goal in mind: to protect Canadians. The price that they have paid has been immense. Some have even made the ultimate sacrifice and paid with their lives. But without their hard work since the beginning of the pandemic, work that continues today, the number of deaths in the population would have been even greater, Mr. Speaker. I have no words to thank them. We owe them an immense debt of gratitude that we will never be able to repay. Since the outbreak of the pandemic, our government has supported the people of this country and worked in collaboration with the provinces. We introduced the Canada Emergency Benefit to help people who had lost their jobs. We invested $500 million through partners to help seniors and others get essential services and supplies, such as groceries. In July, we provided a one-time tax-free payment of $300 to seniors eligible for old age security, and an additional $200 for seniors eligible for the Guaranteed Income Supplement. We worked with the provinces and territories to ensure the safety of residents and staff in long-term care facilities. When the provinces called us for help, we responded, Mr. Speaker. Members of the Canadian Armed Forces were deployed to more than 50 long-term care facilities in Quebec and in Ontario. In addition, we published guidelines for long-term care facilities to prevent and control COVID-19 infections. We are investing billions of dollars in the purchase of personal protective equipment for healthcare workers, including long-term care workers. In fact, the new emergency reserve for essential services will assure that PPE and other essential services will always be available for those who are caring for our seniors. As part of the State Safe Restart Agreement, $740 million will be invested in infection control and protection measures in long-term care facilities and for other vulnerable populations. We have provided $3 billion to the provinces and territories to increase the wages of essential low-income workers, such as long-term care workers. Our government has taken comprehensive measures to improve the quality of life for seniors. This builds on the attention we have paid to seniors since we were elected. Since 2015, our government has put in place several measures to improve the quality of life of seniors across the country. Thanks to our initiatives, many seniors have been able to make ends meet, to get the care they need, and to stay active in their communities. Among these measures, Mr. Speaker, we have restored the age of eligibility for old age security and the Guaranteed Income Supplement from 67 to 65, putting thousands of dollars back into the pockets of new seniors. We've invested to provide greater income security for seniors by, among other things, increasing the GIS and increasing the GIS income exemption. We worked alongside the Quebec government to ensure that the harmonization of the Quebec pension plan with the Canada pension plan continues following the 50% increase in the maximum annual CPP benefit that we put in place. Small increases that the Bloc Québécois is criticizing us for. They know full well that these are adjustments, not an increase. It's playing with words in order to misinform seniors in Quebec and Canada. That's what the Bloc is doing. Our government's leadership and collaboration with the provinces prove that it is possible to establish national standards for the benefit of seniors and the population while respecting provincial jurisdictions. Moreover, we know how important it is to help seniors live longer in their own homes. That's why we invested $6 billion, an additional $6 billion in home and community care and palliative care services. Since the throne speech, our government has been committed to continuing to support seniors and essential workers. We will work with the provinces and territories to establish new national standards for long-term care so that seniors have the best possible support. We have good cooperation from the provinces and territories and Quebec, Mr. Speaker. In addition, we are committed to accelerating action to establish a national, universal pharmacare program in collaboration with the provinces and territories. We are also committed to helping develop amendments to the Criminal Code to explicitly penalize those who neglect seniors in their care, putting them at risk. Yesterday, our government provided an update on the fall 2020 economic statement. We know that Canada is fighting a virulent second wave of COVID-19. We are better prepared than we were in the spring. We have the personal protective equipment we need to protect nurses, doctors, frontline workers. And the government is getting even more. And that's why, Mr. Speaker, we will create a new long-term care security fund of $1 billion that will help the provinces and territories protect people in long-term care and support infection prevention control. That's a transfer, Mr. Speaker. We are committed to support of the order of $38.5 million for training of up to 4,000 trainees in the area of human support services to address critical labor shortages in long-term care and home care. The government proposes to allocate $150 million to the Canadian Red Cross, and that is a transfer to help our seniors, Mr. Speaker, to help the Canadian Red Cross and other agencies build and maintain a humanitarian workforce to provide surge capacity in response to COVID-19 outbreaks. We will invest $6.4 million to expand the Canadian Foundation for Health Services Improvement. Once again, this is to help all provinces and Quebec. All Canadians and Quebecers can rest assured that we will continue to work closely with the provinces, territories, municipalities, and Indigenous communities to develop a pan-Canadian response to the pandemic. While more work remains to be done, Mr. Speaker, our government's ambitious measures are making a real difference in the lives of seniors, just as the measures taken during the pandemic have helped millions of people. We will always be there for Canadians and Quebecers. Mr. Speaker, relations with Quebec are good, even though the Bloc Québécois would like us to be squabbling with the Quebec government. We are there for Canadians and Quebecers. Thank you, Mr. Speaker.
Questions and comments? The honourable member for Saint-Hyacinthe-Bagotte. Thank you very much, Mr. Speaker. Far be it from me to cut off my honourable colleague for Longueuil-Saint-Hubert. Oh, well, perhaps next time it'll be the other way around. I'm sorry we hadn't consulted each other. Anyway, I just wanted to be part of a report that stated that long-term care centres in Quebec have major needs, especially when it comes to trained personnel. This is not a report published by a sovereigntist organization. No. It is from that well-known sovereigntist organization, the Canadian Armed Forces. I would like to know what my colleague thinks of that sentence. The Honourable Parliamentary Secretary. Thank you very much, Mr. Speaker. I'd like to thank my colleague for his question. It's good to hear that he read a line of the report, or perhaps the entire report, I'd hope. The report said that as a Canadian government, we need to be there to support our seniors in long-term care. Mr. Speaker, the action we took during this pandemic within long-term care means that we've been able to get to know what's happening on the ground. For us, when it comes to seniors, it's not about federal, provincial jurisdiction. No, we're talking about human beings, and as a government, we need to be there to support them, Mr. Speaker.
And comments. We'll go to the honourable member for South Okanagan, West Kootenay.
Well, thank you, Mr. Speaker, and I'd like to thank my colleague for his speech. And I just want to stay on that theme of long-term care. We have seen the tragedy that's unfolded in long-term care homes across the country. This is a problem that was there before COVID. COVID has just exacerbated it. And the NDP has put forward a proposal to bring long-term care into the Canada Health Act so that the standards that every province has, the trouble with the provincial standards is not that the standards are too low, it's that none of the provinces are meeting them because they don't have the funding. And I'm just wondering if the member can comment on that and the NDP proposal to bring this into the Canada Health Act so that every province will have the adequate funding so our seniors can be taken care of in the manner that they deserve.
Secretary Parlementaire.
Oui, merci. The Honourable Parliamentary Secretary. Thank you, Mr. Speaker. An excellent question from my colleague from the New Democrats, Mr. Speaker. We are currently negotiating with the provinces and territories to establish national standards for seniors. And all ideas are on the table, Mr. Speaker, but the major objective here, the principal objective, is to improve, to give back dignity to our seniors, those who built a Canada we can be proud of, our teachers, those who enable us to be here today, our decision makers. We owe them respect. And the best way to show them respect is to establish national standards in cooperation with the provinces and territories in order to establish a way for our seniors to have a dignified end of life and pension. Thank you. The Honourable Member for Longueuil Saint-Hubert. Mr. Speaker, I have a lot of empathy for my colleague across the way. He's here this morning. He's going to bat for his government. In his speech, he hasn't told us anything new. He's repeated the same numbers over and over. About the $300 that were sent back in July, that's a long time ago. And now he's telling us about pandemic investments. Well, there was federal investment in health during the pandemic, but why was that necessary? Because those investments weren't made before. If the federal government had increased health transfers before, it wouldn't have been necessary. When are the investments going to come now to avoid problems in the future? That's the issue. That's what we're asking for here this morning. I have a question for my honourable colleague. He said, people know such and such, and the Bloc Québécois is causing misinformation, they're partisan. Well, yesterday evening, I received an email from someone in my riding, and he doesn't seem to have read the same newspapers as my honourable colleague. Many pundits and politicians are talking about increasing benefits for people of a certain age. When it comes to these benefits for low-income seniors, I'd like to hear what's going on with that. Thank you for all your help. This is something I got from someone in my riding yesterday. After the speech from the Deputy Prime Minister, I'd like to know what's happening to help seniors. The Honourable Parliamentary Secretary to the Minister of Seniors. Thank you, Mr. Speaker, for enabling me to answer this question, which is very easy to answer, in fact. I can help my colleague across the way to answer this constituent if he's not able to answer. Yes, the $300 was very helpful during the pandemic, but we've done a lot more than that. For example, in his riding, there is the New Horizons program. Organizations were supported during the pandemic to help with mental health. He can also remind his constituent that $20 million additional dollars were invested in New Horizons, $9 million in United Way, $350 million for health infrastructure, and more funds for seniors. So if he needs help to answer his constituent, I'm ready to help him answer and tell the constituent about all that we've done. Resuming debate. The Honourable Member for Châteauguay-Lacolle. Thank you very much, Mr. Speaker. And I'd like to seize this opportunity to thank all of the healthcare workers in my riding, Châteauguay-Lacolle. They do extraordinary work on the ground, in Anne Auberge Hospital, and in our long-term care centers. and community health centers. Now, since March, Mr. Speaker, we've seen that Quebecers and the government of Quebec have taken individual and collective measures to contain the spread of COVID-19. And these actions were strengthened by the cooperation, very close and ongoing cooperation between federal, provincial, and territorial governments. The Government of Canada has always been very proud of supporting the delivery of healthcare services to Quebecers. In 2020-2021, our government granted more than $9.42 billion to Quebec through the Canada Health Transfer, which represents an increase of 3.4% over the preceding year, and $1.1 million additional dollars over what Quebec received in 2016-2017. That represents 23% of total Quebec government expenses on healthcare. On the 16th of July, the Prime Minister and the Premier of Quebec, as well as the other provincial premiers, announced that they had signed the Safe Recovery Agreement. That agreement earmarks more than $19 billion in federal investment to help the provinces and territories, including Quebec, so they can restart their economy safely over the subsequent months, while making Canada more resilient when it comes to possible future waves of the virus. In addition to $500 million transferred to the provinces and territories at the beginning of the year to support their health systems during the first wave of the COVID-19 pandemic. In addition to that assistance, the Safe Recovery Agreement includes $700 million additional dollars to help guarantee that health systems throughout Canada will be ready to face any resurgence or future waves of COVID-19. And that means more than $270 million in additional funding for the Quebec government in order to continue meeting the needs of Quebecers and in order to preserve the Quebec health system's capacity. Since the beginning of the pandemic, we have also committed to supporting the efforts of provincial governments, including the Government of Quebec, in the areas of contact tracing and data collection. With that in mind, our government granted more than $675 million to support the Quebec government's efforts in contact tracing and data collection. Moreover, in May of this year, the governments of Quebec and Canada announced that they had reached an agreement to support the provincial government in the area of contact tracing. Currently, we can say that Statistics Canada has increased its capacity to 1,980 calls a day in Quebec. We are also supporting virtual care services and online tracing services in order to remove the burden from emergency services and support physical distancing. We have also invested $240 million to develop virtual care in order to help the provinces and territories to continue to carry out that important work. That amount includes $150 million this year for the provinces and territories in order to help them to speed up their work to increase accessibility to virtual care while protecting Canadians' privacy. More than $28 million out of the total funds for virtual care were given to the Government of Quebec. We also committed to protecting the most vulnerable populations, including individuals in long-term care and those receiving home care, and that will continue under the Safe Recovery Agreement. The federal government has taken several measures to meet the major challenges that are facing long-term care centers in Quebec and throughout the country, in order to avoid tragedies like those that we saw in the spring. We have called upon the men and women of the Canadian Armed Forces when we learned about the difficult situations in long-term care centres in Ontario and Quebec. Mr. Speaker, that was the assistance that was necessary to stabilize these situations during the summer months. After the Canadian Armed Forces mission came to an end, we worked closely with the Red Cross to continue supporting the provinces and territories facing outbreaks in their long-term care centres. To date, a total of 1,553 members of the Red Cross have been working in long-term care centres in Quebec. 582 members of the Red Cross are still active in the province in order to reduce the effect of current outbreaks and future outbreaks in long-term care centres. In addition, up to $3 billion in federal funding will be provided to the provinces and territories to support an increase in the wages of low-income essential workers, which can include frontline workers in hospitals and long-term care establishments. The Safe Recovery Agreement also lays out additional funding of $740 million to assist the most vulnerable Canadians, specifically those receiving long-term care, home care, and palliative care. Canadians who are at higher risk of suffering serious cases of COVID-19. These funds will support progressive infection prevention and control measures in order to protect people in long-term care and those receiving home care and palliative care. This new funding, with more than $166 million going to Quebec, are in addition to the financial support measures agreed upon between Quebec and Canada's federal government. These preceding measures were laid out in a bilateral agreement in 2017 to support home care and local care as well as addiction and mental health care. The amount of money earmarked in these measures is updated annually and based on population estimates. Currently, the theoretical total for Quebec represents more than $2.48 billion over 10 years, including $1.35 billion for home care and $1.13 billion for mental health care. The Safe Recovery Agreement will increase these support measures with $500 million to help Canadians facing mental health and substance abuse difficulties. I don't have much time left, Mr. Speaker, but I would like to mention that we have invested more than $46 million to create Space for Wellbeing Canada, a new online portal which gives access to a virtual network of psychosocial support. This program is the first of its kind. This program, Wellness Together, is the first of its kind to offer 24-hour support, as well as tools, resources, and free database assistance. These resources aim to support provincial and territorial health services, such as those offered by the Quebec Ministry of Health and Social Services. And the tools include self-evaluation and peer support, as well as confidential sessions with social workers, psychologists, and other professionals. We are very proud of supporting Quebec's efforts, and as my Quebec said, we have excellent relations with the province of Quebec, and we are working hard together. We are very proud of all of the cooperation between our government and the government of Quebec, as well as municipalities in Quebec, and other key stakeholders throughout the pandemic. And we will continue with that approach in order to build back better. Thank you very much, Mr. Speaker. Questions and comments? The Honourable Member for Salaberry-sur-Rouen. I'd like to thank my colleague for her speech, Mr. Speaker. Unfortunately, I did not hear from her about the fact that her government wishes to impose national long-term care standards. My riding, Châteauguay-Lacolle, is part of an area where I used to be in charge of long-term care and housing. So I would like to hear from my colleague as to what the Premier of Quebec just said in the media. The fact that imposing national long-term care standards in Quebec long-term care is unacceptable. I'd like to hear from my colleague. And I'd like to know if she has contacted Normand Godin, who is the director of the 9 long-term care centers in Montérégie-Ouest, where there has not been any nightmare situation with deaths of seniors in these centers. The Army and the Red Cross were not necessary in the area. So I would like to hear what my colleague thinks about what the Premier of Quebec said. Mr. Legault, I'd like to hear what she thinks about the fact that he said that these national standards proposed are unacceptable. The Honourable Member for Châteauguay-Lacolle. Thank you very much, Mr. Speaker. I'd like to thank my colleague for her question. And I'd like to thank her for mentioning that the quality of long-term care services in our provinces is remarkable. It has always been excellent, but I would like to thank my colleague for mentioning that in my riding, there has been remarkable efforts made in long-term care in my riding from the beginning of the pandemic. And there has been a great deal of cooperation between stakeholders in my region since the very beginning of the pandemic and between elected officials at every level. In order to ensure that we had what we needed, including PPE and other types of care. And regarding long-term care and her question about national standards, it's not a matter of imposing standards, it's a matter of cooperation. I have already worked in these establishments, and I would say that it's crucial to have these discussions at every level.
Member for South Okanagan, West Kootenay.
Thank you, Mr. Speaker, and I'd like to thank my colleague for her speech. And we've heard a lot today about long-term care. I've spoken a couple of times on it in questions and comments. What I'd like to talk about is another issue that's facing Canadians in our healthcare system that should have been included from the start, and that's dental care. Dental care is something that really goes down the line. If we don't have good dental care, we end up costing our overall healthcare system millions and millions of dollars. It's one of the parts of healthcare that is a real one of the big factors is your income. If you have a low income, you tend not to have access to dental care. So if we provide a national publicly funded dental care program for those people who really need it, we can really help Canadians who need help the most and help our healthcare system. I'd just like to hear her comments on that.
The Honourable Member for Châteauguay-Lacolle.
Very much, Mr. Speaker, and I'd like to thank my honourable colleague for his question and bringing up indeed an area of healthcare which is I don't want to say neglected, because if we neglect our teeth, Mr. Speaker, we're going to find out about it very soon, right? So I think that this is an area. I know that my own brother, who has been a dentist now practicing for 40 years, his first 10 years of practice were actually here in Ottawa, working in a clinic, in a provincial clinic where he was providing dental care for people at low revenue, vulnerable people, and I think it's certainly an area that needs to be explored. Thank you.
We have the time for a very brief question. The Honourable Parliamentary Secretary to the Minister of Small Business. Thank you very much, Mr. Speaker. I greatly appreciated the speech given by my colleague. Obviously, I'd like to highlight her work with long-term care home workers in her community and region. I'd like to hear her talk a little bit about the announcement by the Deputy Prime Minister and Minister of Finance yesterday regarding the investment of $1 billion in long-term care homes. Perhaps this could help long-term care homes in her region of Montérégie. A member for Châteauguay-Lacolle. Thank you very much, Mr. Speaker. Clearly, it's the most difficult question that always comes from a colleague. But sincerely, I think that the update that we heard yesterday was well received by people in my region. I think that we can be a model as to how to manage long-term care homes. That money will help us and support us in these efforts. Thank you very much. Resuming debate. The Honourable Member for Salaberry-Sarrois. Thank you, Mr. Speaker. I will be sharing my time with the member, the fabulous, wonderful, extraordinary member for Montarville. I will begin my speech, Mr. Speaker, with warm words that I wish to offer to all the staff, all the workers, employees throughout the public Quebec healthcare system. As Christmas approaches, normally, in times when there is not a pandemic, it's already a difficult time because everybody wants to go on holidays. It's difficult to have a schedule and make everybody happy. But this year, this staff, the healthcare staff at any level, be it at reception, etc., they will have a very different Christmas. The same thing is true of patients who will have to experience a very special Christmas. And perhaps they won't be able to have all the visitors they want over this holiday period. A special thanks also goes to the people who are forgotten. We often talk about long-term care homes. We talk about home care, but we don't talk enough about community group staff, community network staff. They also work in partnership to complement the public network with their volunteers and citizens who help others to get better and have better services. So a warm word to you. I know it's not easy. Community groups in essential services have not had any respite since March. They have quickly adapted, changed how they operate in order to continue to provide services to people in need. During the pandemic, we have talked about the needs of seniors, hard hit. Yes, hard hit. They are the main ones who have been hard hit by this pandemic. And we're talking about it as if that was all there was. But I would say there's a great weakness with regard to the care conditions in long-term care homes. I have said on many occasions that I have had the opportunity to work a large part of my professional life in helping seniors in managing where they go. And I think that they need one thing. My colleague from Châteauguay-L'École said it. There are long-term care homes that have not had to suffer through the terrible things that have occurred elsewhere because they had enough staff, because they had a framework, but these people are now exhausted. They're exhausted because since March, they have been going without a break, doing overtime, sometimes forced overtime, and they continue to provide services to our seniors. I can tell you one thing, Mr. Speaker, the healthcare, or the long-term care homes, rather, have many standards they must respect. They must comply with many standards. They are inspected, assessed on a regular basis by the department. We call it ministerial visits. That means you get your approval. There are standards to reduce the medications given to seniors and the reduction in the prescription of psychotropic medicine, and we have controls. The long-term care homes have many targets, quality targets they have to meet in order to get a ministerial visit and get approval. So there is no need for pan-Canadian standards to improve the quality of care provided in long-term care homes. That is beyond any doubt. The Premier of Quebec said it just now to the media. The number of standards that we have to manage our long-term care homes are sufficient. It's unacceptable to impose more. It's not in the federal government's area of jurisdiction. Ottawa doesn't provide direct services. Youth and the homeless get services provided by the people. This is, of course, in an agreement with the government of Quebec. It is not the standards, the addition of standards, that will suddenly mean that staff will appear in the long-term care homes. Suddenly, the quality of service provided will be extraordinary, because it's already extraordinary. But what we're missing is quite clear. We are missing hands. We are missing workers at all levels. Obviously, there is a lack of budgetary means to hire those individuals. But we mustn't ignore the fact that we are in a context of a labor shortage. We don't have enough workers, people who want to become an orderly. We talk a lot about orderlies in long-term care homes, but we mustn't forget that family and social attendants provide home care. And it's difficult to recruit these individuals. So it's not the standards that are going to resolve the problems with home care and long-term care homes and the provision of services to people in need in Quebec and in the provinces, but rather an increase in the financial ability to better organize the services and respond to the needs. And you will not be surprised, Mr. Speaker, that this requires a better transfer from the federal government, federal money to the provinces. It has been often repeated today that ultimately Quebec is making terrible choices. It doesn't have the fiscal capacity because Ottawa has withdrawn over the years, both under Conservative and Liberal governments, and it's been done year to year. So there's been a reduction in federal healthcare transfers from the federal government to the provinces that have dropped, and today it represents approximately 21% of the needs. You know, I was listening to the debate, and it's often been said that the Bloc always wants to quarrel. No. I read a little publication put out by the Department of Finance of Ontario, which said that I hope that parliamentarians will support the Bloc's motion, because it is through these healthcare transfers from the federal government to Quebec and to the provinces that we will be able to increase our capacity to better respond to the needs of the public. Because experts, the professionals in these kinds of healthcare services, know that there is an expression of need. Often we talk about a top-down process. It's not in the federal government where the needs are expressed. It's not the federal government that provides the services. It doesn't have the expertise nor the knowledge of the need on the ground in order to be able to put in place and provide money conditionally for the implementation or establishment of programs. In conclusion, Mr. Speaker, because I know that I am so passionate about this subject, but I must say two things. We mustn't forget that the healthcare system is not just services to seniors. They are important services, but there are other sectors that are important. Homelessness, mental health care, addiction, community groups are being very innovative and have practices that are being studied by other countries, even because Quebec has a model of intervention. The government of Quebec has to make choices. Terrible choices, because the healthcare budget represents about 45% of our total budget. So Quebec's total annual budget, about 41% is spent on healthcare. So I would plead with my Quebec colleagues to understand and to use their power to convince their leadership to say that they're going down the wrong path in wanting to interfere in areas of provincial and Quebec jurisdiction. I know that they're going to play with words. There is no government, provincial government, that will agree to negotiate pan-Canadian standards in healthcare for long-term care homes. So If it doesn't work, we shouldn't impose it. I would therefore ask the collaboration and cooperation of all MPs in the House to be united and stand with the Premier of Quebec, who is demanding the respect of jurisdiction and the giving up of this idea of imposing pan-Canadian standards on long-term care homes. Thank you, Mr. Speaker.
Questions and comments?
Questions and comments? The Honourable Member for Châteauguay-Lacolle. Thank you very much, Mr. Speaker. Again, I want to thank my colleague for her great speech and to provide us with the opportunity to speak about how it's interesting. And I think there's something here to look at in the fact that in our region, which is not a region that is very rich in the sense that we have a lot more money than other regions, but I think I have also just learned from my colleague that she was helpful in the administration of these services. So perhaps there is a question here. Yes, money is helpful, but is it not also a question of management and choices? Administrative level choices and policies that can be looked at, and perhaps Quebec can provide us with some good examples for the rest of the country. The Honourable Member for Salaberry-Serrois. I want to thank my colleague for her question. Yes. Montérégie is an example, a striking example, that there is no need for pan-Canadian standards to manage the long-term care homes and do the work properly. She sees that her government is going down the wrong road. The Quebec government, through its innovative practices, is inspiring other provinces, but also other countries. We can think about our childcare system as a model. And it was developed, and taxpayers contribute to it. Other provinces could choose to do it too, but they haven't. But it's inspiring to see also how we support our community groups who provide services to the public. So we're a good example, but it's not just because we're a good example that it's a reason to come and say what we need to do and how to do it. I hope that my colleague will understand and influence her own government so that it can get back on the right track.
The Honourable Member for Edmonton Strathcona.
Thank you, Mr. Speaker. And I just wanted to follow up a little bit on my colleague's comments that she's just made in terms of ensuring that provincial governments have the ability to make decisions. What my question is if, you know, she talks about the fact that in Quebec, that Quebec has a wonderful childcare program and don't need national standards and these sorts of things. But I have a concern. I'm happy that the people in Quebec have this access, but I'm concerned about people across the country having equal access and it being the same for long-term care in Quebec as it is in Alberta, as it is in British Columbia. So I see a value in national standards. And I just wonder whether she could talk a little bit about how we would ensure that each area of the country, people could access that same quality of care if we did not have a national standard.
The Honourable Member for Salaberry-Serrois. I want to thank my colleague for her question. We don't have the same definition of the word national. When I talk about nation, I'm talking about Quebec. If I talk about pan-Canadian standards, I'm talking about across Canada. So I just want to tell her that it's not in the right parliament, because if she wants to influence in her own province the coverage for the social network and health, she must influence people at her legislative assembly in Alberta. I would tell her that in Quebec, we pay taxes, we pay sales tax, GST, we pay lots of taxes in Quebec because we decided to redistribute equally and collectively the money in order to be able to offer social coverage to all. And the debate on health and social services is not to be done here in this parliament, but rather in the provincial parliament in her province. So I invite her to take her willingness to fight and go turn to her politicians in Alberta. Resuming debate. The Honourable Member for Montarville. Thank you, Mr. Speaker. I want to thank my wonderful colleague, the delightful colleague from Salaberry-sur-Loire, for her very wonderful presentation. I must say, Mr. Speaker, that fortunately I was wearing my mask because otherwise everybody would have seen me blush. And as you know, without a doubt, I don't look very good in red. It's not part of my color family, but I am used to saying that we should eat or wear red rather than being red. So yesterday, no later than yesterday, my counterpart, the Minister of Intergovernmental Affairs for Canada, around 8 p.m., issued the following tweet, and I'd like to read it, Mr. Speaker. On December 10th, the Prime Minister, whom I won't name because I'm not allowed to name the individual, will meet with the Premiers of Canada to discuss our joint fight against COVID-19, strengthening healthcare and logistics, and the distribution of vaccines. The main demand coming from the provinces, other than the fact that they want to know when they'll finally be able to start vaccinating people, when the vaccines will be available, the main demand of the provinces and Quebec, Mr. Speaker, is the substantial increase in healthcare transfers. But what is wonderful in this statement made by the Minister of Intergovernmental Affairs, or rather this tweet, is that the invitation was made when the Prime Minister of Canada was assured of coming to the meeting empty-handed. Why would he come empty-handed? Well, the very afternoon, the Minister of Finance and Deputy Prime Minister gave a description of how she would use the money that she does not have, how she would ensure that she would spend the money that we're borrowing. And oh, what a surprise, there wasn't a single cent for transfers to the provinces. Imagine how ridiculous the situation is during an unprecedented healthcare crisis. The federal government does not find the means to respond to this basic demand coming from the provinces and Quebec to increase healthcare transfers in order to allow them to deal not only with the pandemic, but also the daily management of healthcare services within their jurisdiction.
Oh, Monsieur le Président, qu'est-ce qu'on...
Now, what we see, Mr. Speaker, is that the federal government prefers to invest elsewhere. It prefers investing in a national, as my colleague said, the member for Salaberry-sur-Loire, and as the former leader of the Mr. Bouchard, Lucien Bouchard, used to say, there are two countries in this country, and we don't even have the same definition as to what national is. A national system, a national child care system for early childhood, is something Quebec already has, because we made the choice, as my colleague pointed out. And national standards for long-term care for our seniors. So what led the federal government to say that instead of investing in health, we're going to invest in standards? The government's going to impose standards on the provinces, on Quebec, in areas where the federal government doesn't know anything about anything. The federal government has no jurisdiction there. Now, I'll have to tell them, I know how it works, and so I'll explain it to them. But what prompted the government to make that decision? Because, look, the provinces have been so negligent in the government's books that they had to send in the army, as if the army could provide humanitarian assistance abroad only. I'd like to remind colleagues that Quebecers pay for the armed forces, and when we need them, it's normal for them to be able to step in. But let's get back to that issue of the armed forces and their involvement. It's interesting, Mr. Speaker, because the armed forces don't recommend at all what the government's preparing to do. What the armed forces told the federal government is this. They said there are more than enough standards. That's not where the problem lies. The problem is with respect to staff. Extra arms, qualified people. In the report, it says, if I may quote it, Mr. Speaker, based on our observations, the Army concludes, the needs in the long-term care facilities are staff-related. A need for staff with medical training, so not standards. The provinces in Quebec don't need standards. They need resources. Now, what happened in the long-term care facilities in Quebec, what's happening in long-term care facilities in the other provinces is the result of negligence, not by the provinces, but negligence by the federal government. Well, Mr. Speaker, you're going to say, well, how could it be the federal government negligence? Well, it's very simple to answer that question, Mr. Speaker. The federal government agreed initially to contribute 50% of healthcare costs, but it's not investing a cent, not a cent, in long-term care for seniors. And 85% of the costs of the bill is picked up by the Quebec government and the rest by users themselves. Yet, or so, then the government of Quebec has had to dip into the rare resources that it has for health care because of cuts, successive cuts by the federal government, to pay for that 85% in costs for the long-term care facilities. If the federal government had maintained its contribution at 50%, the Quebec government, the provincial governments would have had additional resources so that they would have been able to adequately support long-term care. But the federal government chose to withdraw. And that's why we're terrified, Mr. Speaker, when the federal government says we're going to impose new standards. And we're going to send an envelope with that. Well, we know that the envelope is something the government always pulls back, but it doesn't remove the standards after the fact. The federal government maintains those standards and those rules and the Canada Health Act, even though it no longer contributes more than 20% to healthcare costs in Canada, Mr. Speaker. So if I may, I'd like to conclude by going back to the wording in the motion, which says that the House acknowledged the extraordinary work of healthcare workers, including doctors, nurses, and orderlies, during the COVID-19 pandemic, particularly with seniors, but also with the general public. I think that we can all agree with that. B, that the House recognized the courage and sacrifices required from them and their families in order to be on the front lines. No one can disagree with that either. C, that it highlight the work of Quebec and the provinces in responding to the health crisis and note the direct impact of their respective budgets. Clearly, the pandemic has had a direct impact on the finances for Quebec and the provinces. The government can't deny that. And D, the motion calls on the government to significantly and sustainably increase Canada Health transfers before the end of 2020 to support the efforts of governments of Quebec and the provinces, healthcare workers, and the public. So, Mr. Speaker, there could be some disagreement on that. Now, I've heard my comments from the Liberal Party, and I would say to my Liberal colleagues that they must vote in favor of the motion for at least two reasons. Even if the last point is something they disagree with. First of all, because it respects the Constitution that the party imposed on Quebec, and secondly, because it would simply be a show that they are honoring the commitment made by the government to pay for 50% of healthcare costs. Thank you, Mr. Speaker.
Questions and comments.
Questions and comments. The Honourable Parliamentary Secretary to the Minister for Seniors. Thank you, Mr. Speaker, and I'd like to thank my colleague opposite for his remarks. My colleague is very well informed. I know a lot about his political life, and he has told us that there's a country within a country, according to his former bloc leader. I'd like to point out to him that indeed he represents a province within Canada that we need to manage through the pandemic, and that Quebec is one of the provinces. In addition to the $200 billion in health transfers, we have added $19 billion to help the provinces and territories in Canada as part of the Smart Recovery Plan. Does my colleague not agree that part of that $19 billion that we've sent to the Safe Restart program can also be used for healthcare? The Honourable Member for Montarville. Well, I have the impression that he wasn't here when my colleague, the member for Longueuil Saint-Hubert, replied, saying that if money had to go in during the pandemic, it's because of federal neglect in terms of transfer payments for health in the past. Now, the World Health Organization has announced that there will be other pandemics, and if we don't want to end up in the same situation, then we need to start reinvesting now to avoid ending up in the same situation later. Now, I thought my colleague for Longueuil Saint-Hubert had been crystal clear in his remarks, but it seems that the member for the Liberal Party still hasn't understood the nuance. $19 billion is all fine and well, but it won't fix the problem, the fundamental problem that healthcare in Canada is underfunded because of the federal government's commitments. If Quebec is part of this beautiful, lovely country, well, then maybe the federal government should assume its responsibilities, and its responsibilities include respecting and keeping its word and paying 50% of healthcare costs. Questions and comments by video conferencing. The Honourable Member for Rosemont-La Petite Patrie. Well, thank you very much, Mr. Speaker, and I'd like to thank my colleague for his passionate and interesting remarks. We're discussing a good motion here today. Lots of interesting parts to it, and in the NDP, we have always denounced the cuts that the Conservatives made under Stephen Harper initially, cuts that were continued by the current Liberal government, and as a result, the increases to health care are 3%, whereas the actual cost is 5.4%. So we've reached a dead end, an impasse, and it's not sustainable. I'd like to talk to my colleague about acknowledging the frontline workers. That's an excellent idea. Those workers also include asylum seekers, and they had been promised that their status would be resolved. Now we've heard that removals and deportations are going to be resumed. I'd like to ask him what he thinks about the compassion and solidarity that the Liberal government is showing. These people helped us during the pandemic. What does the Honourable Member think? The Honourable Member for Montarville. As far as I know, and my erudite colleague, the member for Rosemont-La Petite Patrie, can correct me if I'm wrong, but the federal government, neither the federal government nor the Quebec government plans to deport anyone who has contributed to caring for Canadians during the pandemic. So I think the answer is clear. People who have taken care of our seniors, among others, during the pandemic shouldn't fear potential deportation. Now, having said that, we do have to acknowledge that being welcomed to a country is not a right, and there are a number of criteria that need to be respected. And if people don't comply with the criteria, the law stipulates that there are removals. So now, that's not my cup of tea, nor is that my area of expertise. So I will allow the specialists to elaborate on that particular issue. Thank you, Mr. Speaker. We have time for one final short question or comment. The Honourable Member for Drummond. Well, thank you, Mr. Speaker. I'd like to thank my colleague for his speech. I'd like to have his impression of something that I heard today. We're often told that a bloc makes so many demands. We are seeking a squabble or trying to pick a fight between Quebec and the other provinces. Now, the Minister of Finance for Ontario stated that the provinces are more unified as ever before with the leadership of François Legault. And so that was the Ontario Minister of Finance who said that. So what does the Honourable Member think about that comment? I'd like to thank the member for Drummond for his excellent question. He's absolutely right. I hear the government House Leader repeat in this House that the Bloc Québécois is trying to pick a fight. No, it's not the Bloc Québécois that stated today that federal standards were unacceptable. That was the Premier of Quebec. The Bloc Québécois didn't state to what my colleague just referred to. That was the Ontario Minister of Finance. So we are simply here, the reflection of a reality that. And so the government House Leader could accuse us until he runs out of breath about wanting to pick a fight, but there are some measures that people are dissatisfied with in the provinces, with respect to vaccinations, for example, with respect to funding and transfer payments. So it's not about trying to pick a fight. It's about setting the record straight, clarifying things, and that is what we are here for when it comes to Quebec's demands and expectations. Resuming debate, virtually, the Honourable Parliamentary Secretary to the Minister for Veterans Affairs.
Merci, Monsieur.
Thank you, Mr. Speaker. I'm very happy to have an opportunity to share my views and to make a contribution to this debate on health and frontline workers.
Mr. Speaker, by indicating that I will share my time with the member from Outremont. This pandemic has been unprecedented. There's no question. It's been a challenge right across this country. It's been a challenge for families. It's been a challenge for individuals. And I have to say that the bottom line is that there's been really families and communities coming together, and that's so important to note and thank them. I know that our healthcare workers are, of course, the backbone to this pandemic. They played a role and continue to play a role that's extremely important. I want to thank as well the provinces, the territories, and our government for the excellent work, a Team Canada approach, if you want. I'd like to also indicate that getting us through this pandemic, individuals, frontline workers like healthcare workers, long-term facilities, senior residents, our men and women in uniform, even the garage station, the convenience store, the grocery stores, all these people have played such an important role. And I want to thank and underline some of them in my riding, Mr. Speaker. The nursing long-term care over in Ocean View Manor in Eastern Passage, the Ivy Meadows here on Beaver Bank, of course, Sagwood here in Sackville, which have contributed and continue to do great work. And some of the individuals I want to note, I've visited throughout the summer, throughout the pandemic, and Sabrina at the Beaver Bank convenience store, which was working in supporting her community. VJ Cook's convenience store in Lower Sackville. Sandra with the Ocean Art in Eastern Passage. So many individuals and groups that have been contributing, and I wanted to thank them. That's extremely important as well. Now, as far as some of the organizations, they too have played a very important role, and I think of the Boys and Girls Club in East Preston that was able to deliver food boxes and lunches. The Lions Express in Fall River, the Beacon House, of course, in Sackville, in Eastern Passage, the Cow Bay Community Food, the Waverly Museum. These are all great organizations that had to do things differently to be able to help, and they did a great job at doing that. And I want to also note some individuals that volunteered, like Stephanie in Porter's Lake, who led the Craig's Cause pancreatic cancer 5-kilometer run. Thank her for that leadership. Also, Sandra McDonald Miles in Fall River, who raised over 800 pounds of food for Nova Scotia. Just great stories right around, and I'm sure that all members could talk about stories as well. I want to thank the business community as well, who had to make things differently to try to survive, if you want, who had to find ways to increase revenues and to shed expenses. And some of them who pivoted following our Prime Minister's encouragement to look at different ways of supporting Canadians through this pandemic. And we have Stanfield here in Nova Scotia who had some gowns that they pivoted to build some gowns. We have also Spring Loaded in Dartmouth here who build face shields. Those are very, very important companies that did that. I also want to thank our government for coming forward and helping individuals and seniors and with the various programs, the SERVE, the wage subsidy, the rent subsidy. Those are very important. Transfers for seniors, people with disabilities. Again, I can't say enough about how that was important. And as an MP, I was so proud of our government putting out these programs and then listening to MPs across this country so that they could make the tweaking, the adjustment necessary to meet even more Canadians and businesses and demands. Now, the second part, of course, of my presentation is about the healthcare and working with provinces and territories. And I want to thank the Public Health Agency of Canada, who worked closely with our government, with the provinces and territories, that worked as well with our partners, if you want, international partners, and with the World Health Organizations. Those were great avenues, networking that helped us through this pandemic as we continue to move forward. Healthcare is a very, very important area, and the transfer for Atlantic Canadians and Nova Scotian, because we have, of course, the most seniors, so the funding based on population rather than ratio is an issue for us. There's no question about that. Our government, however, we need to underline, have invested not only in the healthcare transfers in the agreement, but also coming through and helping us with home care, which is essential, which Canadians has underlined. Mental health, which is also very important. Pharmacare, dementia strategies. In Nova Scotia, family doctors, top priority. So those are areas that our government has been working very hard to help Canadians. Our national standards for long-term care, mental health, big issues. On supporting provinces, again, I can't thank the provinces enough, but our restart agreement, 19 million plus an extra 19 billion plus an extra $2 billion for education, big investment helping in testing and creating capacity, PPEs, and now investing in childcare spaces, as you heard yesterday, extremely important. And again, I want to thank our Canadian Armed Forces for helping us, as we will, when we get our vaccine, that the distribution of our vaccine will be supported by the Canadian Armed Forces. Monsieur le Président, permettez-moi quand même de faire des points très importants.
Mr. Speaker, I'd like to make some important points regarding the Bloc Québécois, which keeps talking about jurisdiction. Well, I would like to tell them the real story, which is that we have standards, we have obligations as a federal government to ensure that health care be uniform throughout the country and that everyone has the same rights. For example, look at what happened in Alberta with Jason Kenney, who tried to create private health clinics, whether it be for seniors, for children, childcare. All of these things are key. We need to ensure that we have standard. And the Bloc Québécois seems to be going astray on this point. We are a parliament for all of Canada, including Quebec. We have responsibility. The Bloc Québécois is not the only one that holds the gospel truth. And I must say, I'm a bit disappointed in my colleague, Mr. Blanchet, who I admire. And I don't think he brought a lot of emotion to his speeches about the French language. And today, again, with this motion, he was a bit vague. I respect my friends from the Bloc Québécois, but I wonder why they keep supporting the Conservatives. I wonder if in the new year there's going to be some kind of merger between the Bloc Québécois and the Conservatives. Is there going to be some kind of agreement between Mr. Blanchet and Mr. O'Toole? it's becoming clearer and clearer that the Bloc Québécois, well, they love everyone, they want to help everyone, but if you look closely, that's what they say, but if you look closely what they're doing in health, the Conservatives rather, if you actually look what they did, they made cuts in healthcare when they were in power. And it's our government that came in to increase healthcare spending. We're continuing to invest not just in the agreement, but also in other areas that are important for Canadians. So once again, I am a little concerned about where the Bloc Québécois is going. And when I think about what the Conservatives did when they were in power, for example, in 2012, the Minister of Health of Ontario said,
Offer. Our Christmas present this year is a lump of coal. Ça, c'était le gouvernement de l'Ontario qui dit à une approche unilatérale du gouvernement conservateur. Donc, quand on parle des juridictions, tout à coup, c'est différent. Mais écoutez, notre gouvernement, c'est un gouvernement national. On est là pour tout.
Our government is a national government. We are there for all Canadians. We are there for families, organizations. We are there for everyone throughout Canada. And we will be there to ensure that there are standards that are acceptable, whether it is a senior in Quebec or Alberta, in Nova Scotia or New Brunswick. All of these seniors will be able to be respected and have their rights followed and respected. Thank you, Mr. Speaker. Questions and comments. The Honourable Member for Salaberry-sur-Roi. Thank you very much, Mr. Speaker. I'd like to thank my colleague for his speech. Well, it's true that we need standards. But we need Quebec national standards. Standards for the Quebec nation, and each province has its own standards, given the situation on the ground, the specific situation on the ground. So I don't agree with my colleague. I don't agree with my colleague when he says that it's the Bloc Québécois that wants this. No, all the provinces agree. They've all asked the federal government to respect their area of jurisdiction and to transfer the money so that health services in the provinces can be offered appropriately. Why is he continuing to want to interfere in areas of provincial jurisdiction? It's clearly described in the Canadian Constitution. Why doesn't my colleague seem to care about this? The Honourable Parliamentary Secretary. I'd like to thank my colleague. There is a very important question that she asked, and I would like to address her question. Whether it's about seniors or youth, it's important to have quality standards, regardless of what part of the country that person is. We need to help them. And we need to have a minimum level of standards. If Quebec wants to go farther, then that's perfect, that's fine. But there needs to be a minimum level of care and standards. The interpreter would like to mention that there is a second voice speaking. When it comes to standards in long-term care, well, we need to respect provincial jurisdiction. I'm not saying that we should not respect provincial jurisdiction, but it's important to have standards that extend throughout Canada, which is one Canada for all Canadians.
And by video conference, the Honourable Member for Hamilton Mountain.
Thanks, Mr. Speaker. And I wanted to tell my friend I appreciate his speech. I was very interested in his first part, Mr. Speaker, when he talked about the programs that his government has implemented to the seniors and people with disabilities. So on the first wave, they've made small payments. Now that we're in the second wave, does his government plan to have any plan at all to make additional second wave payments to help our seniors and people with disabilities? And when will this happen?
Honourable Parliamentary Secretary to the Minister of Veterans Affairs.
Thank you, Mr. Speaker. I want to thank my colleague, which I know very well, for his important question. But I appreciate his question, and we need to continue to invest in Canadians. We need to continue to invest in seniors as well. There's no question about that. But, you know, we're looking at the Conservative who are quick to say we're spending too much money. There's not enough money. We need to make sure that Canadians are safe. And that's essential. And we need to invest in Canadians. And we will continue. We did build programs the first wave, and now we are, as the Minister of Finance explained yesterday, we are working on support for second wave. She described some of the initiatives that we would be coming forward on. And of course, seniors is a top priority to discuss how we can support them. Thank you.
Il y aura le temps pour une brève question.
We have time for one more brief question. Question and comments. No, resuming debate. The Honourable Parliamentary Secretary to the Minister of Small Business. Thank you very much, Mr. Speaker. Canadians are very proud of their public health care system. In Quebec, we are very lucky to have one of the most progressive and comprehensive systems in the country. Now, when it comes to Quebec and provincial jurisdiction in healthcare, before discussing that, I would like to speak to our healthcare workers. We've heard a lot of numbers of cases, sums of money, and I'll speak of that a little later. But we need to remember that our healthcare system is composed of human beings, men and women, Quebecers, Canadians. I'm thinking of those who are working in free tracing centers in Outremont, Côte-Neige, and in the Mile End neighborhood, as well as the staff at the CHUM Hospital, Hospital Sainte-Justine, the Jewish General, and St. Mary's. I'm talking about nurses who work day and night, doctors, surgeons, orderlies, receptionists, those who clean and cook. They are all tired. They've been facing a health crisis for 9 months. We recognize their hard work. And their requests for more resources are extremely legitimate. And that is why the federal government has set aside $3 billion to increase the wages of our essential workers. There are 4 clauses in the motion before us. I don't think many colleagues here would have any issue with the 3 first clauses, Mr. Speaker. I would never miss an opportunity to pay tribute to our frontline workers and recall the sacrifices they've made and continue to make. But when it comes to the 4th clause, Mr. Speaker, which essentially asks us to provide a blank check to the provinces, I have serious questions about that. Our government wants to work closely with the National Assembly of Quebec, as well as all provincial and territorial governments, to increase access to care for all. With that in mind, our government has announced that we will be launching negotiations with the provinces on healthcare. A meeting has been organized on the 10th of December, so in only 9 days. The COVID-19 pandemic has brought to light the importance of having a solid, resilient health system. The pandemic showed that the system needs to be more flexible in order to help people in their homes and communities. The Government of Canada has committed to working in partnership with the provinces and territories to strengthen healthcare, thanks to targeted investment in virtual care, home care, long-term care, in the community, as well as investing in mental health and addiction services. A pan-Canadian effort to offer better care to Canadians, Mr. Speaker. We're talking about unprecedented collaboration between the different levels of government. Over the last 9 months, Mr. Speaker, the federal government offered direct support to provinces totaling more than $24 billion. $24 billion in 9 months from the federal coffers transferred to provincial governments. In fact, if we take all the programs and not just transfers to provinces, over the last 9 months, the federal government has provided nearly 85% of the funding to support Canadians, including, of course, Quebecers, in fighting this pandemic. That also includes more than $25 billion specifically allocated to fight COVID-19, protect the health of Canadians, and promote a safe recovery. I'm talking about $4 billion for PPE purchases, more than $4 billion to help provinces increase their tracing capacity, $2.3 billion for public transit in our municipalities, more than $1 billion for medical research, and much, much more. Mr. Speaker, as a mother, I would also like to underscore the transfer of $2 billion to the provinces for a safe return to school. Half of this was transferred in September. We often hear arguments about the fact that provinces should have exclusive jurisdiction on education. And yet, I didn't hear much about that transfer, which does come with certain conditions. These targeted investments, Mr. Speaker, are accompanied by the funding that our government already provided to provinces and territories through the Canada Health Transfer, CHT. In 2020-21, the government will transfer nearly $42 billion to the transfer to support the provincial and territorial health systems, for a total of more than $200 billion over the next 5 years. And we should also recall the nearly $20 billion invested under the Safe Recovery Agreement. Once again, these are investments from the coffers of the federal government, and they have increased our government's health transfers to provinces by more than 23% compared to just the Canada Health Transfer. An increase of 23%, Mr. Speaker. By targeting investments to specific priorities, our government is helping the provinces broaden access to services where they are most needful. For example, we know that the pandemic has led to a mental health crisis. Our government is investing in addiction and mental health services to help the provinces implement initiatives that will broaden access for children and youth to community mental health and addiction services, raise awareness of community models for mental health care based on evidence and culturally appropriate response models integrated to primary health services, and increase the availability of community services, integrated community services for healthcare and addiction for people with complex health needs. Canadians expect the government to offer them collective, concrete results. As a result, the Ministers of Health have committed to measure performance and be transparent about the results that these investments enable us to obtain. Once again, we have worked in collaboration with the Government of Quebec. We have developed clear conditions and targets. Bilateral agreements with the provinces are a targeted way of concentrating efforts on the parts of the health system where resources are the most needful. Our targeted investments will contribute to enabling healthcare to become sustainable in the long term. And bilateral agreements on virtual care will assist provinces and territories in speeding up their work to face COVID-19. In addition to these initiatives, our government will work closely with the provinces and territories in order to improve access to family doctors and primary care teams, to increase virtual care capacity, and to strengthen the health insurance regime. Mr. Speaker, we are looking forward to continuing to work with the Government of Quebec and all provincial governments to bring significant changes to our health systems in order to better support Canadians from coast to coast to coast. Thank you.
Questions et commentaires?
Questions and comments. The Honourable Member for Drummond. Thank you very much. I'd like to thank my colleague for Outremont for her speech. I must say that I was shocked when I heard it on several occasions. Not only does this government openly admit to interfering with areas of provincial jurisdiction, but it almost seems proud of it. The province's request for health transfers, it's not a matter of the provinces begging for assistance. It's something that they are owed. My colleague talked about a blank check. She seems to think that conditions should be attached to this money. But no, this money is what the provinces need to manage their health system. It's part of an agreement that's at the very basis of your federation. I'm practically speechless. I'd like to ask my colleague to comment, as I asked my colleague from the bloc earlier. The Minister of Health of Ontario said that under the leadership of François Legault, the provinces are in a better position, and that it would be a good idea if the bloc motion was adopted. That's extraordinary coming from the Minister of Health of Ontario, and it shows that all of the province don't want to see interference in the area of health. The Honourable Parliamentary Secretary. Thank you, Mr. Speaker. I would remind my colleague that in the federal government, well, really for all of us, we need to read the Canada Health Act and really understand it. As a federal government, we have responsibilities in health as well as the provincial governments. We need to work closely with other levels of government. Yes, that's true. But the federal government also has obligations under federal legislation. The time for question and comments is over for now. There will be 3 more minutes for the honourable member when debate resumes on this motion. And now we will move on to member statements.
On va commencer avec l'honorable député de Vaudreuil.
The honourable member for Vaudreuil-Soulanges by distance. Thank you very much, Mr. Speaker. Today, during the 16 days of activism against sex-based violence, or gender-based violence, rather, I want to highlight the impact that the pandemic has had on victims of domestic violence. A number of women's shelters like La Passerelle in my riding of Vaudreuil-Soulanges have had an increased number of requests for their services since the pandemic began. This means that more women and children are looking for help in order to find to get out of dangerous situations.
Report, which showed that there was an increase in calls for wellness checks and domestic disturbances. We know that social isolation and unstable employment situations increase the instances of domestic violence and that the majority continue to suffer in silence. Je veux donc remercier l'équipe à la...
I want to thank the team at La Passerelle for their important work for our community. I encourage the people in my riding to support them in their mission. Together we can spread the word and put an end to domestic violence. Thank you.
The honourable member for Richmond Centre.
On November 27, I witnessed the delivery of 450 high-quality winter jackets by Chi Foundation Canada CEO David Tan to the Aboriginal Mother Centre Society, AMCS, in East Vancouver. Tamora Galvins, the executive director of AMCS, this donation was timely. Their society has been moving mothers and children at risk off the streets and providing them with all the support they need under one roof. Through my connection, Charlestown, a garment factory owner, donated a total of 182 boxes of clothes for Chi to reach different nations. Besides AMCS, brand new winter jackets are also delivered to Native AIDS Health Centre in Vancouver, Liwet Nation in Mount Currie, Summers First Nation in Abbotsford, and Seabird Island Band in Agassiz. Chi has been serving these nations well in different capacities. A big thank you to you all. Merci beaucoup.
The honourable member for Vancouver Centre.
Mr. Speaker, on World AIDS Day, I honour a Canadian hero who 30 years ago turned tragedy into hope. During the AIDS pandemic, Dr. Peter Jepson Young, a young Vancouver physician, contracted AIDS. Instead of submitting to fear, he chose to shed a light on the deadly disease through a CBC series, The Dr. Peter Diaries. From 1990 until his death in 1992, for 111 episodes, Canadians glued to our TVs shared Dr. Peter's pain, watched the disease devastate his body, listened as he explained every stage in clear detail with candor and humor. Nominated for an Academy Award, Dr. Peter Diaries fought stereotypes and broke down the social taboos around HIV/AIDS, shaping how Canadians perceived and understood the disease and those who suffered it. Dr. Peter's legacy lives on in the work of the Dr. Peter Centre in Vancouver, one of the world's most progressive care facilities for persons with HIV/AIDS.
The Honourable Member for Drummond. Mr. Speaker, I have the honour of marking the birthdays of two new centenarians. The younger of the two, James W. Price, will blow out his 100 candles on December 30th. Mr. Price was born in Cape Breton and came to Drummondville when he was 8. He worked for 45 years at La Celanise, which was a textile company in the region. He still lives in his home, and he goes out to get some air every day. And today, Mr. Speaker, is the birthday of Yvette Mathieu Lafonde. She lived and raised her family in Saint-Cyril, where she was a teacher for 33 years. She lives with her daughter, Denise, who gives her a little hand. I had the pleasure of her company last Friday. I could have spent all day listening to her tell me stories about her life. No doubt that's why we have already agreed to see each other next year. Mr. Price and Ms. Mathieu Lafonde aren't old. They have just become young, longer than we have been, and I want to wish them the happiest birthdays. The Honourable Member for Châteauguay-Lacolle. Thank you, Mr. Speaker. We are in the midst of the international campaign. It's an annual 16-day campaign of activism against gender-based violence. This campaign will end on December 6th, which is the anniversary of the sad events that occurred at the Polytechnic in Montreal. I want to take this opportunity to highlight the excellent work being done on the ground by thousands of community organizations across the country who are fighting to put an end to gender-based violence. Everyone is entitled to live in a world without violence. Victims need support and assistance. I want to take this opportunity to thank the organizations in Châteauguay-Lacolle, like Espace Châteauguay, Les Calacs, and the Ressource Shelter. Thank you, Mr. Speaker.
Honourable Member for Elgin, Middlesex, London.
Mr. Speaker, Christmas cheer, community spirit, and a creative alternative to our traditional holiday parades are needed more than ever this year. I am ecstatic to share with residents of Elgin, Middlesex, London, a Thrill of Hope stationary Christmas park parade in partnership with MPP Jeff Urich. A Thrill of Hope will be taking place in St. Thomas's Pinafore Park on December 4th, 5th, and 6th from 4 p.m. till 9 p.m. nightly. This event will bring together community groups, businesses, and service clubs from across Elgin, Middlesex, London to install lit-up floats or stationary displays along the roadway in Pinafore Park that the community can drive by and enjoy. For residents who don't have a vehicle, a safe shuttle service will be available at the Queso station. There will be a collection of non-perishable food and monetary donations that will be distributed across the riding. Our event has been planned and approved by the Southwestern Ontario Public Health and will be in regular contact with them going on. A huge thank you to our planning committee, volunteers, the St. Thomas Optimist Club, Mayor Joe Preston, and all of the others for all of your work. I'm very excited to be sharing this with all the constituents of Elgin, Middlesex, London, the Thrill of Hope. Thank you very much, Mr. Speaker.
The Honourable Member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Speaker, I stand in the House today to honour the exceptional work of Sean Eckford, who has made extraordinary contributions to our community and country throughout his decades-long broadcasting and journalism career. Sean consistently provides residents on the Sunshine Coast and beyond with quality reporting and reliable information that is trusted and appreciated by all. From his early days at the CBC covering Parliament Hill to his managerial role at Coast FM and his more recent tenure at the Coast Reporter, Sean has for so long been an important fixture of our community. His integrity, sincerity, and depth of knowledge is an example for fellow journalists, politicians, and citizens. The relationship between the press and our elected officials is a pillar of our political discourse and democracy, accurate, fair, and rigorous journalism is more important than ever, and Sean's career epitomized that ethos. Sean, thank you for serving our community and country. Wishing you a well-deserved retirement.
The Honourable Member for Guelph.
Mr. Speaker, I rise to celebrate the achievements of one of Guelph's and Canada's most prolific authors, Thomas King, who recently was named a Companion of the Order of Canada for his enduring contributions to the preservation and recognition of Indigenous culture. His work is regularly recognized as part of the Canada Reads and Indigenous Reads programs, including his latest book, Indians on Vacation. As the holiday season approaches, I want to encourage all Canadians to support the work of Canadian authors and illustrators like Tom by supporting our incredible independent bookstores. Let's shop local and read Canadian. Thank you, Mr. Speaker.
The Honourable Member for Grand Prairie, Mackenzie.
Mr. Speaker, for many, it's been a tough year. Too many families across the Peace Country have suffered the pain of financial loss and loneliness over the past months. I've heard stories of families facing this Christmas season without a loved one lost to suicide or overdose. I spent hours with moms and dads who have lost their jobs or their businesses or had crop failure. They don't know how they're going to pay the bills, never mind buy Christmas gifts for the kids. For many, it feels hopeless. But I believe that there's reason for hope, because in these dark and challenging times, I've also witnessed the selfless giving of people who are struggling themselves. I've seen the ingenuity and the creativity of small business owners who have struggled back with the help of their neighbors and even competitors to build opportunities for others. I've seen churches and service clubs who have found ways to make connections with the lonely, the hungry, and the heartbroken. Mr. Speaker, this Christmas season, I have hope for the Peace Country because the people who call our region home.
The Honourable Member for Whitby.
Mr. Speaker, over this past summer, a senseless act of violence occurred in my riding of Whitby. Kimberly was out for an evening walk and was brutally attacked and beaten to within an inch of her life. Our community was shocked and devastated by this senseless act of random violence. As a community, we stand together against gender-based violence. We stand together to support Kimberly, her family and friends, and all others that have been victims of gender-based violence. I'm truly proud to see how our community has come together to support Kimberly and her family, and I'm in awe of the grace and resilience displayed by her. When I spoke to Kimberly about this incident, she wanted only good to come of what happened to her. Mr. Speaker, sadly, incidents like the one that Kimberly went through remind us that gender-based violence remains a major problem in this country. And I believe we all have a part to play in ending gender-based violence, including and especially men who must take an active role in combating gender-based violence. Our government has developed the first ever national action plan on gender-based violence, and I know this week is the 16 days of activism to end gender-based violence. I encourage all Canadians to get involved in helping end gender-based violence. Thank you, Mr. Speaker.
The Honourable Member for Lakeland.
Mr. Speaker, Lisa Freeman's father was murdered 30 years ago. The violent killer was given life in prison, but in March, Lisa found out he could be released this fall. She relived the pain to prepare a victim's statement for the unexpected parole hearing, but a lack of action for victims' rights stole her chance to face him. A private member's bill spearheaded by our colleague from Oshawa will be tabled today in the Senate by Senator Boisvenu. Both tireless advocates for victims' rights in Canada. It would give transparency to victims' families who are often left out of the loop or find out at the last minute about parole requests and hearing dates. The Victims' Bill of Rights says victims and families have the right to know about and to attend parole hearings, but the system puts up roadblocks. Murderers and rapists are given the privilege, but victims' families are treated like a second thought. That's backwards. Lisa says, quote, "The system will bring you to your knees." Like so many others across Canada, she wants to be seen and to be heard about something that impacts her whole life. Victims and their loved ones should not be casualties of the system. Let's work to put them first.
The Honourable Member for Southwark, Interlake Eastman.
Mr. Speaker, today I pay tribute to one of our fallen heroes, Private John Lambert.
This brave young man wanted to serve so badly that he lied about his age to enlist with the Newfoundland Regiment when he was only 16. He fought throughout Europe during the First World War and made the ultimate sacrifice, dying in the Battle of Langemarck at the young age of 17. However, like so many others, his body was not recovered and identified. During an archaeological dig in Belgium in 2016, a soldier's remains were discovered. Thanks to modern technology and DNA sampling, the remains were identified as those of Private John Lambert. This young man died a hero, and it is only fitting that he has now been laid to rest alongside his fellow soldiers at the Commonwealth War Grave, New Irish Farm Cemetery in Belgium. In sharing Private Lambert's story, we remember the service and sacrifice of all our fallen heroes. May they rest in peace.
Before we go to the next SO31, I just want to remind the honourable members that people are speaking, and I realize that it's COVID and we're 6 feet apart, so we have to speak a little bit louder to hear each other. But please, let's show some respect for the person who's speaking. The honourable member for Esquimalt Saanich Sooke.
Mr. Speaker, today marks World AIDS Day. Let us unite again to fight HIV/AIDS, to show support for people living with HIV, and to commemorate the many who have died from AIDS-related illnesses. A future with zero new HIV infections is in reach, something as a gay man of a certain age I never thought I'd see. Knowledge is the key to eliminating the spread of HIV. People who know their status are far less likely to spread the virus, and that makes self-testing a crucial factor in HIV prevention. Now that Canada has finally approved self-test kits, the government must ensure that Indigenous, racialized, low-income people and those who live in rural and northern communities actually have access to these kits. Improving access to the most marginalized and those who face the largest barriers to testing and treatment is the only way for Canada to meet its commitment to the UN AIDS 90-90-90 goals and the only way to eradicate HIV once and for all.
The Honourable Member for Manicouagan. Mr. Speaker, on behalf of the Bloc Québécois, I offer a hearty congratulations to the member for Salaberry-Sarrois for having received the Marie-Victoire Félix de Michel Prize during the 2020 Gala for the Rassemblement pour un pays souverain. This shows her commitment because it is a commitment, if not a gift of oneself, but a deliberate and necessary choice to unconditionally invest oneself in putting words into action and getting involved in something outside of ourselves. She embodies perseverance. She has walked towards love, like Miron, the writer, wrote. She is this movement which does not submit to the passage of time, but harnesses the horizon in order to push forward. She is full of humility, the silence that she gives space to others to allow them to fully exist. She is welcoming and unifying. She is with us in this country that we still have left to do. Thank you.
The honourable member for Battlefords Lloydminster.
Mr. Speaker, COVID-19 is taking a heavy toll on the mental health and the well-being of Canada's seniors. Temporary measures to protect our vulnerable populations have become less and less temporary. Seniors have been distanced from their loved ones. Many have missed birthdays, holidays, and family milestones. They want their lives back. Canadians want their lives back. To accomplish that, we know that we need rapid and mass testing, and we need safe and effective vaccines. Yet yesterday's fall economic statement offered them no real plan for testings or vaccine. There was no clarity, there was no timelines, and there was no plan for safe family reunification. Mr. Speaker, the Christmas holidays are just around the corner, and seniors who are waiting to hold their grandbabies in their arms, they deserve better. They deserve certainty, clarity, and competence from this government. They deserve a real plan.
The Honourable Member for Hochelaga. Thank you, Mr. Speaker. I'm a bit surprised to see how in recent weeks the Conservatives are trying to improve their image with women. It will take more than words to convince us women of that. I would like to mention certain facts. When we introduced wage equity legislation. The Conservatives voted against it. When we proposed historic funding to strengthen the women's movement, they also voted against it. In the recent platform of the Conservative leader, the word gender is absent. And when women are mentioned, it's almost exclusively as mothers and not as women entrepreneurs or those who contribute to the labor market. In addition, the Conservative leader has frequently highlighted the fact that he would not prevent his MPs from tabling anti-abortion legislation. On this side of the House, Mr. Speaker, we know that decisions about reproduction belong to women. Women know that the only party that proposes progressive, feminist policies and that always stands up for women's rights is our government. Thank you, Mr. Speaker.
Before we move on to the next stage, I'd like to remind members who are virtual to use a microphone.
Are joining us who are virtual, whether they're asking questions or answering the question. Now, we want to make sure that everyone hears it and that it's translated, interpreted correctly. So please use House-approved microphones and headsets. Thank you. Oral questions. Coral, yes. It's a Freudian slip if I ever heard one. Oral questions, question orale, the Honourable Leader of the Opposition.
Mr. Speaker, the general in charge of vaccine distribution in the United States said that all Americans will be vaccinated by June. The Prime Minister has suggested that only a few Canadians will be vaccinated by September. This morning, the Deputy Prime Minister said she hoped vaccinations would start by the summer. Why can't this government give Canadians any certainty on what date they will first have access to a COVID-19 vaccine?
The Honourable Minister.
Mr. Speaker, this government worked hard throughout the summer and secured access to tens of millions of doses of vaccines for Canadians. We have the most diverse portfolio of potential vaccines of anyone because there is right now no effective vaccine against COVID-19. Countries around the world are working to approve many of the promising candidates, but we don't know which one is going to be most effective, which ones are going to arrive quickly. That's why we secured as a government access to the largest range of vaccines and more vaccines per capita potentially than any other country. We are
The Honourable Leader of the Opposition.
Mr. Speaker, the Prime Minister is responsible for presenting a comprehensive plan for vaccine distribution for Canadians. So far, all we get are Liberal buzzwords like a robust portfolio and no details. 7 months ago, the Prime Minister announced with great fanfare their joint venture on a vaccine with China. Now, the China deal fell apart at the end of the summer, and since then, they've been scrambling to come up with plans for a vaccine. Why did the Prime Minister put the lives of Canadians in the hands of communist China when it came to a COVID vaccine?
The Right Honourable Prime Minister.
Mr. Speaker, the Leader of the Opposition shouldn't just make stuff up. The fact is that we secured contracts for vaccines in August. And right now, we are moving forward with the approvals for 4 different vaccines, Pfizer, Moderna, AstraZeneca, and now Johnson & Johnson at Health Canada, so that we can be sure that as soon as those vaccines arrive, we will be able to deliver them to Canadians. We know we need to get through this with vaccines, and that's why this government has worked hard to ensure vaccines are there for Canadians.
The Honourable Leader of the Opposition.
Mr. Speaker, it is time for the Prime Minister to be honest with Canadians. Last May, they announced a joint venture with China, the CanSino deal. That was going to be their major vaccine distribution plan for Canada. That deal fell apart in August, Mr. Speaker, and then in September, they changed the regulatory structure and started dealing with Moderna and all the other companies. So my question for the Prime Minister, it is time for truth. Why did the Prime Minister put all of our vaccine eggs in the communist China basket?
Right Honourable Prime Minister.
Again, Mr. Speaker, that is simply not true. We worked, as Canadians would expect us to cover all the bases, to try and reach out to get the most diverse portfolio of vaccine candidates of any country around the world, and we did. Some of them didn't pan out, but many others have. That's why the 4 top vaccines around the world are now currently in regulatory approval from Health Canada, and we have secured tens of millions of doses of those vaccines. That's the work this government is doing. That's the plan we're delivering on.
The Honourable Leader of the Opposition.
Monsieur le Président.
Mr. Speaker, France announced that it would be vaccinating its entire population by June. The same thing in the U.S. This morning, the Deputy Prime Minister announced that only a few Canadians will be vaccinated by the summer. The delays by this government are endangering people's lives, and Canadians want a plan. Where is the plan for the distribution of vaccines? Who will be vaccinated first and when? The Right Honourable Prime Minister. Mr. Speaker, we are working with the provinces and experts, and have been since last spring. First of all, to sign vaccine contracts and to ensure an appropriate delivery of vaccines as quickly as possible. We will continue to do so. As experts have said, we expect to have the majority of Canadians vaccinated before September 2021. We hope to have more done prior to that. The Honourable Leader of the Opposition. Mr. Speaker, this week CNN disclosed that China hid the truth surrounding COVID, and the Liberal government is so pro-China that they decided to work with the country in order on a vaccine. And that plan fell apart. Can the government and will the Prime Minister admit that we don't have a vaccination because of Canada's partnership with China? The Right Honourable Prime Minister. Mr. Speaker, the Conservatives once again are playing political games. No one in the world has an approved vaccine. We are all working on different candidates, and there are 4 that are currently in the regulatory process with Health Canada. Yes, there was a partnership with CanSino that was extremely effective in the past on Ebola, and it was something we looked at. We have agreements with 7 different companies across the world. They will deliver vaccines for Canadians in the future. The Honourable Member for Belleuil-Chambly. Thank you, Mr. Speaker. I have a surprise for the government. We did crunch some numbers, and health is a provincial jurisdiction. The Quebec and the provinces have put forth unanimous asks on issues with respect to the transfers, which are critical for taking care of the most vulnerable people. Now, the Prime Minister has postponed his meeting with the provincial premiers until December 10th, and it's really good because after that, the Parliament won't even be sitting. So what proposals does the Prime Minister have for the provinces? Isn't he going to go there empty-handed? The Right Honourable Prime Minister. Mr. Speaker, for 10 months now, we have been working hand in hand with the provinces to help them with their health systems, be it through the Red Cross, with the Canadian Armed Forces, the billions of dollars that we transferred to help the provinces with their health systems during the pandemic. We will continue to do so. At the same time, I will be speaking with the premiers and not with political party leaders. The Honourable Member. True, we're just elected officials in the House of Commons. Now, the Prime Minister keeps saying, look, I've respected provincial jurisdiction. However, this morning, the Minister from Quebec, with respect to national standards, said it was unacceptable for Quebec and the provinces. With respect to daycare and pharmacare, he said he would be seeking to opt out with compensation. So that's not working exactly the way the Prime Minister wants us to believe. We're talking about health and human lives. Does the Prime Minister will the Prime Minister acknowledge that he will authorize this opting out? The Right Honourable Prime Minister. Mr. Speaker, there is no jurisdiction when it comes to the dignity and the lives of our seniors. We're going to all work together to protect our seniors. What we saw in the spring across the country, including in Quebec, was unacceptable. What happened in the long-term care facilities, that's why the federal government worked with the province, with all provinces, so that they could take control over the system and be there to help seniors. We will always work to protect seniors, regardless of where they live across the country, because that's what Canadians expect us to do. The Honourable Member for Burnaby South.
We all know that seniors have been particularly hard hit by COVID-19, not just because they're vulnerable, but also because of the isolation. Many seniors have seen their programs canceled and they can't come together and connect the way they usually were able to. Now, we know that the medical experts are saying that there's enough COVID vaccines to cover about 3 million Canadians. There are over 4.5 million seniors over the age of 70. So what's the plan? Which seniors will get the vaccine and which will have to wait?
Right Honourable Prime Minister.
Mr. Speaker, every step of the way we have worked with health experts and scientists to determine the prioritization of vaccines on the rollout. We need to get to the most vulnerable. We need to get to our frontline healthcare workers, and that is exactly what we're going to do. We're working with the provinces on establishing that list, but I can tell you that the vaccines that are coming in are going to go to those people who most need them most urgently. And because Canada has secured tens of millions of doses of the vaccines, we will ensure that everyone gets vaccines in the coming months.
Member for Burnaby South.
Thank you, Mr. Speaker. Mr. Speaker, the Shamattawa First Nations community in northern Manitoba is faced with a COVID-19 outbreak, and they are in urgent need of help. They're already dealing with a housing crisis and TB. Like many other remote and northern Indigenous communities, they have underfunding, under-resourcing, and a lack of access to basic things like the internet to deal with. The chief has asked for military to be sent to the First Nation, to provide testing, tracing, and safety measures. Will the Prime Minister heed the call of the chief and send in the military supports that they need?
Honourable Prime Minister.
From the very beginning of this pandemic, we've worked closely with Indigenous communities and Indigenous leadership across this country to ensure that they have everything they need. We saw the first wave hit far less hard in Indigenous communities than in many other communities because of the leadership of Indigenous communities and the partnership that we've been able to establish with them. We will continue to work with local and territorial governments as well as remote communities to ensure that everything they have, they need.
The Honourable Member for Carleton.
Canadians want their lives back. But yesterday, they got no plan to fix the vaccine mess that this government has made. They want paychecks, but instead yesterday they just got more credit card bills. The national credit card will grow by $10,000 per man, woman, and child in Canada. The deficit is 8 times bigger than the previous all-time record, bigger than any other country in the G20. And yet, we won't have vaccines before billions of other people have them. The only way to get Canadians safely back to work and paychecks in their pockets is a vaccine. When will every Canadian who wants one have one?
The Honourable Deputy Prime Minister.
Mr. Speaker, the leader of the official opposition claims to believe in unions and in supporting union workers. So I'm sure the Conservatives will be interested in what the Teamsters had to say about our fall economic statement. And I quote, "Today's numbers show that Ottawa is dead serious about supporting working class and middle class Canadians through this terrible crisis. The pandemic is sadly far from over, and over the coming months, continued government spending will be the only thing keeping millions of honest, hard-working families from total ruin." I couldn't have...
The Honourable Member for Carleton.
Monsieur le Président, la question c'était pas...
Mr. Speaker, the question was when? When will Canadians have access to a vaccination? The only way to deliver paychecks safely to people is if they're protected. and vaccinated if they choose to be vaccinated. So, Mr. Speaker, with the highest deficit in the history of this country, the biggest credit card bill, will the government finally tell us when Canadians will have access to a vaccine? The Honourable Deputy Prime Minister.
Start by setting the record straight on what I said about vaccines this morning, since the Leader of the Official Opposition misconstrued my words, something which is becoming a bad habit of his. As Moderna's Chief Medical Officer said this week, and I quote, "Canada is in the front row on vaccines. I know that, and I know our rollout will be a success." And since the Leader of the Official Opposition mentioned France, let me inform him that the EU said this week their regulators will not take a decision on Pfizer until December 29th, on Moderna not until July 12th.
L'honorable député.
The Honourable Member for Mégantic-L'Érable. Madam Speaker, now on the other side they like to lecture, but what was presented yesterday is a political statement, not an economic one. But Canadians won't be fooled. They understood that, Mr. Speaker. An unprecedented deficit and is, and I quote Emmanuel Latraverse, a reflection of the Trudeau government's ideology. It's certainly an electoral deficit. Canadians want concrete answers, not a list of election promises. It looks like a Christmas list. When will we see a vaccination plan? When will we see a clear plan? The Honourable Deputy Prime Minister. Mr. Speaker, when will the Conservatives have a financial plan, a clear and defined plan? On Sunday at Tout le monde en parle, the Leader of the Opposition assured Canadians that he would provide the same level of support that we have provided under a Conservative government. So, what do the Conservatives really believe?
Le député de Mégantic-L'Érable.
The Honourable Member. Mr. Speaker, the economic statement is disappointing. There's a lack of certainty around vaccines. There's lack of clarity for budgets. It shows a flagrant lack of skills for economic recovery. And above all, it shows the Liberals have lost control over public finances. The minister says she put in place fiscal safeguards, but she's careful not to protect Canadians from her reckless spending. When will we have a plan with dates? The Honourable Deputy Prime Minister. Mr. Speaker, allow me to remind the member opposite that our approach has already enabled us to create jobs. Many of the jobs were recovered. Jobs lost during the pandemic. Compared to the United States, we're doing far better. Canada, in the third quarter, had the highest rate of growth. And that is a success story, Mr. Speaker.
For Calgary Nose Hill.
Mr. Speaker, today the Prime Minister said that it would be September before most Canadians would be able to get a COVID-19 vaccine. But the Minister of Intergovernmental Affairs said early January and then just January. And today the Deputy Prime Minister said before the summer. So my question is to the Health Minister. Is she content to keep letting her colleagues give their best guess on a very important issue to Canadians, or will she finally take responsibility and give us an actual date?
Minister of Health.
Mr. Speaker, every step of the way, my colleagues and I have worked incredibly hard, hand in glove with provinces and territories to A, secure the best portfolio of vaccines in the world, B, to secure the most doses per capita in the world, and C, to strengthen the regulatory process at Health Canada to give them every opportunity, every resource they need to accelerate their work. Mr. Speaker, Canadians should be proud and confident we have a plan, and they too will get vaccinated when the vaccines are proven to be safe and effective.
Member for Calgary Nose Hill.
So the answer is no. So the Prime Minister said September for vaccine delivery. The Minister of Intergovernmental Affairs said January or early January. The Minister of Procurement said the new year. The Deputy Prime Minister said before summer. And today, the Health Minister said early 2021. COVID-19 is a deadly disease that is crippling our economy. Why is the Health Minister content to keep allowing her and her colleagues to play vaccine date bingo with Canadian lives?
Minister.
Mr. Speaker, I'd invite the member opposite to get a briefing on vaccine work, as I've repeatedly offered her on testing. In fact, her remarks indicate that she doesn't understand how many moving parts there are in vaccine delivery. But I want to say this to Canadians.
Minister, I'm very interested in hearing the response, just like I'm interested in hearing the questions. Just when it gets loud, it makes it very difficult for everyone to hear. So I just want to remind everyone that we want to hear the answers and the questions. I'm sure the honourable members want to hear what I'm saying, correct? I'll just wait for him to stop. Okay, good. We're done? Thank you. Okay, Madam Minister, you can continue.
Thank you, Mr. Speaker. As I was saying, look, we have the best portfolio of vaccines in the world. We have the most doses per capita in the world. We're working hand in glove with companies like Pfizer, Moderna, Johnson & Johnson, AstraZeneca. In fact, we were the first country in the world to receive applications from the 4 leading companies. You know why, Mr. Speaker? Because our Health Canada regulators are gold standard. The world looks to Canada for safety and efficacy, and we are here for Canadians.
The Honourable Member for Shefford. Mr. Speaker, in the midst of a pandemic, how can you write a 259-page economic statement without mentioning seniors? There's not a measure in there for them when they're the most affected by the pandemic. No health transfer when Quebec needs money to support quality of care. No pension increase to support their purchasing power. Not even a second installment of the special payment when we know that the pandemic will last another year because vaccines will arrive late. How can the government justify this to seniors? The Honourable Deputy Prime Minister. From the outset, we have worked with the provinces and territories to protect Canada's most vulnerable by supporting the work of the Red Cross and by deploying members of the Canadian Armed Forces to some long-term care facilities. In the economic statement, we committed up to $1 billion for safety in long-term care facilities to continue to help the provinces and territories protect our seniors. The Honourable Member. Mr. Speaker, I was talking about more money in seniors' pockets, at least in the throne speech. The government had raised the possibility of increasing the old age pension. That wasn't enough, but at least the possibility existed. Today, not a word for seniors in the economic update. The Liberals let them down. Seniors are the ones who suffer the most from COVID. They're the ones dying from it. They're the ones who suffered the harshest confinement measures. They're the ones who are going to be spending Christmas alone this year to protect themselves. How can the government abandon them today? The Honourable Minister.
Speaker, for many months, we've been providing support for seniors through tax-free payments and enhanced community supports. The fall economic statement reiterated our government's support for seniors by establishing a new $1 billion safe long-term care fund that will help provinces and territories protect seniors in long-term care. We're also committing $38.5 million to support training up to 4,000 personal support worker interns. And we'll move forward in establishing the foundational elements of a national universal pharmacare. It's clear that we will always stand with seniors.
The Honourable Member for Charlebourg-Saint-Charles. Mr. Speaker, before the COVID crisis, the Prime Minister already demonstrated his inability to manage crises. And here's proof. On Friday, he said to everyone that by September, the majority of Canadians would be vaccinated. And I asked the Minister yesterday, does that mean 51%? And the Minister said we've got 70%. 70% of Canadians would be vaccinated. So can the Minister use some documents and show us how she arrived at that figure? Or did she improvise it during question period? The Honourable Minister.
Mr. President, nous travaillons fort.
Mr. Speaker, we are working hard to ensure that Canadians can be vaccinated when the time comes. When we have a vaccine in Canada, we are working with the provinces and the territories to create a distribution plan so that Canadians can be vaccinated. Our approach has always been guided by science, and nothing will change. In collaboration with experts like the Advisory Committee and other experts in public health, we will ensure that Canadians have a vaccine from COVID-19. The Honourable Member. Mr. Speaker, if we talk about planning, well, we can look at our allies. Yesterday, French CBC said in a report that Germany doesn't yet have a vaccine, but already has a very detailed logistics plan in place. They've presented it to their fellow citizens a couple of weeks ago. And it says that it'll take 2 minutes for each German citizen to be vaccinated. The Netherlands, Belgium and France are some of the other countries that have made their plans public. So we look ridiculous in the eyes of the world. When will we see a detailed plan? The Honourable Government House Leader. The Conservatives are playing partisan politics on vaccinations, and they're trying to make Canadians afraid, Mr. Speaker. That's unacceptable for months now, and they don't like to hear it either, but for months now we've been working with the provinces. We've been preparing the process for rolling out vaccines. We've appointed General Fortier. We are working together. They don't like to admit it, but we're going to be delivering the goods for Canadians.
Selkirk, Interlake, Eastman.
Well, Mr. Speaker, millions of people around the world will start getting vaccinated for COVID-19 next week. Canadians will be stuck at home watching it all happen on TV. The Liberals say they have a plan, but they're keeping everyone in the dark. Canadians deserve to know, Mr. Speaker, how many troops will be deployed to distribute COVID-19 vaccines? Who is the top logistics officer who will be in charge of this distribution? Where's the plan?
The Honourable Minister of Health.
Mr. Speaker, the member opposite, I understand, has a great deal of knowledge about the Canadian Armed Forces, and I want to say to him that he should be expecting the same level of excellence that he would have come to know during his time with the forces. We are so pleased that Major General Danny Fortin has embedded himself and his team within the Public Health Agency of Canada. This builds on the partnerships across the government to safely deploy vaccines. And, Mr. Speaker, I'll tell you this, we will not deploy vaccines until we're certain they're safe in Canada. That's the role of Health Canada. We're world-class regulators. Canadians can be confident in this.
The Honourable Member for Selkirk, Interlake, Eastman.
Mr. Speaker, I have confidence in the Canadian Armed Forces. I don't have confidence in this government. They say they have the plan, but it doesn't sound like they have a plan. How can Canadians trust this Liberal government when they refuse to answer simple questions? Canadians deserve answers, so I'll try this again. How many personnel are being trained to inoculate Canadians against COVID-19? How many military aircraft are ready to deploy to distribute these vaccines? Where's the plan?
Well, Minister.
Well, Mr. Speaker, the member opposite doesn't realize that actually immunization is done by provinces and territories. In fact, they have the jurisdiction to deliver health care, and the federal government is stepping up to help them in that responsibility by acquiring vaccines, by ensuring we have a logistical plan to deploy the complicated vaccines. But let me say this, Mr. Speaker, the provinces and territories have successfully, over the last few weeks, vaccinated 16 million Canadians for influenza. They have the expertise. They have the people to do that. We're going to support them.
Well, Member for Vancouver, Kingsway.
This week, the U.S. received vaccines on American soil, so they're ready to distribute once approved by the FDA. In contrast, Canada has either refused or neglected to accept vaccines while waiting for Health Canada's approval. Clearly, making arrangements to accelerate vaccinations is smart policy. Having vaccines on Canadian soil ready to be rolled out once approved will save time and lives. The Liberals are either refusing to receive vaccines now or are unprepared to do so. Which is it, and why are they falling behind the United States?
Well, Minister of Health.
Mr. Speaker, I stay focused on Canada's plan, and I can tell you it's one of the best in the world. And you know why, Mr. Speaker? Because we have 7 of the most promising vaccines in our portfolio. We have more doses per capita. We're working closely with manufacturers like Pfizer and Moderna, AstraZeneca. Johnson & Johnson just applied on Monday. We were the first country in the world to get their application. And here's what the Moderna's chief medical advisor said. Canada's in the front row. That's because we acted early, we secured contracts early, and we're well placed to vaccinate Canadians.
The honourable member for Vancouver East.
Mr. Speaker, that wasn't an answer to my colleague's question. In Canada, we have learned that only 3 million doses of vaccine will be available by March, while other countries are stocking up so that there is no delay in getting them to their citizens once they are approved. If we don't take swift action, Canadians will have to live with the pandemic for months longer than other countries. The toll on seniors, families, and small businesses is already significant. Why won't the Prime Minister ensure that Canada stock up on the vaccine while we await for Health Canada approval?
Honourable Minister.
Thank you, Mr. Speaker. And I'll just repeat, we have the best portfolio in the world. In fact, we have the most doses per capita in the world. And that's because of an aggressive procurement strategy at the very beginning. And not only that, Mr. Speaker, we are working hand in glove with manufacturers around the world. Canada is well situated. The manufacturers themselves are saying we're well situated. And on top of that, Mr. Speaker, we have the expertise in a public health care system that knows how to vaccinate Canadians. So I have confidence in Canadians. I have confidence in the regulators. And I have confidence in the provinces and territories that will get this done.
Honourable member for Etobicoke Centre.
Thank you, Speaker. My question is to the Minister of Environment and Climate Change. Minister, Canadians, I think, and people in my community in Etobicoke Centre want clean air, healthier communities, and they also want a strong economy while protecting the environment for our children and our grandchildren. And that is why constituents in my riding of Etobicoke Centre want governments to take real and meaningful action on climate change. Now, today is the coming into force day of the amendments to the Federal Sustainable Development Act. So, Minister, could you share with this House and with my constituents in Etobicoke Centre how this is helping us in the fight against climate change?
The Honourable Minister.
Thank you, Mr. Speaker, and I certainly want to thank the member from Etobicoke Centre for his deep commitment to tackling climate change. Today, an act to amend the Federal Sustainable Development Act came into force. These important amendments expand the number of federal organizations who must contribute to the good work done under this act from 27 to 95. It will make the Act more accountable to Parliament. It will include new principles around intergenerational equity, openness, results and delivery, and the involvement of Indigenous peoples. Mr. Speaker, when it comes to climate change, Canadians expect the federal government to lead by example, as we saw yesterday in the Fall Economic Statement, and the improvements to the Federal Sustainable Development Act help us do just that.
Excellent. The Honourable Member for Kelowna Lake Country.
Mr. Speaker, the International Trade Minister's appearance at committee on Monday left us with more questions than answers about the Canada-UK agreement. We still don't have the text. We still don't have the legislation. And now we found out there's no plan for mitigating tariffs if the government can't get this agreement done by the December 31st deadline. The minister says she cares about certainty for our importers and exporters. So when will the minister release this plan?
Honourable Minister.
Mr. Speaker, our priority is to provide predictability and stability for Canadian businesses who trade with the UK. And now that we have concluded the negotiations, the next step is for the agreement to be readied for signing by Canada and the UK. For Canada, this means tabling in the House of Commons for debate and parliamentary scrutiny in accordance with established practices. I look forward to working with colleagues from all sides of the House to support the timely parliamentary approval of this TCA, and our government is actively working on how to mitigate the impact of any implementation delay so that businesses can rely on the continuity that they need. Thank you, Mr. Speaker.
The Honourable Member for Kelowna Lake Country.
Well, Mr. Speaker, the minister has used buzzwords like stability and predictability and certainty, but this means nothing if there's not a plan in place. The minister told committee that she doesn't want to make up policy on the fly. Well, she wouldn't have to do this if the government had taken this seriously from the very beginning and not leave it till the final month in the final year. So can the minister tell us why she still has no policies for disruptive tariffs if a Canada-UK agreement is not finalized by the end of the year?
Honourable Minister.
Mr. Speaker, I can assure the honourable member that our government is actively working on how to mitigate the impact of any implementation delays so that businesses can indeed rely on the continuity that they need. It is excellent that we have worked with the United Kingdom to come to this continuity agreement so that there is that predictability and stability for Canadian businesses. I would like to work with all colleagues on all sides of the House to ensure that we take this agreement timely through the parliamentary process.
Honourable member for Edmonton West.
Mr. Speaker, last night the President of the Treasury Board admitted he conducted zero due diligence on the $900 million WE deal. Now, the Treasury Board exists to ensure government spending is vetted and that all rules are followed. So either the President of the Treasury Board simply doesn't know his job, or he deliberately turned a blind eye so that his colleagues could continue to line the pockets of Liberal insiders. Minister, which is it?
The Honourable Minister.
Thank you, Mr. Speaker. I'm very glad and proud to be able to answer this question. As a member knows, since I told him just last night, the Treasury Board Secretariat is there to provide both guidelines and make sure that authorities are at the disposal of appropriate ministers when it comes to implementing new policies and programs. Thank you, Mr. Speaker.
Before I continue, I just want to bring up one point. I notice on both sides the questions are being asked of the Speaker. I'm sure they don't want the answers from me. Please ask the questions through the Speaker and answer through the Speaker. L'honorable député de Bellechasse-les-Échemins-Lévis.
The honourable member for Bellechasse-les-Échemins-Lévis. Mr. Speaker, the Liberals claim to care about French in Quebec, but the reality is very different. Yesterday, 2 Liberal ministers confirmed to the Standing Committee on Government Operations that not only were Treasury Board rules not respected for the We Charity contract, but that no official languages analysis was done. The Liberals claim to be defenders of French, but ultimately they just don't seem to care. Why did the Minister of Inclusion and Youth ignore Treasury Board rules when it comes to the We Charity scandal in Quebec? The Honourable Minister. Thank you, Mr. Speaker. It goes without saying that we respect not only the spirit, but the letter of the Official Languages Act. My colleague, the President of the Treasury Board, is doing his hard work to ensure that we respect official languages, and that's what we do. And if my colleagues has any other questions on that, we will be pleased to answer. Thank you. The Honourable Member for Saint-Hyacinthe, Bagot. Mr. Speaker, in the economic update, the government said that it was going to help the industries most affected by the pandemic. That's all very well, but once again, nothing about the aerospace industry. When planes have been stuck on the ground for 8 months, it's very discouraging. We're talking 20,000 jobs that are threatened on the short term in the next 2 years without a policy for aerospace. We're talking about a network of SMEs that is fragile and that may be bought at bargain basement prices by foreign companies. We're going to lose control of our economy. What will it take for the minister to take action to protect Quebec's global expertise? The Honourable Deputy Prime Minister. Mr. Speaker, our government is very much aware of the importance of aerospace and the air sector. With that in mind, in the economic update from yesterday, we promised $206 million over 2 years to support regional air transport, $186 million to assist small airports, $700 million to assist large airports, and we are now in discussions with large airlines. The Honourable Member for Saint-Hyacinthe Bagot. Mr. Speaker, we're not talking about air transport. We're talking about the aerospace industry. Let me just say that. For months, we've been told that there's going to be a solution, but there wasn't a single word about aerospace in the throne speech or in the economic update from yesterday. At a certain point, silence speaks louder than words, Mr. Speaker. If the minister is working on a plan, he's clearly all alone because his boss doesn't seem to care. his boss is turning his back on Quebec's biggest export sector. Is the minister so isolated within his own government? The Honourable Deputy Prime Minister. Thank you, Mr. Speaker. All of Canada's exports, including Quebec, of course, are very important to our government. Personally, I have worked closely with the aluminum sector to protect our exports. Concerning aerospace, it is a crucial sector, and transitioning aerospace to the green economy can and must be part of our economic growth plan.
Caledon.
Mr. Speaker, hospitals all across Canada have done a phenomenal job of taking care of people. They do this despite staff burnout, increased operating costs for PPE cleaning, and many more. Headwater Healthcare in my riding does this and faces this every single day. But now they're being asked to be pilot sites for rapid tests with absolutely no money to operate these machines. How has it taken 11 months for us to be piloting rapid tests in hospitals during a pandemic?
Minister of Health.
Mr. Speaker, every single step of the way, we've been there for provinces and territories to protect healthcare workers with massive amounts of personal protective equipment, to ensure they have the tools they need, including building up testing capacity, ensuring that they have the ability to contact trace, ensuring they have the ability to capture all that data. Over 5.7 million tests have been deployed, Mr. Speaker, across the country. 2 million to Ontario, 1 million to Quebec, over 1 million to Quebec, 650,000 to Alberta, 627,000 to BC. The list goes on, Mr. Speaker. We'll be there for provinces and territories and for the hospitals the member opposite is talking about.
The Honourable Member for Edmonton Riverbend.
Mr. Speaker, currently during the pandemic, we're seeing an increased emphasis on using plastic items. Many grocery stores are asking customers to keep their reusable bags at home and providing plastic bags instead. The increase in ordering from restaurants has seen an uptick in to-go packaging, including plastic cutlery. The use of masks and gloves at stores means we're having to use more disposable waste than ever before. As businesses struggle to stay open and adapt, why has the minister chosen right now to push labeling plastic as a toxic substance?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. Canadians know that plastics are a challenge that need to be managed appropriately. The focus of the plastics announcements that we made a couple of weeks ago is about keeping plastics in our economy and not in the environment, in our lakes, our rivers, and our oceans. The vast bulk of what we announced was about enhancing recycling, ensuring that we're actually getting investments alongside regulations that will improve the amount of plastic materials that are actually recycled, completely consistent with what the government of Alberta announced with respect to turning that province into a centre for recycling opportunities going forward. Mr. Speaker, Canadians are far ahead of political parties on this. They want us to address the plastics issue.
The Honourable Member for Port Moody Coquitlam.
Mr. Speaker, Fraser Mills, a brewery in Port Moody, just opened in March. Unfortunately, with lockdowns, they can only serve at 30% capacity in their tap room. With reduced revenue, no rent relief, looming loans, fixed costs, and PPE expenses, the owners are depleting their personal savings to stay open. Because this government has failed to provide help for newly opened businesses that can't confirm revenue loss. What will the minister do to help new businesses like Fraser Mills and give them a peace of mind this Christmas?
Hear, hear. The Honourable Deputy Prime Minister.
Thank you very much, Mr. Speaker. And this gives me a great opportunity to point out to the lion's share of businesses in Canada that the rent support program is open now and businesses will start getting their money this week. That is going to support thousands and thousands of jobs across the country. And for businesses like the one we just heard of, subject to additional lockdown measures, they can get up to 90% of their rent covered. Now, we do know there are special circumstances always, and some businesses fall through the cracks. And that's where the RDAs come in. They are able to support those businesses, and I would urge that business to talk to its local RDA.
L'honorable député de Brome-Missisquoi.
Monsieur le Président, les producteurs de lait, d'œufs et de volailles font la force et la vitalité de nos régions rurales d'un bout à l'autre du pays, y compris dans ma circonscription de Brome-Missisquoi. Située à Farnham, la fromagerie des Cantons, qui fait des produits artisanaux et qui a remporté plusieurs prix pour son fromage au lait de vache Jersey, pourra en bénéficier. À la suite des accords commerciaux avec les pays de la région Transpacifique et l'Europe, notre gouvernement avait promis de compenser pleinement et équitablement nos producteurs sujets...
Interrompre une seconde, s'il vous plaît. Apparemment, place.
I'm sorry to interrupt. It seems that there's an issue with the interpretation. You do seem to have the correct the headset. Perhaps there's a connection. Could you please repeat the question? And simply ensure that it's on the right channel. Please go ahead then. Please go ahead and we'll see if it works. Thank you very much. Milk, egg, and poultry producers are a cornerstone of our rural regions throughout the country, including in my riding, Brome-Missisquoi. For example, there's the Fromagerie des Cantons, which has received several awards for its exceptional cow's milk cheese. After signing FTAs with Trans-Pacific region countries and Europe, our government promised to fully and fairly compensate supply-managed producers. Can the Minister of Agriculture and Agri-Food give this House more details about the compensation package? The Honourable Minister. Thank you, Mr. Speaker. Last Saturday, we announced that out of the money promised in compensation for the two first agreements, we announced that that compensation would be delivered over 3 years rather than 7. That represents $38,000 a year for 3 years for someone with an 80-cow farm. And poultry, egg, and turkey producers will receive an investment of $691 million over 10 years. Thank you.
Thank you, Mr. Speaker. As part of a long-standing agreement between Manitoba and Minnesota, some remote Manitobans in the southeast corner of the province received their health care in Minnesota. When the Canada-U.S. border was closed to non-essential travel, health care was considered essential. Then suddenly the CBSA required residents to isolate for 14 days after attending necessary medical appointments. I've reached out to the health and public safety ministers to address this issue, but 5 weeks later, no results.
Shame, Paul.
Mr. Speaker, how long do these ministers expect these residents to go without health care?
Honourable Minister of Public Safety.
Thank you very much, Mr. Speaker. And I do want to thank my friend from Pomochet for his advocacy and his question on this matter. Mr. Speaker, we think it's absolutely essential that people do have access to health care. I've had conversation with my counterpart in Manitoba, and in fact, the constituents that the member opposite refers to are able to cross into the United States and obtain the necessary health care that they require. But the arrangement that's currently in place at the border is when they return, because they have been exposed to the population in Minnesota, when they return, they are subject to a 14-day quarantine. And that measure, Mr. Speaker, is in place to keep all Canadians safe.
Honourable Member for Yellowhead.
Mr. Speaker, the Liberal fuel standard will increase the cost of fuel by 4 cents per litre. This increase in cost will have disproportionate effects on Canadians living in rural areas, like so many of my constituents. Rural Canadians don't have the same transportation options as those in urban centres. Mr. Speaker, will this government make concessions for rural residents to even the playing field, or will they continue gouging rural Canadians?
Honourable Minister of the Environment.
Thank you, Mr. Speaker. Using cleaner fuels in our buildings, vehicles, and industries is one of the biggest steps that we can take to reduce emissions in this country. The Clean Fuel Standard will cut pollution by up to 30 million tons in 2030, equivalent to taking 7 million cars off the roads. It, though, is going to create enormous opportunities for farmers and companies producing renewable fuels, hydrogen, biofuels. It will encourage investments in energy efficiency that will help Canadians save money, and it will insist with the faster deployment of electric vehicles. It is something that's going to drive innovation in this country, business opportunity, and environmental sustainability.
The Honourable Member for Sarnia-Lambton.
Well, Mr. Speaker, it will drive jobs out of the country. Our energy sector continues to suffer under this Liberal government. Just this month, Imperial Oil, Nova, Cenovus, Husky Energy, and Suncor announced 3,000 layoffs across Canada. That's more Canadians who'll need government assistance instead of supporting their families with well-paying jobs. This government has been punishing these sectors even before the pandemic, but they doubled down with carbon taxes, the clean fuel standard, and the plastics issue. Mr. Speaker, at a time when Canadians need work more than ever, why are the Liberals hurting these sectors instead of helping them?
Hear, hear. Honourable Minister. The Honourable Minister.
Absolutely understands the importance of the energy sector when it comes to the Canadian economy, when it comes to Canada's exports. And that is why we have been working very, very closely with the energy sector in a joint effort to reach net zero emissions by 2050. Because the Canadian energy sector understands that we, as a country, the Alberta energy sector as a sector needs to be able to do that in order to attract investment from around the world, and we are here to support them.
Well, member for Mississauga Lakeshore.
Mr. Speaker, yesterday's fall economic statement was clear. The government will continue to be there for Canadians as we fight through this pandemic. But it also began the important work of setting the stage for our recovery by making a down payment on a meaningful and targeted stimulus. Can the Minister for Middle Class Prosperity and Associate Minister of Finance tell the House how the government will ensure this recovery is inclusive and focused on the quality of life of Canadians?
Honourable Minister.
Mr. Speaker, I'd like to thank the honourable member from Mississauga Lakeshore for his question and for his hard work for his constituents. Smart, time-limited investments that improve Canadians' quality of life are at the heart of our plan to jumpstart the economy. This means taking the next steps toward a Canada-wide early learning and childcare system, support for youth through job placements, and alleviation of federal student loan interest. Mr. Speaker, we will also bolster training support for those hardest hit by the pandemic, including marginalized and racialized women, Indigenous peoples, people with disabilities. Thank you, Mr. Speaker.
The honourable member for London Fanshawe.
During the first wave of COVID-19, the government decided to temporarily not profit off struggling students and froze student loan repayments and interest. Just last week, the Liberals unanimously supported the NDP motion to go a step further and put a moratorium on student loan repayments until May 31st, 2021. Students hoped it would be in the economic update. However, 6 days later, Liberals already broke their promise. Students are being forced to continue to make loan payments in the middle of the second wave. What happened between last week and yesterday that caused Liberals to break their promise to students?
Woohoo! The Honourable Minister.
Mr. Speaker, we know that post-secondary students across Canada are facing unprecedented challenges. That's why we launched the suite of measures that included direct financial support, funding to double Canada student grants, a temporary moratorium on Canada student loan payments, and investments that allowed students to gain the experience they need to start their careers. As we announced in the fall economic statement, our government is significantly scaling up the youth employment and skills strategy to provide more paid work experiences for young Canadians and reducing student debt by eliminating interest on the federal portion of student loans for the next school year. Our government will continue to be there to help students through these challenging times, Mr. Speaker.
The honourable member for Nanaimo Ladysmith.
Thank you, Mr. Speaker. December 3rd is International Day of People with Disabilities. In Canada, people with disabilities are forced to live in legislated poverty. Benefit clawbacks prevent them from earning a modest living. Veteran Affairs Canada has a backlog of almost 50,000 disability benefit applications, and people with disabilities are still being charged outrageous fees for help applying for the CPP disability tax credit. Will the government develop a national disability strategy so people with disabilities in Canada can live with dignity?
The Honourable Minister.
Well, thank you very much, Mr. Speaker, and I appreciate my colleague's excellent question. We know this pandemic has deeply affected the lives and health of all Canadians and disproportionately affected Canadians with disabilities. From the beginning, Mr. Speaker, we have taken a disability-inclusive approach to our emergency response to ensure Canadians with disabilities get the support they need. We are building on the progress made over the last months and years and committing to developing a disability inclusion action plan, which will have a new Canadian disability benefit modeled after the GIS for seniors, a robust employment strategy for Canadians with disabilities, and a better process to determine eligibility for government disability programs and benefits.
I'm afraid that's all the time we have for today. We have a point of order. The honourable member for Edmonton West is rising on a point of order.
Mr. Speaker, if the House will give permission, I'd love to table the Ogo Blues from November 1, 2018, where the Treasury Board Secretary at the time, Scott Bryson, stated, Treasury Board has a responsibility to oversee expenditure management for the government day in, day out, in contradiction with what the current Treasury Board Secretary stated today.
This being a hybrid sitting of the House, for the sake of clarity, I will only ask for those who are opposed to the request to express their disagreement. Accordingly, all those opposed to the honourable member moving the motion will please say nay. I'm afraid we don't have agreement. Orders of the day? No other? Thank you, Ken. Orders of the day.
Orders of the day, government orders, business of supply, reprise du débat sur la motion de l'opposition.
Resuming debate on Mr. Blanchette's opposition motion with regard to support for workers in the healthcare sector. Resuming debate, the honourable member for Montcalm. Oh, apologies, there's a change. The member for Manicouagan. Thank you, Mr. Speaker, and just want to say that I want to share my time with the member for Montcalm. Mr. Speaker, a historic year is coming to an end. 2020 quickly became a worrisome and difficult year. I'm sorry, Mr. Speaker, there's a lot of room here in the chamber. Sure, we'll give people a few moments to leave, the ones who are talking, and the ones who are staying will listen to you carefully. Perfect. Thank you. Go ahead. So, as I said, we're coming to the end of a historic year. It was a difficult year. Things quickly changed, and many Quebecers became concerned, as did people around the world. We were all here in this chamber at the beginning of March, and we all agreed to change the parliamentary calendar by temporarily stopping the work here to help protect Canadians from a virus which we didn't know would turn into a pandemic. A few hours after Parliament shut down, we started a new chapter which will mark our work in the coming weeks, months, and years. Beyond the sacrifices made by Canadians, and which they still are making, and with our healthcare sector under a lot of pressure, well, the workers in the healthcare sector have really shouldered the brunt of the work in the pandemic. Now, people in the healthcare sector are working extremely hard. Our nurses, every time we ask them to make a sacrifice to go to the front lines, they step up. They've stopped counting the hours they're putting in, and they are giving their all. To our orderlies and nursing aides, who are doing so much as well and are working hard with a smile to help their patients, thank you so much. To our doctors who have continued to provide services, even working extra hours to help support nurses and orderlies, thank you to you as well. To our personal support workers, Canadians will never be able to thank you enough for everything you've done. You've worked in red zones during the first wave. You've done everything you can to help contain a second wave, and I'm extremely grateful to all of you. To our community organizations who are on the front lines when human, financial, or material resources are lacking, these people who are helping the most vulnerable, our seniors and people living on the edges of society, thank you for your work in these unprecedented times. Thank you for your intelligence and strength. Thank you so much. I'm also thinking of our cleaning staff, our custodians who are working day and night to make sure the virus does not end up in our healthcare institutions. You're making a big difference. Thank you. Mr. Speaker, my mother is a nurse, so I know very well what the sacrifices are that nurses and healthcare workers are making right now. Quebec's healthcare system can count on all of these workers who are dedicated to the well-being of the population and who have dedicated their careers to improving the well-being of others. Quebec's healthcare system can also count on the support of the MPPs from the Quebec National Assembly who are doing what they can to support the healthcare system in Quebec, which is a model around the world. Quebec's healthcare sector can count on the Bloc Québécois. We are going to pressure the federal government and remind the federal government that it should increase health transfers to the provinces, as Mr. Legault has asked for and other provincial premiers. Quebec's healthcare system cannot count on the federal government. Even in a crisis, this is not only unacceptable, it's inhuman. This is an unprecedented healthcare crisis, and yet the Liberals have unveiled an economic update without increasing health transfers. So how can the government claim to Quebecers that healthcare is a priority for the federal government? The federal government has decided to interfere in provincial jurisdiction by creating a national strategy which nobody wants, which nobody needs. Quebec has full jurisdiction over its healthcare sector in every sense of the word. Mr. Speaker, I have an objective as a member of the Bloc Québécois. I've never hidden this objective. It's clear. I believe in it. But I'm still going to ask the question because sometimes, as the expression goes, asking the question is answering it. Isn't the Prime Minister, again, showing us in an absurd manner that the federal government is superfluous? Quebec can do very well on its own. Thank you very much. The government of Quebec has said that as soon as the vaccine arrives, people will become vaccinated. This is a world health crisis. It's unprecedented in scale. Quebec's healthcare sector is under pressure more than ever, and we need all the financial levers available to deal with COVID-19. But the Government of Canada is not willing to step up and help provincial premiers by increasing health transfers. Mr. Speaker, the Prime Minister has to wake up and smell the coffee. Things are happening on the ground. Healthcare is a provincial jurisdiction. It's quite simple. What Quebec wants and the Bloc is calling for is for the federal government to shoulder its financial responsibility and to send healthcare transfers to the provinces. If the federal government believes it has to play the hero, it can put the maple leaf on the check it'll send to Quebec. In the remaining time I have, again, I would like to thank all the people who have stepped up since March to look after their fellow citizens, to help them get through the COVID-19 pandemic. We say that healthcare workers are heroes. There's a reason for that. These are courageous people who expect nothing in return. If we could enter a hospital for one day only and to look around and see the work these men and women do, in fact, they're creating miracles every day. And we'd see that the most important thing for these healthcare workers is to see their patients' smiling faces. They're not only heroes, but they're people with careers and professions. And if there's one thing we can do as elected representatives is to help them do their job. As the member for Manicouagan, which is on the North Shore, in Quebec. I'm very proud of the healthcare ridings in my riding who have stepped up since the start of the pandemic. Thank you, healthcare advisors and physicians. Thank you, Dr. Richard Fachoun and his entire team for their daily efforts and their messages to the population. Thank you to Claude Lévesque and Dr. Alourdin, also from public health authorities on the North Shore. And thank you to the Innu and Naskapi chiefs who have helped to contain the virus. Thank you.
Mr. Speaker, I think our intervention is clear and straightforward. We're calling on the government to permanently increase health transfers immediately to the amount that the provinces and Quebec are asking for. A responsible government thinks of its people, not of its re-election. Thank you, Mr. Speaker. Questions and comments? The Honourable Member for Châteauguay-Lacolle. Thank you, Mr. Speaker, and I'd like to thank my colleague for her speech. I'd like to continue the discussion that we had a bit earlier, and that's all about the great work that's being done at home in Quebec. I was pleased for part of my career to be involved in the healthcare system, and I've always noticed just how cooperative people were. We're all among professionals and administrators, not just in Quebec, but also with other provinces. So can my colleague say whether Quebec has actually contributed a lot to the cooperation between provinces and the federal government? The Honourable Member for Manicouagan. Yes, Mr. Speaker, the very essence of my speech was along those lines. I wanted to thank the people of Quebec who are doing excellent work, who are dedicated, devoted to the task, and they have been since the start of the pandemic and even well before. When it comes to healthcare, personally, I think that the federal government should respond to the call from Quebec and the provinces and transfer the money. That's money that people back home need to do their job properly and to protect the dignity and well-being of the public. So, in my opinion, there are discussions that can be held, but the essential fact is that the federal government should simply do its part and transfer the money to the provinces as the premiers have called for. Questions and comments? The Honourable Member for Salaberry-sur-Roi. Thank you, Mr. Speaker, and I'd like to congratulate my colleague from the bloc for her excellent, clear speech, thanking healthcare workers in her region, a region which she deeply cares about. Could she perhaps explain to us why it's so important for the Premier of Quebec and all the other provincial premiers to see the federal government respect provincial jurisdiction around health and social services? The Honourable Member for Manicouagan. Thank you, Mr. Speaker, and I'd like to thank my colleague for her question. I feel like giving you two answers. First of all, we don't need a national strategy. We saw the Army report after it came to the rescue in Quebec, and basically we already knew what all the problems were, but the big problem is the lack of resources, the lack of funding. And the second answer is that in terms of the individual life experience, as I mentioned in my speech, I have aunts who are nurses, and over the years they all basically left the healthcare field because the budgets were getting smaller, the workload was getting higher, and it was really impacting on them both professionally and in their personal lives. And that was before the crisis. So, of course, it's important that the federal government do its share. And I keep saying it over and again. Maybe it will become true like a wish, but the federal government should increase the transfers as the premiers have called for. Questions and comments?
Question, 30 seconds, and 30-second answer. The honourable member for Vancouver Kingsway.
Thank you. I enjoyed my honourable colleague's speech. A quick question. Does the honourable colleague agree with the principles of the Canada Health Act, which sets out 5 principles that every province, including Quebec, must respect in order to receive health transfer monies? Does she respect those principles in the Canada Health Act?
The honourable member for Manicouagan. Thank you, Madam Speaker. I didn't have time to put my earpiece in for the translation, but I think I understood the gist of the question from my colleague. The fact remains that jurisdiction over health care and social services, the entire structure, all of the knowledge, comes under the Quebec government. So there's no need for, I'm looking for the term here, there's no need for paternalism from the federal government. Quebec already has everything it needs except for the money. We want the money to be transferred. Resuming debate, the honourable member for Montcalm. Thank you, Madam Speaker. I'd begin my speech on the Bloc's motion by reminding the House what Émilie Ricard said in January 2018, 10 months before the 2019 election. She issued a cry from the heart. She said she's broken by her profession. She's ashamed of the poor care that she is able to provide, and when she does her utmost. The healthcare system is ill and dying. A cry from the heart, Madam Speaker, which was not heard by this government, which is turning a deaf ear to these calls. They've done this before the election, during the election, and even after the election. And still today, 9 months after the start of the pandemic, and the pandemic merely increased the workload of all healthcare workers who were already overburdened. What did the Liberal government respond yesterday? Nothing. Absolutely nothing. Fortunately, Madam Speaker, the House of Commons has gathered and is made up of representatives of the people, not just government. We are the elected representatives of the people. And the House passed the Bloc Québécois motion, which I'll remind you of here. Or the House may pass a motion which pays tribute to Émilie Ricard. And the motion reads that the House acknowledge the extraordinary work of healthcare workers, including doctors, nurses, and orderlies, during the COVID-19 pandemic, particularly with seniors, but also with the general public. B, recognize the courage and sacrifices required from them and their families in order to be on the front lines. C, highlight the work of Quebec and the provinces in responding to the health crisis and note the direct impact on their respective budgets. And D, call on the government to significantly and sustainably increase Canada Health transfers before the end of 2020 in order to support the efforts of the governments of Quebec and the provinces, healthcare workers, and the public. With this motion, Madam Speaker, the Bloc Québécois, counting on the solidarity of all the elected representatives of the people here in the House, whether they're on the government side or not, at least we hope, and including those who work in Quebec, all together in solidarity today, what we're underscoring is our duty, our obligation to say to all those workers in the various healthcare networks, we need to say a big thank you to them. And it's not without pride that I came here this afternoon, because I said to myself, here's a motion that fits right in with what the government has been claiming and calling for months and months, which is cooperation between Quebec and the various territories and provinces. Cooperation requires concrete steps, Madam Speaker, not just words and wishful thinking and empty rhetoric. All the experts who appeared before the Health Committee during our study of the first wave, all those witnesses indicated to us, and this is obvious, it's so obvious, Madam Speaker, it's like when you're standing right in front of a tree, you can't see the whole majestic forest. So these experts told us that the chronic underfunding of the healthcare system has weakened healthcare networks and made it impossible to adequately address a pandemic of the dimensions we're experiencing. This is the biggest health crisis, the most mortal health crisis in the past century. And that's why, Madam Speaker, contrary to what the government leader claims, he claims that we're just trying to squabble and to pick fights with the government. But when the National Assembly of the people of Quebec, all parties included, passes a motion that calls for a significant increase in healthcare spending, and on the other side, the Liberal government here claims that's just looking for constitutional squabbles, looking to pick a fight, I don't think they're listening. They're not actively listening. They're just engaging in empty rhetoric and making commitments that are never kept. But this is what the National Assembly said in June, as recently as that. And as I said, all parties stood behind this, that the National Assembly of Quebec condemn the fact that the federal share of healthcare funding has dropped by more than half since it began. They went from 50% of spending to 23%. And the National Assembly called on the federal government to rapidly revisit its contributions to healthcare spending and to increase its transfers immediately by at least 6% with no strings attached, and reiterate the importance of respecting Quebec's jurisdiction over healthcare. Madam Speaker, it seems to me that a party with representatives from Quebec and the Bloc, of course, which is exclusively elected by the people of Quebec, it's up to us to bring this issue before the House. And if we hadn't done it, who would have? And it's regrettable that some Liberals are too concerned with holding power. They should remember that they're here to represent the interests of Quebecers, and they should vote according to their conscience in favor of our motion. Who can vote against this? This was supposed to be inclusive. So, or the Liberals claim that they want to be inclusive. And I quote the Prime Minister, he says, "The dignity and lives of seniors are not a matter of jurisdiction. That, Madam Speaker, is such an empty statement because the values are universal. But if you don't interpret it in the proper context, it's meaningless. It's as if I said, health has no borders, Madam Speaker. And then what? What about the organization of health care? And given threats like pandemics, there's a requirement to have territorial organization and jurisdiction over health care. Now, the Constitution Act is so dear to the Prime Minister, and what does it say? It says that all health care comes under the exclusive jurisdiction of Quebec, the provinces, and the territories. The deal between the federal government and Quebec and the other provinces is quite simply for the federal government to transfer our money back to us so we can take care of people properly. After 25 years of chronic underfunding, that's had an impact on the principal determinants of health, Madam Speaker, i.e. prevention. If the federal government cares so much about health care, they should increase transfers so that we can get ready for the next pandemic, because there will be more. They should do their job. They should play their role and do their part, Madam Speaker. That is why I would, since I only have a few seconds left, I would encourage all members here not to see the Bloc's motion. And I'm talking to the Liberal members from Quebec here. Do not interpret this as an attempt to pick a fight, because they're the ones who always stand behind the Constitution. We never wanted to bring it down to that level. We're just saying, do what you're supposed to do. Keep your word. I'm sorry to interrupt the member. You'll be able to continue during questions and comments. Questions and comments. The honourable member for Abitibi-Temiskaming. Thank you, Madam Speaker, and I'd like to thank my colleague for his excellent speech. Obviously, he's very inspired. I'd like to know what the circumstances were behind the economic statement we heard yesterday, the fall statement. What would be consistent with the speech he gave? Has the government addressed any of the concerns he's just raised, including the age-old question of health transfers? The honourable member for Montcalm. Thank you, Madam Speaker. We're going through the worst health crisis, and obviously Quebec and the provinces, Ontario said so recently. Everyone should support the Bloc's motion, shouldn't they? It's important for those people who are managing healthcare to get a clear signal from the federal government that sustained, ongoing increases to funding will be made so that we can get through this crisis and prepare for the next. And I've heard the Prime Minister mentioning that it was a lot of money and that it would be, structural and so on. Well, that's precisely what we want. We want it to be a lot of money. We want it to be structural, not just window dressing, not just sprinkling a little bit of funding here and there. Transfers for health need to be brought back up to 35% to meet the needs of Quebec and the other provinces. Questions and comments. The honourable member for Lac-Saint-Jean. Thank you, Madam Speaker. I'd like to thank my colleague for his speech. He's always very serious and impassioned when he speaks about his files. My question is quite simple. When I look at the wording of the Bloc's motion, I see nothing in the motion that members here could possibly vote against. Does my colleague see any reason in this motion for other members to vote against it? The honourable member for Montcalm. Madam Speaker, unless, like the Prime Minister often says, they want to play politics with the vulnerability of patients, people who are sick, who have COVID-19, unless that's the goal, to play politics with the fragility of the healthcare system and to say, this is our chance to unless that's the motive, I can't see anything beyond petty politics and an opportunity to take advantage of Quebec's weakness right now and the other provinces' weaknesses. I can't see any reason for the federal government, for the Liberals to want to impose their views and their vision. They should just respect the Constitution that's so dear to them.
Speaker, I'm wondering if my colleague could provide his personal thoughts, or better yet, the positioning of the Bloc on the issue of the Canada Health Act. It is something that I believe from coast to coast to coast is widely supported from all residents of all provinces. And I'm wondering if he could just share what his thoughts are in regards to the importance of that piece of legislation.
The Honourable Member for Montcalm. Thank you, Madam Speaker. I'm happy to receive this question from my colleague. What the Canada Health Act does is ensure that there are some principles, universality, accessibility of care, and other principles. Yet there is chronic underfunding of health care. There have been so many cuts to health care. The Liberals have continued on with Stephen Harper's policies. They're not indexing it as we wish. It is very clear, in fact, Madam Speaker, that healthcare is not as accessible. Accessibility is being undermined, in fact. So what is the government waiting for in order to send a message to Quebec, to the provinces and territories, that they will plan for the long term? We need to have long-term planning to get out of this crisis. A very brief question. The member for Rivière-des-Mille-Îles. Thank you, Madam Speaker. I'd like to read a quote, a very memorable quote from our Premier. I'd like to hear my colleague on it. He said, I absolutely respect provincial fields or areas of responsibility and jurisdiction, especially when it comes to people's lives and livelihoods, though. But when it comes to people's lives, there is no jurisdiction. The Honourable Member for Montcalm, 10 seconds. Here's what I have to say about it. I said it earlier, Madam Speaker, about that quote by the Prime Minister. We need collaboration, but we also want our areas of jurisdiction respected. We want the government to contribute in the ways it should and can contribute, rather than interfering, rather than pretending that Ottawa can do better than the provinces. Ottawa has not even managed to handle its own files and its own areas of jurisdiction throughout the pandemic. Resuming debate. That answer was much longer than 10 seconds.
To the Queen's Privy Council. Yes, thank you, Madam Speaker. It's a pleasure for me to be able to rise and speak on what is, in my opinion, a very important debate about health care. Health care is something in which Canadians from coast to coast to coast truly believe in. One of the things that I've always found is whenever I talk to especially new Canadians, and you talk about some of the things that makes Canada so attractive, it's, in fact, our healthcare system. It might not necessarily be the perfect system in the world, Madam Speaker, but it is a system that is, generally speaking, accepted as one of the finest deliveries of services that we provide as a society. Canadians love our healthcare system, and they want to see governments working together in order to protect it into the future, Madam Speaker. It's one of the areas of responsibilities in which I think this current government has done exceptionally well. Shortly after getting into government back in 2015, Madam Speaker, we were able to reach agreements with the different provinces and territories in regards to funding formula, amongst other things. I used to be the health critic in the province of Manitoba, very much familiar with jurisdictional responsibilities and who is responsible for what. And for those that would advocate that Ottawa has no responsibility other than to give cash, they are wrong. there is a responsibility that all of us have, even members of the bloc have, to the constituents that they say that they represent, in ensuring that the health care services that we have today continue to be there in the future. And if there's ways in which we can expand upon it, we should be open to doing that, Madam Speaker, as this government has clearly indicated its interest. I look in terms of the motion that's been presented today. And one of the things that I do agree with is in regards to the workers. You know, it's interesting. I've had the opportunity, as many members have had the opportunity, to talk a great deal about the pandemic. I often talk about the high sense of cooperation. The focus of this government and this Prime Minister is, in fact, minimizing the damage of the coronavirus, the pandemic. And we are working with all the different stakeholders, Madam Speaker. And I often make reference to that. But we have some real heroes that need to be recognized. And I've done that also in some of my previous comments. And I do think it's worth repeating time and time again. Our healthcare workers have done an exceptional job during this time of a pandemic. And when I think of the healthcare workers, I could go into our institutions, whether they're hospitals, our personal care home facilities, those individuals that visit homes in order to provide services to seniors, home care service workers, Madam Speaker. There's a wide spectrum of individuals that have been able to sustain our healthcare system during this pandemic. And they have really been challenged to be able to provide that quality of service that Canadians expect there to be. And at times, it has been challenging. Whether it's the province of Quebec or the province of Manitoba more recent, where we've had the need to bring in the Canadian Forces or the Red Cross. And that's one of the nice things about the Federation, is recognizing that Ottawa can complement many of the things that are taking place within the services dealing with health care, Madam Speaker. And we have seen that vividly during the last 8 months. I would ultimately argue since 2015, Madam Speaker. A government that truly understands the importance and values the work that day in and day out, 7 days a week, 24 hours a day, that we have healthcare professionals that are meeting the challenge. It's one of the reasons why we allocated significant money to provinces to provide support, additional financial support, Madam Speaker, to those workers. Whether you're someone that's working in an operating room, an ICU, bedside care, replacing bedpans, cleaning stations, the individuals that are providing the services that are so critical to allow our patients to be safe in our institutions. The services that those home care service providers are providing when they go to visit seniors and others in the community. This government has demonstrated and acknowledged not only of their existence, but we have supported them financially in all regions of our country, Madam Speaker. I don't think there's a member of Parliament in this House of any political stripe that would challenge the idea that our healthcare professionals and workers and supporters have really stepped up to the plate on this pandemic. I believe that all members of the House would recognize that fact, because that fact is a reality, Madam Speaker. I am very passionate about health care because I believe in it, and I know the #1 concern of the residents of Winnipeg North is health care. We value it, we treasure it, and I, whether it was an MLA or now as a Member of Parliament, will do whatever I can to ensure that it continues to be there into the future for future generations. And I am so encouraged that we have a Prime Minister that is committed to our health care system, that is committed to the Canada Health Act. I have seen previous Prime Ministers that lack that sense of commitment, Madam Speaker, which causes concern. I think people should understand why it is that the Bloc Quebec Party is here. They're not here, and as the government House Leader has said, to contribute that positively for the entire country. Members of the Bloc would be quite happy to see issues related to other provinces being left to the side. Yes, in this particular motion, they are advocating that let's look at other provinces too. But let's also remember that the biggest advocate of just give us cash and forget about anything else comes from the Bloc. The Conservatives might not be that far behind. But I can tell you, I believe it would be fundamentally wrong for any government to say, here's a pile of cash, we don't want anything else to do with it, just take the cash and run. And if it was up to the Bloc, it would be not only in healthcare, Madam Speaker, it would be in every department. I understand that, because they see a very different role, a role that is quite different. We want and we recognize that whether you're a resident of Quebec, my home province of Manitoba, or anywhere in Canada, that our first priority needs to be the pandemic. That should be the first priority of us, Madam Speaker. Not how we might look for confrontation or issues that are really not there. And the Bloc will focus on trying to bring forward issues at a time in which I believe that most Quebecers, I would think, as most Manitobans, are wanting all of us to work collaboratively on trying to minimize the negative impacts of the coronavirus, Madam Speaker. You know, I asked the member in terms of the positioning of the Canada Health Act. The Canada Health Act, 5 basic principles: public administration, comprehensiveness, universality, portability, and accessibility. There are some in the House that would like to be able to see more. I know there was back a number of years back in the 90s where there was a push, Madam Speaker, to have a sense of accountability also incorporated into the Canada Health Act. I believe that the federal government made good decisions when it talked about the importance of home care services, when it talks about medications. And these are the types of services that it would be nice to see in expansion. Some provinces were further ahead than other provinces. You know, Quebec has done a phenomenal job on the issue of child care. And we saw it was referenced in yesterday's speech. Many years ago, the province of Saskatchewan did a phenomenal job on the issue of health care, and look what we have today. Or British Columbia, as the Minister of Finance or Deputy Prime Minister made reference to yesterday, in the fine work they're doing on the environmental issues. We are a big country, Madam Speaker. And provinces play an absolutely critical role, especially when it comes to the healthcare delivery. As I said, I used to be the healthcare critic in my home province. I know the role that they play. I can tell you that when we think of the pandemic and the issue of healthcare, Madam Speaker, the province or the federal government has stepped up to the plate. We have resourced literally hundreds of millions going into billions of additional dollars in order to support health care. We have put a special emphasis on issues like mental health. And I suspect that if you were to canvass people across Canada, you will find that mental health needs that additional attention. If you listen to, I can tell you, my Liberal caucus colleagues, you will often find the issue of mental health being raised as an issue. The issue of home care services, again, being emphasized and financially resourced by, at least in part, Madam Speaker, by the national government. These are the types of issues that I believe that we need to focus even more attention on. You know, a few years ago, NDP, and some would say, well, many, many years ago, the Liberal Party has been talking about pharmacare. This particular Prime Minister made it an issue that has been widely debated in Canada now for the last 4 or 5 years, at a significantly higher level of debate than it was since Medicare was first brought in, Madam Speaker. And I know that, and I'm comfortable in believing that, because I've been a parliamentarian for 30 years, Madam Speaker. And it's only in the last 5 years where we have seen it to the stage in which it's gotten today. If we want to maximize the benefit, if we want to listen to what our constituents, no matter what province they live in, if you want to listen to them, Madam Speaker, you'll be sensitive to the issue of a national pharmacare program. In order to be able to achieve that, you have to do what the throne speech said that was brought in September of this year. It said you need to work with provinces. You cannot have a national pharmacare program without the cooperation and support coming from provinces and territories. It's just not possible not to have the optimum program, Madam Speaker. This is the type of issues that even though we're in the pandemic, that this government continues to want to strive forward on. And that's why, once again, we got an indication from yesterday's announcement with the Deputy Prime Minister as we continue to move forward with that, Madam Speaker. And remember, it was only 4 years ago, when we really, 4.5 years ago, through a standing committee, that we requested to be able to look into the issue to bring it forward. Now, Madam Speaker, I have to provide comments on financing of health. This is something in which I could probably spend quite a lengthy period of time on, Madam Speaker, so I'll try to encapsulate my thoughts on it. The healthcare funding, back in the early 90s, I can remember sitting inside the Manitoba legislature when there were some cuts that were coming from Ottawa. And at the time, we were being told, Madam Speaker, that we were going to be establishing a very base floor for ongoing support towards health care, and then there would be incremental increases. I suspect if you were to look into the Hansard debates back in the early 90s in the Manitoba legislature, what you would have heard was that it's only a question of time before Ottawa does not contribute a dime towards health care, because previously there was a negotiation that had taken place in which premiers wanted to see tax point changes as opposed to direct cash going into health care. And if we would have continued along that line, we would not have had healthcare dollars coming from Ottawa because it would have been in the form of tax point changes, Madam Speaker. I always find it interesting when members opposite say, well, there was cuts in healthcare during the 90s, in the early 90s. There was one budget where there was a cut, but there was also the establishment of a base and a fact that Ottawa would always contribute towards health care. I'm pretty confident in that because I was inside the Manitoba legislature when that was being debated. And because of that guarantee and then the monies that continued to flow every year afterwards, Madam Speaker, money and the Treasury continued to grow towards health care transfers. Today, we give more money, historical amounts of money, Madam Speaker, towards health care. And even over and above those health care transfers, there is still additional hundreds of millions of dollars that is being tagged to go towards health care in our provinces and territories, Madam Speaker. You see, we understand what the expectations are, the role of the federal government, Madam Speaker, how important it is that we continue to work with provinces and territories. When it comes to, for example, on the pandemic and the testing, it's the provinces that have the responsibility and the setup, the administration, to be able to ensure that the testing is in fact being done. But, during the Restart program, $19 billion that went to the different provinces, what that did, Madam Speaker, is it enabled the province of Manitoba to triple the number of tests that were being done. And that's, whether it's examples such as that, Madam Speaker, or it's taking a look at other ways, the vaccine, making sure we are in a fantastic position, contrary to what it is that the leader of the official opposition tries to give an impression of, Madam Speaker. Canada is well positioned to be able to be there in a very real and tangible way because of the fine work that was done by science and civil servants and by working with other jurisdictions where we are now we have an opportunity through a number of different companies to provide the vaccines that Canadians are going to need, and we're going to be going to our healthcare workers and others to ensure that Canadians continue to be safe going through this pandemic, and we will get out of it, Madam Speaker. Thank you very much.
Questions and comments? The member for Montcalm. Thank you, Madam Speaker. Well, with all due respect, all the respect I have for my colleague, it seems to me that he is launching a debate which has nothing to do with the motion. To say that the Bloc Québécois, when it comes to health transfers, only talks about Quebec's interests. Well, the Premier of Ontario, does he speak for Quebecers? Does the Ontario Health Minister speak for Quebecers? The Premier of Alberta, he has a centralized, he believes the federal government is centralizing. So I don't know if his Quebec MPs would agree with what he said. Quebec has its own interests, and all provinces have their own interests, and yet they all agree on one thing, which is an increase in health transfers. So what exactly is he referring to when he's saying that the Bloc is only speaking for Quebecers in this topic?
Speaker, I can assure the member that, as members of Parliament, we all represent jurisdictions, and I trust and hope and believe and have faith that we are advocating as members of Parliament the best interests of our constituents, no matter what province it might be. I I've always done my very best at ensuring that Winnipeg North is well served by me, but I never lose the perspective of the national interest. And the national interest, I believe, is something that allows for a sense of cooperation on a wide spectrum of files so that the citizens as a whole will actually be able to better benefit in society. And all the province of Quebec, where my heritage lineage goes back to, both on my mother's side and my father's side, at the end of the day, has so much to offer to us as a nation. And I look forward to the ongoing debates that we'll have on that particular issue.
Questions et commentaires? Hamilton Centre.
Thank you very much, Madam Speaker. And I've heard the honourable member opposite speak at length in this House, but I don't know that I've ever seen him this fired up. So the block must have definitely struck a nerve. Look, Canadians are rightly proud of our healthcare system, but decades of austerity and privatization have challenged our ability to deal with the public health crisis like COVID-19. It was back in 1976 when Prime Minister Trudeau first proposed replacing the 50-50 cost sharing with a new regime of block grants that exposed provinces and territories to the unilateral federal cuts over the subsequent decades. The federal share of overall healthcare spending in Canada has plummeted to 22% at present. The Trudeau Liberals promised a new health accord during 2015, but once they got in power, they kept the Conservative Harper cuts. So given that the healthcare expenditures are projected to increase by an average annual pace of between 6.5 and 8.4%, does the member opposite believe that it's time to increase the healthcare transfers from the current 3%?
The Honourable Parliamentary Secretary.
Yes, thank you, Madam Speaker. What I believe is that we have infrastructures such as our Standing Committee on Health that is in a very good position to be able to review issues of this nature. We have once again established through this Prime Minister the idea that was lost, and where we have first ministerial meetings that take place. There's opportunities to have that particular dialogue, whether it's in the two examples I just listed, or it's on the debate inside the chamber. What I would tell the member is he makes reference to 22%. That percentage varies, I suspect, depending on the province that you're in. Some provinces have a much higher per capita cost on health care than others, and the way that the funding formula works for health care transfers, I don't want to say that I understand fully all the complexities of it, but I can tell you that the variations differ between provinces and Ottawa.
Questions et commentaires, l'honorable député de Repentigny.
Questions and comments, the member for Repentigny. Thank you, Madam Speaker. Well, we have ideas on what the federal government can do better. They're trying to teach us lessons when it comes to long-term health care. Borders. In March, the mayor of Montreal had to go to Dorval to give information on the pandemic because the federal government was not doing its job. When it comes to other issues, the vaccines and the N95 masks, which had been destroyed or unusable, the federal government failed. It failed on so many fronts, and if it were in school, it would not graduate.
Speaker, I would just have to, I guess we'll just have to agree to disagree. I believe that with Ottawa working with the different provinces, we have been able to bring forward the types of PPE and other safety measures that are necessary. That one of the reasons why the second wave is not as severe as it could have been is because through the great sense of collaboration and teamwork back during the first wave, and the lessons that were learned through that process have assisted us going through the second wave. And now when it comes to the whole issue of vaccination, for the first time in a while, we can see some light at the end of the tunnel, and Canada is in a good position because we have done our homework in ensuring that we have the ability to get the vaccines that are going to be necessary to be delivered in a very safe fashion fashion to Canadians, Madam Speaker. And I think that bodes well for all of those partners and those individuals that would work with the government in order to put these type of things in place.
The honourable member for Esquimalt, Saanich-Sooke.
Well, thank you, Madam Speaker. I listened with great interest as the member for Winnipeg North talked about almost everything else except healthcare transfers, which are the heart of the Bloc Québécois motion. But I wonder if he, like me, being shocked and horrified that Canadian troops and the Red Cross had to bail out long-term care homes, does he agree with me that we should move toward national standards for long-term care and perhaps bring long-term care under the National Health Care Act with those national standards?
The Honourable Parliamentary Secretary.
Yes, Madam Speaker, as being from a province in which we've recognized in the past the important role that our Canadian military has played, in particular, let's say, the Red Cross during the pandemic in the province of Manitoba, or the military in other jurisdictions, I think that it's something that's good to have and was demonstrated that at a time of crisis, Madam Speaker. So I see that as a positive thing. I always believe that it's very important that Ottawa works with provinces related to health care to ensure that we maximize the service that we know that Canadians would like to be able to see. We recognize the important responsibilities that provinces play in terms of the administration of health, but it doesn't mean that we have no role.
Honourable member for Selkirk, Interlake Eastman.
Thank you, Madam Chair. And I was going to get up on a point of order because I believe the member from Winnipeg North actually claimed that he was a health critic when he was back in the Liberal opposition in the Manitoba legislature. And I believe that he was only one of two Liberal MLAs, so he's held a portfolio of many different files, including health, among other things. I just want to take this time to recognize all our healthcare workers out there. My wife is a nurse, works in long-term care. My daughter is a nurse that works in geriatrics. And I know that they and their colleagues in Manitoba, right across this country, are really working hard to keep our loved ones safe. And I want to thank our Canadian Armed Forces, as well as the Red Cross, who have stepped in most recently in Manitoba, but also have served this country well and working in long-term care facilities in Ontario, Quebec, and elsewhere. And so without their support, we wouldn't have got through this as well as we have. And I know that their commitment and dedication is what makes all of us proud as Canadians.
The Honourable Parliamentary Secretary.
Yes, Madam Speaker, the member demonstrates exactly what it is that I was, the point I was making at the beginning of my speech. I suspect that you would not find any member inside this House that would not recognize just the valuable and critical role that our healthcare professionals and support workers have played during this pandemic. They have been absolutely outstanding heroes in the true sense, and we do value their ongoing sense of commitment to the quality of service that they continue to provide for Canadians day in and day out, 7 days a week, 24 hours a day. Thank you very much, Madam Speaker.
The member for Shefford. Thank you very much, Madam Speaker. To begin, I'd like to point out I'll be sharing my time with the member for La Prairie, and I'd rather speak before him than after him. So it is with a great sense of urgency that I rise today to speak on the Bloc Québécois Opposition Day motion. I am the seniors critic, and I've chosen to talk about the fact that we need to take good care of our seniors, and I will talk about those who do exceptional work for seniors, including the FADOC network. It's the largest seniors organization in Quebec and Canada, with over 500,000 members, over 700 clubs, 16 regional groups, and some 17,000 volunteers. They have a long and fruitful tradition going back half a century. And according to a brief submitted in June of last year, in preparation for the pre-budget consultations, the FADOC requested an increase in health transfers. The brief said that in 2018-2019, federal health transfers amounted to $38.5 billion. And according to the Conference Board of Canada, total spending by Canada's provinces and territories was $174.5 billion. Therefore, provinces and territories' share accounts for 40%, and the federal government's share is only 22%. But if the current growth trend continues, the federal share will fall to less than 20% by 2026. The FADUC is asking the federal government to index the healthcare annually by 6%. It's important to underline the impact of the aging population on public health care expenditures. The Conference Board estimates that it costs about $12,000 a year to care for a senior, compared to $2,700 a year for the rest of the population. The board estimates that this amount will increase, that healthcare spending will increase by $93 billion for provinces and territories, an amount that will account for 1.8% of their total spending alone. In its current form, the Canada Healthcare Transfer does not take the aging of the population into account. Its formula is based on an equal per capita amount, and that's why the FADUC believes the Canadian government should change the current formula to take into account the aging population for each province and territory. FADUC has agreed to the Conference Board report, which contains figures that speak for themselves. The Canadian population is aging, and the proportion of seniors in Canada will increase from 16.9% to 21% over the next 21 years. Federal health transfers will amount to $37 billion out of a total of $167 billion public sector expenses. Now, the provinces and territories receive a per capita share of transfers. Federal health transfers increased by 6% per year over the last decade. As of 2017, the growth rate for the transfer was limited to 3%, or the rate of growth of the economy, whichever is higher. Now, the federal government absorbs about 22% of healthcare costs. But if these costs rise faster than the growth of the economy, the provinces and territories will have to absorb the difference. Now, we estimate that the growth rate of the Canada Health Transfer will be 3.7% per year over the next decade, while healthcare costs will increase by 5.1%. So, in other words, the federal contribution will not keep pace with the growth of healthcare costs. And if nothing is done to fix the situation, the federal share will fall to less than 20% per 2026. The FADUC network deeply deplores the fact that the government once again is ducking its responsibility. There was nothing in the finance minister's economic statement from last night. I would like to remind the member that we don't name names here in the House, names of colleagues. The FADUC expected the Trudeau government to announce a minimal increase of 10% in old age security. FADUC said that it's absolutely unacceptable for the government to abandon seniors yet again, many of whom are in a poor financial situation. This according to Gisèle Tassé-Goodman, the president of the FADUC network. Yet in last September's speech from the throne, the government reiterated its commitment to increase OAS. FADUC had maintained its claim that this benefit should not only be for people aged 75 or older, but for those between the ages of 65 and 74. People with income only from the GIS and OAS receive just over $18,000 a year, roughly the equivalent of the threshold set by the market basket measure. This amount only covers basic needs, but not dental care, eye care, or medication. Many seniors are low income, And FADOC does not agree with an indexation of less than 1% of OAS and GAS, ironically in the middle of International Seniors Day. So how can the federal government treat these people who built this country? By not increasing OAS by at least $110, we're taking away the purchasing power of seniors, and the cost of everything keeps on going up. This situation has gone on long enough. We must do something about it.
If I've added this aspect of increased purchasing power, Madam Speaker, it's because there are exactly two things the President of FADOC came to ask the committee when the question of how to help senior women in this time of pandemic was raised. Of course, we have to give them the financial means to stay and receive help at home, but we also must give them the healthcare system. We must give the healthcare system the means to take care of seniors and those who take care of them. It's not national standards they need. It's not national standards that will take care of them. It's by empowering people who work in the healthcare system with adequate PPE, with sufficient equipment. In short, it's by cutting off the supplies to workers in hospitals and throughout the healthcare system that we firmly believe we will truly be able to help seniors. Let the government mind its own business. Giving money to certain organizations that help them is good, but it's far from enough. We should stop holding our seniors hostage. They need reassurance. Let's give Quebec and the provinces the means to help them get through this health crisis. Let's recognize the work and highlight the efforts of our frontline workers, efforts made by the public to reduce pressure on our healthcare system. In Quebec and Canada, governments have already worked together for decades to meet the healthcare needs of the public. Then, after years of Liberal and Conservative cuts, governments must continue along this path in order to meet the needs of the aging population. Hopefully, the Liberals will avoid the two temptations of governments in times of crisis: austerity on the one hand, such as refusing to increase health transfers to 35%, and on the other hand, interfering in provincial jurisdiction, so that seniors are no longer seen as an economic burden, but as a grey force. Let's take action. Before we continue to questions and comments, I'd just like to remind honourable members that you mustn't use the names of current members of the House. Questions and comments? The honourable member for Courtenay Alberni.
Thank you, Madam Speaker, and I want to thank my colleague for her speech. And we do agree that the government needs to increase the transfers to support those health workers. And I also would like to give a huge shout out to all of those people on the front line putting their lives at risk every day, regardless of this crisis. And certainly throughout this crisis have been there for each and every one of us. One thing that we've talked a lot about is long-term care and the need to invest more in long-term care and set national standards. I also want to talk about home care workers. They seem to not be part of this conversation. And I was meeting with home care workers yesterday, and obviously their goal is to keep people out of long-term care. They're in the middle of a staffing crisis. They'd like to see more money transferred to the provinces with federal oversight and guidelines. Does my colleague agree that home care workers need better support, better guidelines, better oversight in terms of a long-term agreement moving forward, and the important role that home care workers play in our healthcare system?
The honourable member for Shefford. Thank you, Madam Speaker. Home care workers are more than essential. They're on the front lines and they enable seniors to stay at home. And I said that in my speech. For senior groups in Quebec, they're fully aware that what is needed in Quebec and the provinces is increased health transfers so that they can keep having these home care workers. They don't want standards, as I said. Standards don't take care of anyone at home, but an adequately paid personal support worker who's well protected with PPE, they can certainly help people stay at home.
For Nanaimo Ladysmith.
Well, thank you, Madam Speaker. I'd like to thank the honourable member for her speech. And I want to say that I support this motion. I think that our healthcare workers have been doing extraordinary work under stressful situations. And I think that it's about time that the government got back to proper transfers for healthcare. And I agree with her that we should be looking at demographics when with these health transfers. In my region, we have a large number of seniors. People come to Vancouver Island to retire. One of the things that's not mentioned in here is infrastructure. We have aging healthcare infrastructure in Canada, and when you have workers in an older building, it stresses them out when the building doesn't meet the requirements of modern healthcare. And so I'm wondering whether she agrees that we should have the federal government putting money back into the infrastructure for our healthcare system, for our hospitals. They've abandoned funding for healthcare infrastructure. Should the federal government be putting money into healthcare infrastructure again?
The Honourable Member for Shefford. Madam Speaker, I've worked with a lot of seniors groups, and we've talked about abuse and also good treatment. Good treatment involves getting seniors out of hospitals. Unfortunately, they've been grouped together in long-term care facilities, and we should have invested in decentralizing hospitals and getting people out of the hospitals. We shouldn't invest in concrete. We should be investing in young people. The Honourable Member for Montcalm. Thank you, Madam Speaker. Both of my colleagues earlier said they were outraged that the Army had to intervene in long-term care. Now, these are people who are paid, of course, but does my colleague not believe that if we needed to call in the Army, and of course, the Army does missions in other countries, in other places in the world. I don't see why they shouldn't be called in here if we need help, if the government hasn't been able to do its job properly. But doesn't my colleague think that the presence of the Army was linked to the fact that there were cuts year after year to health transfers? And the Army report says there was a shortage of workers, and that shortage meant that workers had to work in multiple facilities, and that contributed to the spreading of the virus. Isn't my colleague outraged that all the federal government thinks is that standards are needed when they were basically missing in action all along? Now, a member for Shefford. You know, speaking of the Army, that's an old war tactic, which is to cut off supplies and then attack when the opponent is down. So I don't think there's anyone in the Bloc Québécois or groups of seniors who thinks that way, Madam Speaker. Resuming debate, the Honourable Member for La Prairie. Madam Speaker, I'd like to point out how amazing the work of healthcare workers has been. I think anyone who's had the unfortunate experience of having to go to the hospital for themselves or to support someone else, you see right away how hard those people work. And I think that's one of the only times in our lives when we agree to wait, where we're patient, because we can see how overworked the people in the hospitals are. And it's not their fault. There's too much for them to do. And you can see that right away. You see those people working hard. They're passionate about what they do. They're not there for the money. They're there to care for people. It's not a job. It's a vocation, and you can see it in their daily actions. They provide support and help to people. They always want to do more to help people, and unfortunately, it has backfired a bit on them because the federal government has slowly but surely cut funding, and that has put more and more pressure on healthcare workers. And the network is hanging by a thread, even in a pandemic, and it's all thanks to them. So what do they get as a reward? Burnout, overwork, and longer shifts. And so it's the workers who are paying the higher price for the chronic underfunding of healthcare. And I deeply salute those workers. And I've known a number of them because my mother was in long-term care and she was often in hospital. And I admired all the healthcare workers, and I express my deepest gratitude to them today. They're the people on the front lines who bear up under all the pressure that their work brings to bear on them, and they often get sick, and some have even died in service. It's incredible when you think of how much we owe them. So I would be remiss if I didn't underscore their outstanding work. We're lucky to have them. This pandemic has been raging for more than 8 months now, and they're still there. They're still on the front lines to help us, and we should never lose sight of that. And they're the ones we're working for here today, the Bloc Québécois, and I hope the other parties will understand how necessary it is for us to intervene to increase federal health transfers. And every time I go to the hospital and speak to the workers, nobody ever says, the problem is federal health care standards. We need them. We need the feds to impose standards on us. You never hear that. What you hear them say is we need resources. We need help. We're short of staff. And that takes money. All of that takes money. So the responsibility for this chaos in healthcare funding lies on the other side of the House. It's them. They're the ones. Since 1867, it's said in the Constitution, which they defend tooth and nail. The Constitution clearly states that healthcare comes under Quebec and provincial jurisdiction. And it says that the federal government can help Quebec fund healthcare because the provinces don't have enough sources of funding. But that funding should be unconditional. There should be no strings attached. And that's what the Constitution, that's so near and dear to their hearts, says. We used to get, in 1984, roughly half of federal of healthcare expenses were covered by the feds. But then Jean Chrétien and Paul Martin came along and decided to fight the deficit. How did they do it? Well, they passed the buck to the provinces. It was pretty easy. They cut spending and left it up to the provinces to make do, to such an extent that in 2004, that 40 to 50% of federal funding dropped to 18%. The feds were only covering 18% of healthcare spending. And that's all they're chipping in. And they're not even embarrassed about it. Paul Martin eventually felt a bit sheepish about it and said, look, I think we maybe went a bit too far. I think we should increase transfers to Quebec and the province. So they increased it by 6% from 18 to 24. And that lasted just until the third Harper government. Harper and the Conservatives said, okay, that's enough. 6% is too much. It's only going to be 3% annual increase now. So the Conservatives started putting the brakes to it. It's math, Madam Speaker. It's not complicated. The numbers tell the whole story. And they said, instead of 6%, we're going to give you 3%. And the Liberals said, oh, that's a good idea. That's a great idea. It's going to cost us less. So let's do the same. And they basically say, well, it's not our jurisdiction, so it's not our problem. So let's do a little math 101 lesson here. The Thompson report in 2013 or 14 came out and said that in order to keep pace with healthcare spending because of the aging population, with technology and so on, it should be 5%, not 3%. When you give 3, but it should have been 5.2, well, then you're not paying your fair share. And if you're not paying your share, someone else is going to have to make up for it. So, Madam Speaker, that's what's happening right now. We were at 25%. Now the feds are only paying 22% because over time it drops. And it's going down more and more. The underfunding is getting worse and worse, and it's become chronic. And I don't know, I might have to get out my little puppets and my crayons to explain this to them. Then the pandemic comes along, and the Liberals start screaming from the rooftops. They're saying, we're going to help everyone. We're going to help everyone. We're going to shovel $300 billion out the window. No, it's a health crisis. People are dying. They're in the hospitals. You'd think they're going to give us something for health care. Out of $100 spent on the pandemic, Madam Speaker, do you know how much of that is going to health care? Out of $100, 15 cents to the health care system, not $15. $15 wouldn't be enough, but 15 cents is all the federal benefits that are going to health care. It's a health crisis, and they're spending 15 cents only out of $100 on health care. And do we really have to stand up in the House and table a motion to say, wake up, look what you're doing to our health care system? And all they can answer is, oh, the Bloc is trying to pick a fight to start a squabble. But it's not just Quebec. All the provinces are saying this is urgent. We're all urgently, and it's not just the Bloc. It's all provinces and Quebec together saying that it's not enough. We're suffering here. It's a crisis. So what we're going to do is ask the federal government to bring it up to 35%. We know we're not going to get them up to 50 all in one shot, but 35%. Could the federal government at least pitch in 35% of the cost? It's logical. It's defensible. 50% of Quebec's budget goes to health care. 50%. And it keeps going up because they're not doing their fair share year after year. That's where we've come to, Madam Speaker. We're hitting a wall, and this government is going to have to finally get it. These are people we have to care for. These are sick people. These are deaths we want to avoid, and that's the work the Bloc Québécois is doing today. We're commending healthcare workers who are helping us get through this crisis, but we're also saying to the federal government, help us so they can help us. Help us help ourselves. It's just humanitarianism we're asking for. It's time they did their share, Madam Speaker. Questions and comments?
It's the Honourable Parliamentary Secretary.
Yes, thank you, Madam Speaker. And I think it is looking at everyone stepping up and doing their share. There's no doubt about that. And when you take a look at the federal dollars, for example, going towards the pandemic, I suspect that you will find for every $10 being spent, at least $8 is coming from Ottawa in terms of fighting the pandemic. And best examples of that would be the wage subsidy program, the CERB program. There's a significant suite of different programs that were provided from Ottawa. On top of that, there was also additional hundreds of millions of dollars. Remember, it says, well, 15 cents per Canadian. You know, I don't know the exact dollar, but you're going into the billions of additional dollars that went into healthcare. Does he not believe that the provinces also need to participate more extensively, or does he believe 80-20 is an appropriate level of support?
The Honourable Member for La Prairie. 500 million out of 300 billion. I said it's 15 cents on $100. My colleague says 80% of the effort of the money came from the feds. That's true. They're the ones with the greatest means. They're the ones sitting on all the money. There's a lot of money of that money that comes from Quebec taxpayers, and the services they're offering are more limited than what Quebec and the provinces have to provide. And they're stuck with the public debt crisis. And this basically limits greatly what the provinces can do. And that's the fiscal imbalance. That was explained by Séguin, who was a great liberal federalist. All the money's in Ottawa and all the responsibilities are in Quebec. Everybody gets that. But everybody thinks the fiscal imbalance started in 2003, but actually it goes all the way back to the drafting of the Constitution. The Fathers of Confederation created the fiscal imbalance because under the Constitution, there's too many soups in the kitchen. There were when the Constitution was drafted.
Jeune père, quand mes enfants étaient plus jeunes, ils me demandaient souvent d'avoir des sous.
when I was a child, I often would ask my parents for some allowance, and they said, okay, well, tell us how you're going to spend it and give an accounting for the money that you spent. So there was a sense of responsibility around spending. But you could buy whatever candy you wanted because you knew what you wanted. You knew what you liked. So this is a bit like this. The federal government's acting like a grandpa or a father. They're talking about all these great things they're doing in the economic statement. But I'd like to know from my colleague whether he likes this paternalistic approach that the government showed yesterday, the finance minister, in the economic statement.
The Honourable Member for La Prairie. Madam Speaker, I thank my colleague for his question. It makes no sense. Ottawa doesn't get health care, and that's fine. It's not because they're bad guys. The feds just don't administer and run the healthcare system. Provinces, Quebec, that's who knows how to run healthcare. And according to the 1867 Constitution, provinces have jurisdiction over healthcare. We have agreements. Ottawa needs to transfer funding to Quebec and to the provinces. But they are being armchair managers. They're lecturing us, and it's not time for that. Taxpayers have given money, and taxpayers need health care. So let the government use this money, taxpayer money, to give Canadians the health care that they need.
Madam Speaker, and of course, I'd like to join all my Bloc colleagues in thanking the healthcare workers in my riding as well, who've done such an amazing job, and in particular in the long-term care homes. And of course, I also join them in suggesting that federal transfer should be increased. The NDP has been calling that for a long time. And I just want to stress again that I thank the Canadian Forces for the work they did in Quebec, Ontario, and now are doing in Manitoba. But in the Defence Committee, we had interesting, when we were studying the response for the Canadian military, we had an interesting comment from the former PQ, the Parti Québécois Minister of Health, Régent Hébert, who said he had no problem with the national standards being established for long-term care because those standards would be the same for all Canadians, that provincial boundaries wouldn't really make any difference. There weren't really significant cultural differences there. And so that he thought establishing national standards, if that would help flow more funds to Quebec, would be a very good idea.
The Honourable Member for La Prairie. Madam Speaker, in the Armed Forces report, and in passing, I have to thank the Armed Forces for all of their hard work, but Quebec's taxpayers do pay for them. In the report, they said the problem wasn't lack of guidelines, rather, it was a lack of resources. They were on the ground. They know what the real problem is. The problem is a lack of resources, lack of funding. So why are we still debating this? Régent Hébert, I worked with him in 2012, 2014. When he was Minister of Health, he sang to a different tune. At the time, he felt totally different. He would get so angry, so inflamed when he would talk about lack of resources. He was furious. And that's that. Before we carry on, pursuant to Standing Order 31, I will read adjournment questions. Member for Mégantic-L'Érable, Agriculture and Agri-Food. The Honourable Member for Edmonton Strathcona, Official Languages. The Honourable Member for Bow River, Natural Resources. Resuming debate, the Honourable Member for Carleton. Thank you. I'll be sharing my time with the Honourable Member for Mégantic-L'Érable. I thank my colleagues from the Bloc Québécois for their motion, which we will support. We absolutely support increasing federal health transfers.
Madam Speaker, I'd like to speak about the other pandemic. Its symptoms include drug overdoses, depression, and even suicide. According to our Public Health Agency's recent report, the grim story is this: BC paramedics saw 2,700 calls, a 700 call increase in people asking for help to save the lives of someone who is overdosing on opioids. That's 700 more people yelling into the phone at an operator to ask for an ambulance to save the life of a dying person. It's not just BC. In Alberta and Ontario, 50% increases in opioid deaths. Stats Canada reports that the number of Canadians reporting good public health dropped from 68% to 48% in just the last 2 years. Calls to one suicide prevention line tripled, prompting one Conservative MP to call for all of the hotlines to be merged into one to serve all the desperate people seeking help during these desperate times. But what is behind all of this misery? Well, part of the answer is worklessness. Through no fault of their own, and because of the pandemic lockdown, 9 million Canadians were forced out of their work and rightly received CERB benefits. Now, replacing their incomes, while necessary, does not replace their work. Allow me to quote from the public health officer. Statistics Canada found lower life satisfaction among unemployed Canadians and noted that this relationship is about more than money. This is echoed by systematic reviews exploring unemployment and mental health, unemployment and health, and unemployment and mortality risks. The National Bureau of Economic Research found that a 1% increase in unemployment leads to a 3.6% increase in opioid deaths. The University of Calgary found that a 1% unemployment increase led to a 2% increase across Canada in suicide rates. In other words, worklessness is literally lethal. Researchers looked at 310 men laid off from a ball bearing manufacturing plant in the early 1980s and found that 2 years after the layoffs, those who still didn't have jobs reported higher rates of mental health, hospital visit, medication requirements, and other health problems. 2 years later, those people were suffering more than their compatriots who had found jobs. If worklessness had a warning label, it would read, and I quote, "Unemployment raises the chances by about a third that a man will die in the next decade," to quote the former editor of the British Medical Journal, Dr. Richard Smith. And for those in middle age with the biggest commitments, the chance doubles. The men are most likely to die from suicide, cancer, and accidents and violence, end quote. One study by Dr. Diet in the United States found that those people who remained out of jobs for long periods of time, even when they had no history whatsoever of mental health problems, were 125% more likely to experience mental distress after that unemployment. And it's not just about money. Harvard professor Edward Gleiser found that the mental health impact of worklessness was 10 times higher than the mental health impact of losing $25,000 in annual income. This goes to the core of who we are as human beings, the necessity to work, to put our brains and bodies to use for other people. To quote the Dalai Lama and Arthur Brooks in an essay titled "Behind Our Anxiety, the Fear of Being Unneeded," they wrote, "Virtually all the world's major religions teach that diligent work in the service of others is our highest nature and thus lies at the center of a happy life. Martin Luther King called it the dignity of labor. I am the captain of my destiny. That is the meaning of work. It is self-agency. It is mastering one's world rather than having the world master one. That is why I rise today to bring the House's attention to the urgent need to get the 600,000 people who are still out of work since COVID back into jobs. What does that mean? It means ending the war on work. We have in this country a system with clawbacks and taxes that can rob a single mother of up to 80 cents on the next dollar she earns. This system punishes people for putting their hands and their heads to work in a job to earn a little bit more and to try and get ahead. We must fix that tax system to make work pay for everyone. We must remove the regulatory and taxation obstacles that make it difficult and sometimes impossible for our First Nations communities to bring business and develop resources and give their young population the opportunity to make maximum contributions. We must once again unleash the power of our resource sector. Think of the number of people who have lost hope across the formerly bustling rural communities in Western Canada, where work is part not just of making a living, but of making a life, where people always took pride in getting out of the bed and producing. How many of them lost hope? How many of them took their lives since the government decided to try and phase them out of existence? Why not unleash the power of that sector to lift people out of poverty and give them once again the dignity of work that they deserve and so desperately want? Why not make Canada the fastest place in the world to get a permit to build a factory, a warehouse, open a mine, a shopping center, so that those places can be filled with workers? Why not make this the easiest place on earth in which to create the opportunities for people to get up every day and contribute, to restore health and happiness? We must not just increase healthcare funding, though that is necessary. We must also honor work and workers, reform tax and benefits to reward effort, free businesses to pay more wages, let labor keep more of the bread it has earned, and unleash the mighty force of 20 million Canadian workers. Because a job brings dollars and dignity, paycheck and purpose, a burden and a blessing, a good living and a good life. Madam Speaker, we have work to do.
Comments. The honourable member for Milton.
Thank you very much, Madam Speaker. And I rise today to, well, I'm jubilant, actually, because I heard my colleague opposite, the member from Carleton, possibly take a full 180 on something that I've seen him stand in this House before advocating against. And I recognize that the member's message today was about jobs. However, the premise was focused on the opioid epidemic. And this is something that I care deeply about. I also recognize that the previous government, his government, in which he served as minister, staunchly opposed any evidence-based measures to support those suffering from opioid addictions. And I have a quote here: "Should Bill C-2 become law, it will become extremely difficult to open a supervised injection site anywhere in Canada." This was a bill that he supported and defended. It was the Respect for Communities Act in 2015. An advisor to the previous Harper government, Benjamin Perrin, had a full about-face on this issue just recently when he began advocating for safe injection sites across the country in a more compassionate way to deal with the opioid epidemic. So my question, while it's not specifically about jobs, Madam Speaker, is have you had a 180, and do you now support safe injection sites in Canada and a more compassionate way of dealing with opioid addiction as a disease and not a crime? Thank you.
Member for Carleton.
So first of all, the member is absolutely right that opioid addiction is a disease, and its users, its victims are victims. They are not criminals, and they should be treated as victims. Our urgent priority should be recovery. And lifting those people up. I've worked with Harvest House here in Ottawa, which brings young men to an abandoned schoolhouse where they've renovated into a beautiful inpatient center that cleans them up, separates them from their troubles, gives them some skills, gets them earning money and back into their lives as good, honest law-abiding and drug-free citizens. There is hope for every single person to recover, and that must be our purpose. But in order to have recovery, we have to remember that all the ingredients of human need must be in the mix, and that includes work. And that was the point of my speech here today. We need to bring back work. We need to end the war on work. We need to honor the dignity of work. Thank you.
The Honourable Member for Saint-Jean. Thank you, Madam Speaker. Earlier, during the debate, the Parliamentary Secretary to the Government Leader reminded us of the 5 basic principles of the Canada Health Act and said that based on those principles, he will oppose this motion. Well, you know, the only people disrespecting the principles of the Act, that's Ottawa. Ottawa originally committed to 50%, and we're around 20% today. Here's my question for my colleague. Does he feel that the Parliamentary Secretary to the Government Leader is being totally hypocritical? The Honourable Member for Carleton. Yes. But there are so many Liberal ministers who are also being hypocritical. It's hard to add another Liberal to this group of being hypocritical. The Liberals are adding so much to our debt that in the future, all of our revenues, all the wealth generated by our workers will go to lenders, bankers, and the wealthy. There won't be any funding left over for other priorities, including healthcare. This is one of the reasons why we're proposing to protect our finances. We want a plan to gradually bring down deficits without major cuts like what the Liberals did in the 90s. Such a plan will take discipline and early planning starting now, and it's necessary for the benefit of our social programs and taxpayers.
Member for Courtney Alberni.
Thank you, Madam Speaker, and I want to thank my colleague for his speech. And I'm glad to see the Conservatives finally supporting a significant increase in the transfer of health share of costs to the provinces' investments. Madam Speaker, one thing that really concerned me was when he talked about CERB being the cause of opioid deaths in our country, when in fact we've heard from public health officials, including medical health officers on Vancouver Island, the mayor of Vancouver, calling on the government to first name that it's a national public health emergency under the Emergencies Act, the opioid overdose and fentanyl poisoning that's taking place, to decriminalize personal possession, and to create a system to provide safe, unadulterated access of substances to people who suffer from opioid addiction. And Madam Speaker, yes, we agree with treatment, but does he support those medical health officers and Moms Stop the Harm and all the medical professionals that are asking for a real plan and action?
A very brief answer from the Honourable Member for Carleton.
Well, of course, the member says is absolutely false. The CERB was necessary. We supported it from the very beginning. What I do say, though, at the same time, is while people need income while the governments have shut them out of jobs, we need to make it our urgent priority to make it safe again for them to get back to work, because work is part of a healthy life. And in the meantime, of course, they will need income supports from the government. As for the rest of the members' questions, we support recovery. We believe in recovery from addiction, and we believe that should be the urgent priority of governments to bring about the recovery of the people who are suffering from these addictions so that they can rebuild their lives and go on to a brighter future. Thank you.
Resuming debate, the Honourable Member for Mégantic-L'Érable. Thank you very much, Madam Speaker. First, I'd like to thank my colleague for his excellent speech. And I especially would like to thank him for paying special attention to those who are suffering from mental health problems. I can't remember my colleague's riding name. Carleton? No, in fact, my other colleague's riding, my colleague who is proposing that we have one suicide prevention hotline, the 988 hotline.
Great initiative to support and to help those with mental health. So I just wanted to say that I'm fully support of it, and I hope that everyone in this house will support this initiative. This is very important for all of us. Pour revenir à
So I thank my colleague from Caribou Prince George. Now, let's talk about today's motion. I would like to thank my colleagues for giving us this opportunity to talk about how important healthcare workers are. This motion is clear. We commend the work of all doctors, nurses, and orderlies in our healthcare system during the COVID-19 pandemic. We commend them for their work with COVID patients, but with all Canadians in general, and we thank them for the sacrifices that they make for their work on the front lines. We want provinces to have more funding because there is a significant impact on their budgets, but when the provinces ask, they don't receive it. We want health transfers increased by the end of 2020. My speech, it might be shared on social media. It's important that people know how each party feels. This is an occasion for all members in this House to applaud healthcare workers for their work. I want to name them. In the motion, we name some groups of workers, but there are others. For instance, ambulance drivers. Also, personal support workers. There was a shortage of PSWs during the pandemic. Then there are all the caretakers who work in these health facilities who have been under great pressure during COVID-19. We also thank security personnel as well as administrative workers, nurses, various categories of nurses, doctors, specialists. In a nutshell, Madam Speaker, we thank all those who directly or indirectly contributed to the healthcare system to help those who have suffered from this awful pandemic, COVID-19. It's so important that we thank them, Madam Speaker, because all of these workers I've mentioned have had to take extra precaution. They have had to isolate more than other Canadians. They have had to refrain from being with loved ones even more than other Canadians. Furthermore, they have been near COVID patients every day, thereby putting their own lives at risk, Madam Speaker. In fact, many healthcare workers got COVID-19 because of where they worked, and they worked long, long hours. We thank all healthcare workers. They deserve our commendation, our gratitude, and that's why we are recognizing them today through this motion.
It's an excellent motion which recognizes and congratulates all of the workers in the healthcare sector. In my riding of Mégantic-l'Érable, there are 3 counties in a red zone. Some people have died, and I knew them. I also know people who got sick. Madam Speaker, allow me to name the establishments which were most hit by COVID. Those people deserve that we recognize them. They deserve recognition for their hard work, and these institutions really deserve a couple of minutes of our time. Here's an anecdote. I was calling a residence long-term care facility. I wanted to speak with the residents, and as I was calling, somebody else was calling at the same time to tell people in the same institution that one of the residents had died of COVID-19. So these calls happened at the same time. It was a really tough moment for me, but especially for the families, the loved ones of one of the residents who died. So COVID-19 is not a myth; it's real. It's especially real for seniors. And seniors, for me, are a great thing. And I believe that all the more that we need to support this motion today. So the Lambton, Lac-Mégantic, and the Village Harmonie, the Château Marissa and Stratford, the Maison des Femmes, La Bouée, La Villa de l'Érable, the Marc-André Jacques Long-Term Care Home, the Saint-Alexandre Long-Term Care Home, l'Oasis, l'Hôtellerie Nouvel Âge, Accès Santé Service Plus, la ressource d'hébergement in Thetford, Saint-Alphonse, the Fortier establishment, the Thetford Mines, and other such long-term care facilities. I've named them, Madam Speaker, because in those establishments, people are living there, men and women who have chosen, perhaps not for long-term care, but retirement homes. These people have chosen to live out the last part of their lives there, and unfortunately, some of these people feel abandoned after COVID hit, so it's really important for us to recognize them today. So I support this motion. The Thetford Mines establishment sent out a message saying that it's important for everyone to follow public health guidelines to make sure that what happened in long-term care homes doesn't keep on repeating itself. Dr. Gaudreau said that he's got a family and kids. He wants to protect them. So he's calling on people to physically distance. He's an anesthesiologist who said it's a very pernicious virus. And Dr. Nathalie Boutin put out a message saying that I want to keep on operating and taking care of you. So let's all work together. Let's follow the rules. Because by respecting the rules, we will be protecting those who will take care of us if ever we get COVID-19. So we have to be careful and we especially have to think of those who've been hit by COVID, and we have to think of those who are looking after patients. The Conservatives will not stop putting pressure on the federal government to make sure that it sends supplies and whatever the healthcare sector needs. But, of course, the federal government should not tell the provinces how to spend the money. Each province has its own way of looking after its seniors in long-term care homes. So Ottawa really is not a father who knows best. The provinces know how to invest the money to protect their own citizens. And in fact, I was particularly disappointed by the economic statement. And when the statement said that the government would create a $1 billion fund to help contain the spread of the virus in long-term care homes. On the face of it, it looks good. But if you read a bit farther, it says the funding will be conditional upon presentation of detailed spending plans, and the administration will have to, the provinces will have to prove the money will be spent as presented in those spending plans. Well, the people who work for the government of Quebec know how to spend the money that comes from Ottawa. So it is up to the province to invest the money as it sees fit. It's not up to the federal government to dictate to Quebec how any money should be spent. The money should be spent to Quebec, which will know exactly how to spend the money to protect its own population. I think it was my colleague said national standards are unacceptable in this field. Could we all have done better? Yes, surely. Could the federal government have done better by interfering in provincial jurisdiction? Could the federal government have done better when it comes to the vaccines? Yes, the federal government could have done better. But at the end of the day, it's governments closer to the people who know how to spend the money better and who know how to manage their own things better. Thank you very much. Questions and comments? The member for Shefford. Thank you, Madam Speaker. I'd like to thank my colleague for Mégantic-L'Érable for his speech. He took a lot of time to congratulate the establishments in his riding. I'd like to take a few moments to congratulate the staff in Granby who've worked very hard to contain the pandemic. Now to my question. It's quite obvious that after a pandemic or a crisis, there's always a danger that austerity measures will be brought about. In the past, Liberals and Conservatives, in the name of balancing the books, have made cuts in the public sector. This time, there should be no cuts to the public health care sector after the pandemic. I'd like to hear my colleague on that. The member for Mégantic-L'Érable. Thank you, Madam Speaker. I agree with the first part of my colleague's question, where she congratulated all the staff from the Granby Hospital. They've all done a great job. But I don't agree with her when she said that the Conservatives equal austerity. That's not true. We support stable and predictable, unconditional healthcare transfers. And we believe that should happen now and after the pandemic. That's why we'll support the motion we are debating. If the motion wanted to do something else, we would not have supported it. We recognize that in the course of a pandemic, it's important to have sustainable, predictable funding, and it's important to have that approach after the pandemic. Questions and comments?
Yes, thank you, Madam Speaker. I'm wondering if the member can elaborate when he talks about the ongoing funding aspect of national health care system, and how much does he or the Conservative Party believe ultimately, in terms of a percentage, should be transferred over in health transfers to provinces? Does he have a percentage that he's prepared to share with the House?
The member for Mégantic-L'Érable. Well, Madam Speaker, I know that the parliamentary secretary of the government leader in the House is looking forward to sitting on this side of the House and to ask questions when we are in government, questions about our percentages. But the Liberals cannot even give us a single date, and they have the gall to ask us for a percentage on health transfers. We've asked when the first Canadian will be vaccinated. No answer. We've asked when Canadians will start to be vaccinated. No answer. They've said they've ordered enough vaccines, enough doses so every Canadian has 50 vaccinations. And again, they should answer our questions. The member for Abitibi-Témiscamingue. Thank you, Madam Speaker. I have a message from my colleague. I don't aspire to form government. I'm here to defend Quebec's interests and the interests of all Quebecers. So I could ask that question on the percentage of transfers. If the Conservatives claim they are the government in waiting, and it's always a pleasure to hear them say this in the House, would they agree to the request of the premiers for $28 billion in healthcare transfers? Thank you. The member for Mégantic-L'Érable. Well, again, Madam Speaker, I partly agree with what the member from the Bloc just said, and this seems to repeat itself. Of course not. They will never form government. I agree with that. They will never carry out any federal project, and so they will never be able to control the purse strings and decide how much money goes to the provinces in healthcare transfers. They will never be able to decide where money will be increased, where money will be decreased. They'll never be able to do that. So I completely agree with that assertion, which my colleague just made. And my colleague was very honest in saying that the Bloc Québécois will never form the government here in Ottawa, that the Bloc Québécois will never be able to set percentages. What we will do is ensure that there is predictable, stable, and proper funding for healthcare systems across the country.
The honourable member for Vancouver East.
Thank you very much, Madam Speaker, and I thank the member for his comments. Healthcare workers have been at the front lines of this crisis for nearly a year now. Of course, they need more than just words in terms of gratitude, and what they need is for the federal government to support them to win the fight against COVID. Now, the federal share of overall healthcare funding in Canada has plummeted to 22%. Right now, over the years between Liberal and Conservative governments. We started at 50% when Medicare was first established in Canada. So the Harper government, instead of actually providing stable funding, they in fact cut the healthcare transfer dollars. In fact, the healthcare accord during the 2015 election, the Conservatives negotiated the health accord with the provinces and territories and unilaterally cut the healthcare transfer escalator from 6% to 3%. So when the member talks about funding that is stable, would the member in the Conservative support increasing transfer payments to 25% and with escalators continuing thereafter?
Honorable député de Mégantic-L'Érable.
The member for Mégantic-L'Érable. Thank you, Madam Speaker, and I'd like to thank my colleague for her question. Now, in this pandemic, as she said, it is important to send a clear message to all workers in the healthcare sector that their elected representatives here are there to support them. We're thinking of them. And we're here at the end of the day to make decisions. This is why we support the block motion, which clearly states, which clearly calls on the government to increase healthcare transfers by the end of the year so that all provinces can benefit. That's pretty clear, isn't it? Well, moving on. As it is 5:15, it is my duty to interrupt proceedings and to dispose of all issues related to supply. The question is as follows. Mr. Blanchette, seconded by Mr. Terrien, moves that the House, A, recognizes the extraordinary work of healthcare sector workers, including doctors, nurses, and orderlies during the COVID-19 pandemic, especially with young people and all Canadians. B, recognizes the courage and the sacrifices required of them and their families to be on the front lines. C, underscores the work of Quebec and the provinces to respond to the health crisis and acknowledge the effects of the pandemic on their budgets. And D, calls on the federal government to increase in a sustainable way healthcare transfers before the end of 2020 to support the efforts of Quebec and the provinces and to support healthcare workers and Canadians. So if a member from a recognized party in the House asks for a recorded vote or for the motion to be adopted with dissidents, I would ask that the member rise. The member for Repentigny. Thank you, Madam Speaker. We are calling for a recorded vote. So pursuant to the order adopted on Wednesday, September 23rd, 2020, the vote will be deferred until Wednesday, December 2nd, after oral questions.
Point of order.
Madam Speaker, I suspect if you were to canvass the House, you might find unanimous leave at this time to call at 5:30 so we could begin. Private members are.
Is consent? So it being now 5:30, the House will now proceed to the consideration of private members' business as listed on today's order paper.
Private members' business, resuming debate at second reading of Bill C-210, an act to amend the Canada Revenue Agency Act, organ and tissue donors, standing in the name of Mr. Weber.
Resuming debate, the Honourable Parliamentary Secretary to the Leader of the Government.
Thank you, Madam Speaker. And it's interesting day today where we start the day off talking about healthcare and just how important it is. And now we get into private members' hour. And, the member from Calgary Confederation is brought forward to this House, I believe, a bill that has fairly good support from all sides of the House, as I anticipate the willingness to ultimately see the bill go to committee, at which point in time I'm sure there will be a lot of interesting discussions and possibly a number of presentations, but we'll leave it up to the standing committee in order to establish that. I did want to recognize whether it was the member from Calgary Confederation and even other members. I know, for example, the member from Oakville North Burlington has also been a very strong advocate from within our caucus in terms of making sure as much as as possible, we can get this this bill moving forward. And I believe that after today, the opportunity for it to go to committee will be there. And knowing the efforts of some of the members that have been lobbying on this bill, I suspect that the committee will be dealing with it in a relatively quick fashion. And I wish them well in terms of getting it processed. Madam Speaker, I have had the opportunity to provide a couple of minutes prior to today, and I thought what I would just kind of share with the House, and I did something very, very quick on this, and because when we talk about issues such as organ transfers, and you say, well, what is it that this legislation attempts to do? And really, it's about CRA, Canada Revenue Agency, working with different provincial governments and territorial governments, and seeing ways in which we could ultimately see the establishment and maintenance of an organ and tissue registry. And that is something in which I believe is something that's worth pushing forward. I know many years ago, and one of the names that comes to my mind, he has since passed, is the late Hank Horner. Hank was on for the longest time waiting to get a transplant, Madam Speaker. And I can tell you, the attitudes, and it's hard to really appreciate it, but the attitudes that often these organ recipients have in terms of as they're waiting is truly amazing. They, as opposed to being angry and so forth, the exchanges that I've had with people on that waiting list is really is quite touching, and you want to go that extra mile, and you often wonder why it is that we don't have a higher percentage in terms of people registering. I know in Hank's case, he used to lobby me saying what we should do is we should have MPI, Manitoba Public Insurance, work with the provincial government and try to get a registry established with driver's license. And for good reason, Madam Speaker. It made a lot of sense. Some people would say, well, much like how you have stickers on license plates, you should put a sticker on a license plate to those that are donors. There's obviously a great deal of passion in regards to this issue, and we've seen that in a number of speeches that I've witnessed thus far, and this isn't the first time in which we've been debating this legislation. So for members like the Oakville, North Burlington, and Calgary Confederation, I do applaud them in terms of their efforts in bringing the legislation to the point in which it is today. And I know that in particular the member from Calgary Confederation had used his priority in terms of bill placement and was also able to get additional support in order to be able to get it bumped so it would get that second hour of the debate today. I thought I would just very briefly, Madam Speaker, share what I thought was an interesting stat, and it comes from the Canadian Institute for Health Information that I had received over the internet, and I thought it was somewhat pertinent to what it is that we're talking about, because it puts into perspective some actual numbers. In 2018, there was a total of 2,782 transplant procedures of all organs were performed in Canada. That was an actual increase of 33% since 2009, Madam Speaker. And the next thing that I'm going to go over will clearly demonstrate why it's so important that we continue to take actions that are necessary, that will support people to getting onto registries or to donate, Madam Speaker. And this is a table that I'd like to reference. When you think of, and I'm going to speak specifically of organs, the top organs, the organs that are used in terms of transplants: kidneys, liver, heart, lung, and pancreas. When you think in terms of the kidney, and kidney is the largest number, 1,000. Number of organs that were actually transplanted, Madam Speaker, 1,706. Now, when you take a look at it, number of patients on a waiting list, 3,150. Now, there is some qualification to that because not all provinces were able to get the actual hard number in, but roughly, on a waiting list, 3,150. An active amount, and again, we're talking about 2018, 2,045. The last column is the one that I find is something that really kind of wakes us up to the reality of the importance of it. The number of patients who died that were actually on the waiting list in this particular category was 95. And to me, that speaks volumes in terms of why it is. You take a look and you wonder, what would have happened for those 95 individuals? What kind of future would they have had they received that important transplant? Now, kidney is the highest, but another one where there was a high number of people that had died on the waiting list, Madam Speaker, was in regards to livers. Total number of organ transplants was 533. Number of patients on a wait list was 527, active 377. Now, the number of patients who died on the wait list, and again, you have to try to get a better understanding of some of these numbers, but in this particular table, it's 82. So you can, again, get that sense of just how important it is. Very quickly, Madam Speaker, heart, number of transplants, 189, lung, 361, pancreas, 57. And obviously there's tissues and so forth, Madam Speaker. The point is that I do believe that there is things that government can do. And I think Ottawa working, because you have to be very much cognizant of the issue of responsibility, of jurisdictional responsibility, and I think that Ottawa can play a role that we'll hopefully get a better understanding as it goes to standing committee with CRA working with provinces or willing provinces and territories. Thank you, Madam Speaker.
The honourable member, l'honorable député de Shefford.
The honourable member for Shefford. Thank you very much, Madam Speaker. I rise today to speak to Bill C-210. This bill seeks to amend the Canada Revenue Agency Act to allow CRA to enter into agreements with provinces or territories to collect through income tax returns the information needed by the provinces to establish or maintain an organ donor registry. The second part of the bill allows CRA to share this data with provinces and territories that have entered into an agreement. Today, I'll talk to you about it from three angles. First, our party's position on the subject. Then I'll read some excerpts from articles that will talk about the situation of organ donation in Quebec and Canada. And finally, I'll say a few words on the difficulties the pandemic has created for organ donation. First of all, I'll state the Bloc Québécois' position. We're in favor of this bill, which should have absolutely no impact in Quebec. We also want Quebec to manage a single tax filing, and even if we don't get it, Quebec can get all the information with its own tax return. Let me explain. This bill doesn't cause any problem for the Bloc Québécois, but it's unlikely Quebec would want to enter into any agreement with CRA, since Quebec already has its own tax filings. Instead, what we want is to see a single tax return managed by Quebec, which would mean that this bill would not affect Quebec at all. Even if Quebec wanted to enter into an agreement, we have no problem with sharing information. Quebec is free to decide whether or not to enter into an agreement. This bill does not bind Quebec and does not impose any conditions. Allowing CRA to collect information following an agreement with the province concerned and to disseminate it to the provinces is not a problem. It's even a good way to go, since CRA manages all tax returns already outside of Quebec. Take Nova Scotia, for example, which recently legislated to reverse consent to organ donation. Now, Nova Scotians are presumed to consent unless they indicate they don't. In Quebec, the debate's heading in the same direction as Nova Scotia. It's on their health insurance cards that Quebecers currently indicate if they consent to donate their organs at death. So Quebec has all the information it needs to make things better. According to experts, increasing the number of organs available would help a lot, but even more is needed, like more specialists, to do the transplants. We come back here to the debate that the Bloc Québécois raised today and debated, and that is the importance of increasing health transfers to Quebec and the provinces. It's a matter of logic. Without additional funding, it would be difficult for Quebec and the provinces to have these specialists. Moreover, the number of potential donors is relatively limited, which further complicates the matter. In the second part, I will illustrate with a few statistics taken from recent events that nevertheless expose this problem of organ donation in Canada, since the supply is insufficient to meet the demand, because even if the number of transplants has increased by 33% in the last 10 years, there's still a shortage of organs in Canada, according to the latest data published by CIHI. In 2018, 4,351 Canadians were on a waiting list for transplants, according to CIHI, or CIHI. In the same year, 2,782 organ transplants were performed in Canada, while 223 people died while awaiting a transplant. The growing rate of Canadians with end-stage renal disease, which has increased by 32% over the decade, is one reason for the increased need for transplants. As a result of improved organ donation practices in Canada, the number of transplants has increased by 33% in 10 years, according to Greg Webster, Director of Ambulatory and Acute Care Information Services at CIHI. For most organs, the 5-year survival rate for patients is over 80%. One of the reasons for the increase in transplantation is that many countries have expanded their organ donation practices from deceased donors to include not only donors after neurological determination of death, but also donor after cardiocirculatory determination of death, that is, donors whose hearts have stopped beating. For example, the number of transplanted organs from donors after cardiocirculatory determination of death increased from 42 in 2009 to 222 in 2018, an increase of nearly 430%. As there are more donors, the total number of donors in Canada has increased significantly, resulting in reduced wait times, particularly for kidney and lung transplants, according to Dr. Jagbir Gill, transplant nephrologist at UBC. The number of donors after brain death has also increased by 21% between 2009 and 2018. This is an encouraging trend, since a deceased donor can provide up to 8 organs. CIHI data also reveals that in 2018 in Canada, there were 555 living donors and 762 deceased donors. The number of deceased donors increased by 56% between these years, while the number of living donors remained stable. Despite an improvement in donations, there were 4,351 people on the waiting list in Canada at the end of 2018. These patients were waiting for a kidney, liver, lung, heart, or pancreas. So it's not that simple. We need more specialists. 4 years ago, there was a patient awaiting a transplant. He's been waiting for 3 years. Sammy is on the short list waiting for a transplant. And there's a 60-year-old constituent who saw her life turned upside down 2 years ago when the condition of her lungs deteriorated. She finally underwent a double lung transplant. Of course, automatic consent can't hurt. No doctor will remove the organs without the family's consent. Since Nova Scotia passed its bill that assumes all citizens are organ donors, there's been a nationwide reflection. Nova Scotia Premier Stephen McNeil hopes his initiative will snowball, but for now, nothing's certain. New Brunswick is looking closely at the idea, and the governments of Quebec and BC say they will be attentive to developments in Nova Scotia, and Ontario says it's quite happy with its system. Some European countries like France and Spain have adopted automatic consent and did so years ago. The data do not yet show a clear correlation between automatic consent and an increase in the number of donors. It's a simple solution to a complex problem, according to Marie-Chantal Fortin at CHUM. We've seen in countries with automatic consent like Spain, where there's an excellent organ donation rate, and the U.S., where there's no automatic consent with excellent organ donation rates as well. Instead, the experts agree there's a need for better training of medical teams and, above all, to talk about organ donation around you. The idea is to talk about what we want and dispel the myths. And my final point, The pandemic has exacerbated problems related to organ donation. According to a July 2020 article, organ donations are at their lowest level in 5 years because of COVID-19. Transplant Quebec has issued a warning about this shortage. The provincial organization counted only 2 people who donated organs to save 5 patients in April 2020, when the number of donors was already at a low point. The slowdown because of COVID-19 is mainly due to these exceptional circumstances. The need to ensure the safety of patients to be transplanted, as well as the massive reorganization in hospitals, may have contributed to these results, according to Louis Beaulieu at Quebec's Director General of Transplants. Despite the resumption of activities in May, Transplant Quebec has noticed a 50% decrease in the number of organ donors and a 60% decrease in transplants for the second quarter of 2020 compared to the same period in 2019. In conclusion, I hope we'll be able to broaden the solutions in order to save lives. And we are quite open to discussing the issue of signing the back of your card, because there's some interesting testimonies. People have said, for example, just because I'm 92 doesn't mean I can't donate an organ, says Quebec's oldest organ donor. He gave his liver and the recipient is doing well. The smallest, it's more tragic, he had 48 hours. He was able to donate his heart. So just sign the back of your card. Thank you.
Resuming debate, the honourable member from Vancouver Kingsway.
Thank you, Madam Speaker. It's a real pleasure to stand in this House today and support Bill C-210 with great thanks to my honourable colleague from Calgary Confederation, who I had the immense pleasure of serving with on Health Committee for a number of years. And I can't think of a finer parliamentarian and a more collegial, publicly minded representative than he. And I'm so pleased to support legislation that I know he has fought so hard to make a reality in this place. This legislation amends the Canada Revenue Agency Act to authorize the Canada Revenue Agency to enter into an agreement with a province or a territory regarding the collection and disclosure of information required for establishing or maintaining an organ and tissue donor registry in the province or territory. In short, Madam Speaker, what this act will do is allow Canadians to indicate on their tax return that they wish to have their information shared with a provincial or territorial organ and tissue donation program to help facilitate and expedite the donation of organs and tissues in this country. Now, Canada's New Democrats believe that we must make every possible effort to ensure that every Canadian who needs an organ or tissue transplant receives it. Just one donor can save up to 8 lives and benefit more than 75 people. And yet, at 18 donors per million people, Canada's current donation rate puts us in the lower third of developed countries. So allowing Canadians to register as an organ and tissue donor through their tax returns will help increase registration rates, improve consent rates, and help build a donation culture in Canada. Now, this legislation was first introduced in the 42nd Parliament as Bill C-316. Despite passing unanimously in the House of Commons, C-316 was one of several bills that unfortunately were allowed to die on the order paper in the Senate before the last election. By the way, the Senate also blocked legislation to give mandatory sexual assault training to federally appointed judges, implement the United Nations Declaration on the Rights of Indigenous Peoples, and ban unhealthy food and beverage marketing directed at children at that same time. But this, Madam Speaker, was a life and death matter. Canadians are currently dying on wait lists simply because our organ and tissue donation rate is so unacceptably low. At present, only 20% of Canadians have joined their province's organ and tissue registry. Provinces like Ontario are taking steps to make it easier by asking about organ and tissue donations on health card and driver's license renewals, which has increased registrations. However, even when everything is in place, some 20% of families refuse to transplant a registered donor's organs and tissue. In our recent study on organ and tissue donation at the Standing Committee on Health last Parliament, we learned that of the 4,500 Canadians on the wait list, 260 died waiting for an organ in 2016 alone. In order to better meet this demand, improved coordination across provinces and territories is needed. So Bill C-210 allows the federal government to coordinate with provinces and territories to allow Canadians to register as an organ and tissue donor through their federal tax filing. Now, this act aligns with the long-standing advocacy and legislative work of New Democrat MPs around organ and tissue donation. The bill is essentially a version of a previous proposal to create a pan-Canadian organ donor registry to coordinate and promote organ and tissue donation throughout Canada. And in February 2016, Conservative MP Ziad Abultaif, whose own son had been the recipient of 3 donated livers, reintroduced a private member's bill calling for a national registry. Now, that bill had previously been introduced 7 times by both a Liberal and 2 New Democrats, Lou Sikora, Judy Wazalisha-Lease, and Malcolm Allen. Unfortunately, the Liberal caucus voted to defeat Mr. Abultaif's bill. The Liberals defended their decision to kill the bill without study by claiming that it was a matter that is under provincial jurisdiction, and it is for that reason that the bill was unsupportable. Now, leaving that question aside, I want to just quote from a couple of important stakeholders. The Kidney Foundation of Canada says, in an environment where the supply of donor organs is so low and demands are so high, missed opportunities for donation are literally a matter of life and death. Donor organs are rare and precious, and every opportunity needs to be pursued to ensure that no potential donation is missed or lost, because it also means lost lives of those waiting for transplant. Dr. Philip Halloran, professor of medicine at the University of Alberta, said this: donations in Canada are not performing at the standard that our colleagues in the United States are performing at, and there isn't really any excuse except organization and accountability. So I was quite disappointed to see jurisdiction thrown up by the Liberals as a barrier to facilitating organ and tissue donation. Now, a few facts. While 90% of Canadians support organ and tissue donation, less than 20% have made plans to donate. Unlike the United States, Canada does not have a centralized list of people waiting for an organ or tissue transplant. The efficiency of donor registration varies greatly from province to territory. In the case wherein someone dies outside of the province where they are registered for organ and tissue donation, it's highly unlikely that the hospital would be able to identify them as a donor. Online registration is available only in 5 provinces: British Columbia, Ontario, Alberta, Manitoba, and Quebec. Even if someone is registered as a donor, the family has the final say. As I pointed out, about 1 in 5 registered organ and tissue donors had their wishes overridden by family members, according to a 2016 report in the Canadian Medical Association Journal. For every patient in Canada that does receive an organ transplant, there are 2 more on the wait list. In the past 10 years, the number of decreased organ donors has gone up by 42%, so there's progress, but the number of people needing a transplant has also gone up at the same time. Over 1,600 Canadians are added to the organ wait lists yearly. Now, Canada is the only developed country without national organ donation legislation, such as the 1984 U.S. National Organ Transplant Act. Madam Speaker, it's time that parliamentarians united and address this very pressing need. We can't let jurisdiction, we can't let difficulty, we can't let party interests, we can't let technicalities get in the way of doing what we all know is necessary, which is we must make it much more efficient and simple for Canadians who overwhelmingly want to donate organs and tissue to do so to save their family members and other Canadians. I want to conclude just by saying it's my view that the best system of all is what's called an opt-out system, where everyone is considered to be an organ donor unless they specifically opt out. Now, what this does is it respects the right of everyone who doesn't, for various reasons, religious, philosophical, health, or any other reason at all, to not be an organ and tissue donor if they don't want to. But there are many countries around the globe that have such a system, and what we see in those countries is that the rates of organ and tissue donations and of transplants dwarf Canada's. It saves lives. So, Madam Speaker, I hope that all parliamentarians can work together, support this bill, and expedite it, not only through this place, but also ensure that the Senate passes this legislation as soon as possible so that we can do everything we can in this country to facilitate organ and tissue donation and transplanting as soon as possible. Thank you, Madam Speaker.
Resuming debate, the honourable member for Edmonton Manning.
Thank you, Madam Speaker. And at the beginning, I would like to congratulate and thank the honourable member from Edmonton Queensway for his speech, for his call on supporting this very, very important issue and very close to my heart goal that I was always aiming to see happening on the floor of this House of Commons. Madam Speaker, in 5 years in this House, I cannot think of a bill that I have agreed with more than this one. Bill C-210, proposed by the honourable member of Calgary, or for Calgary Confederation. He is to be commended for his vision and desire to help Canadians. Bill C-210 is an act to amend the Canadian Revenue Agency Act, Organ and Tissue Donors. Is a short bill, only 2 clauses, a simple, effective, and life-saving act. With a yes vote, we can all save lives. Bill C-210 authorizes the Canada Revenue Agency to ask those filling out their tax forms if they wish to be organ donors. It allows the CRA to provide that information to provincial health authorities for their organ donor lists. When we talk about organ donation, we frequently talk facts and figures. I intended to give you some of those today. Sometimes, though, we forget that behind each number, there's a human involved. Lives became impacted for better or worse, depending on the availability of a much-needed transplant. It is that human element that makes this bill so important. For example, let me tell you about my story. I'll tell you about my son, Tyler. When a child is born, parents always have great dreams for them. There is unlimited potential. We are excited to see how they will fulfill it. So it was with Tyler, who is now a young adult. My wife and I are very proud of him. Tyler is alive thanks to not 1, but 3 organ donations. Without them, I would be standing here to tell you a story of a life lost, not a life saved. Tyler was born with a defective liver when he was very young. It became apparent that without a transplant, he would die. The liver is a remarkable organ that can regenerate itself. That means that a transplant can be from a liver donor or a live donor. That is, if the two are compatible. With any surgery, there are risks. And 20 years ago, liver surgery were much, much riskier than it is today. No one undergoes such a procedure without much thought beforehand. I was a compatible donor. Would I risk my life to allow my son to live? Of course I would. And the operation was a success. That though is not the end of the story. That the first transplant did not last. On Christmas Eve 2003, it looked like Tyler's time had run out. His life expectancy was now days, perhaps hours. I was not allowed to make a second donation. Almost miraculously, a liver became available from a Quebec man who had just died. We were told it was not a perfect solution. It would only buy time. But time was what we were desperately looking for. After a decade, that liver also began to fail. One more time, we entered the medical system. Our emotions are a mixture of hope and fear. There were no guarantees. We knew the statistics. We knew the odds. And we had, as we had done before, we prayed for a miracle. Once again, a grieving family offered a loved one's organ for the good of the community, and a match was made. Today, we are so grateful to have a healthy son. There's no sufficient words with any language to express the gratitude that my wife Liz and we still have the feel for the anonymous donors who saved Tyler's life. Our family's experience is not unique, but there are not enough available organs to meet the need. Bill C-210 seeks to alleviate that. When Tyler first began having problems, I became aware of the unmet need for organ donations in Canada. There are literally thousands of people waiting for the telephone call that will change their lives and the lives of the families around them. Tragically, for more than 200 Canadians every year, the time runs out before the phone call comes forward. More than 90% of Canadians support organ and tissue donation. That's a great yield. But that, in theory, only less than 25%, they made plans to donate. I won't embarrass the honorable members by asking for a show of hands as to how many of you have registered to become organ donors should you die. It probably isn't as many as you would expect. Canada's organ donation rate puts us in about 20th place in international ranking. We need to do better. After all, one donor can benefit more than 75 people and can save more than 8 lives. A single donor can provide lungs, heart, liver, kidney, corneas, and more. According to the Canadian Organ Replacement Register, in 2018, there were 762 deceased donors in Canada and 2,782 organ transplant procedures performed. However, there were 4,351 people on organ transplant waiting list. 223 of those people died waiting for an organ to come available. That is a sad statistic. The demand for organs is increasing, but the supply is not maintaining the pace. The number of patients on the waiting list for kidney transplants is approximately 2.5 times higher than the number of transplants performed. More than 1,600 Canadians are added to the wait lists each year. That means we are falling behind. The various ways of registering to be an organ donor are good, but more effort is needed. It isn't that people are opposed to the idea of organ donation, but we don't seem to be that great at putting the idea into practice. By expanding the numbers of those willing to be organ donors, Bill C-210 could help save lives. By allowing people to indicate their wishes before death, medical personnel don't have to approach a grieving family at the worst possible time to ask about the gift of life. What if it was your son or daughter that needed a transplant? Would you not do everything in your power to make sure it could happen? By making the simple change to the income tax forms through Bill C-210, we will be giving Canadians an easy way to do the right thing. Madam Speaker, we are talking about a bill that could literally save thousands of lives. Think about that. Think about what we do here in this House and how we frequently are unsure of the effects of our action. With Bill C-210, we know we will be doing good. How many lives lost is too many? In many ways, that is the question we are asking today. We have an opportunity to do good for all Canadians. Why waste it? Madam Speaker, I do urge every member here to support Bill C-210. Thank you.
Resuming debate, reprise de débat, the Honourable Parliamentary Secretary to the Minister of National Revenue.
Merci, Madame la Présidente.
Thank you, Madam Speaker. I thank my colleague, the member for Calgary Confederation, for bringing to the forefront the issue of organ and tissue donation in Canada. Let me begin by quoting some national data in order to give the House a snapshot of the situation. There are nearly 4,400 people in Canada who are waiting for organ and tissue transplants. More than 1,600 people are added to the waiting list every year. However, it is absolutely devastating to note that approximately 250 people die each year in Canada while waiting for a transplant. Madam Speaker, many of these deaths are, in fact, preventable. The reason for that is simple. There are too few organ and tissue donors in Canada. This is all the more upsetting when you consider that a single organ or tissue donor can save up to 8 lives and improve the quality of life of 75 other people. That's why, Madam Speaker, I am pleased to support this bill at second reading. I must say that I do very much look forward to a thorough review of the legislation in committee. We all care deeply about the fact that too many Canadians are waiting for organ and tissue donations. We all, each and every one of us, want to see the list of donors in Canada grow longer. However, when we review this bill in committee, it will be important that we ensure that it does indeed achieve its objective, and in the best possible way. In my opinion, we must ensure that this bill provides some of the most efficient and effective ways for the Canada Revenue Agency to collect donor information. Furthermore, it will also be necessary to ensure that the Canada Revenue Agency can interact with the provinces and territories to see if amendments are needed to improve the bill. It would also be useful to hear from the agency's non-partisan and professional experts, to hear from them in committee, as they would eventually be called upon to administer this proposal. If possible, it would also be useful to hear from the CRA's provincial and territorial experts on the matter in committee. Ultimately, this bill should be carefully studied to ensure that it creates the best possible framework for Canada's provinces and territories, so that they can work easily and voluntarily with the Canadian Revenue Agency in collecting and sharing donor information, and in doing so securely. The idea, of course, is to reach the best possible legislation, because it is clear that far too many Canadians are waiting for organ and tissue transplants in Canada.
Say that the Government of Canada is already turning its attention to this issue. As announced in Budget 2019, effective 2019-20, Health Canada will receive $36.5 million over 5 years, as well as an additional $5 million per year thereafter, to help in the development of a pan-Canadian data and performance system for organ donation and transplantation, in collaboration with provincial and territorial partners. The funding will also support the promotion of organ and tissue donation to the Canadian public. According to polls on this issue, a majority of 90% of Canadians support organ and tissue donation. But in fact, less than 20% of Canadians plan to donate their organs and tissues. In light of these statistics, it is clear we need to raise awareness of this issue amongst Canadians. Sensibiliser.
Raising awareness about organ and tissue donation is urgent. Year after year, despite small gains here and there, the results, at the end of the day, are still disappointing. For example, there has been a 42% increase in the number of deceased organ donors over the past few years.
Bien que ce chiffre soit
While this figure is encouraging, the number of people requiring transplants has unfortunately also increased over the same period. As a result, the situation is still very difficult. The result? Canadians are dying because they have not received an organ or tissue transplant. This is literally deplorable. Recently, I came across a story that I find incredibly inspiring. It's the story of Logan Boulet. Logan was a defenseman for the Humboldt Broncos, a junior field hockey team. Together with the team, they were on their way to a game when the bus was hit by a transport truck in April 2018. This story made headlines, and it was much talked about in Canada. However, Logan had signed up to become an organ donor. He had made his wishes known in the weeks before he died. He was therefore able to donate his heart, lungs, liver, both kidneys, and both corneas. The news of this generous donation produced what has been called the Logan Boulet effect. More than 100,000 people across Canada registered to become organ and tissue donors in the weeks that followed. His father, Bernie, launched an initiative the following year. He called it Green Vest Day. This initiative, in memory of his son's gesture, aims to raise awareness about organ and tissue donation. Imagine an increase, Madam Speaker, of 100,000 donors. So touching, despite the tragedy.
Must be done to address the serious need for organs and tissue available for donation, because today, transplants can help burn victims recover, remove the need for long-time dialysis, reduce the need for amputations, repair childhood heart problems, assist in heart bypass surgery, replace lungs affected by cystic fibrosis with healthy ones, replace disfigured facial features for accident victims by providing a cosmetic solution. Living donors who are of the age of majority and in good health can donate a kidney, part of the liver, and a lobe of the lung, and continue to lead a full and rewarding life. And what could be more rewarding than saving someone else's life, Madame Speaker? Madame la Présidente said...
Madam Speaker, it's by educating Canadians that we will increase the number of donors. The Logan Boulet effect is there to prove it. In addition, it's by working together at the national level with the provinces and territories that we will continue to improve the organ and tissue donation and transplantation system to ensure Canadians have timely and effective access to care. Thank you very much, Madam Speaker. Resuming debate, the member for Lac-Saint-Jean. Thank you. Madam Speaker, it's an honor for me to speak to Bill C-210. In fact, Madam Speaker, I feel the topic has the potential to meet the urgent needs of many Canadians. It's true that Quebec can rest knowing that this bill will not really affect it. I warmly welcome the efforts undertaken by Nova Scotia for automatic organ donation. C-210 rather, will help organ and tissue donation. As I said, Quebec doesn't need this federal law because it already has its own legislation. But you know me, I'm always attentive to what is happening here. The National Assembly unanimously adopted such a bill, and I hope the same thing happens elsewhere in the country because there is such a strong need for donated organs. The Quebec formula has shown that it works, and that's because Quebec is close to its people. So a government that decides to work on this issue can only get my support. And it's nice to see everyone agrees with this, because often it's the opposite here. However, my fellow Quebecers would be unhappy if I didn't mention the fact that we want that they want to be able to implement a harmonized tax system administered by Quebec. This government has rejected the idea, but we put it to this government again that Quebec should be able to look after its own tax collection system on its own. And if that happens, we will have to ensure that Quebec, which is a generous society, can become even more efficient. Now, coming back to organ donation, it is up to Quebec and the provinces to see what works best for them. This issue speaks to the values of each individual, and each people, each group has its own funeral rights. And often these rights vary from group to group. The Conservatives say that they are for collective rights, and we here at the Bloc are fighting for independence. So when it comes to organ donation, how do things actually play out? Well, it's not a straightforward issue, and that's understandable. In Brazil, they even went back on the measures they had taken, so each society has to do what's best for it. So I'd like to speak on behalf of Quebecers, because small things can get more people to sign up as donors. The Saguenay-Lac-Saint-Jean, my region, has a very high donation rate alongside of Spain, which also has a very good donation rate. There is a real organ donor culture in our area, and people who wish to donate are in contact with authorities who take down their contact information. So the system in the Lac-Saint-Jean area is very effective because healthcare professionals have been trained and they follow up with individuals. A donor culture, a strong donor culture means that the healthcare workers are already trained to speak with families of loved ones who have died. So it's very important for a good healthcare system that it be innovative and can adapt. And in fact, having a good organ donor system in place means that the entire healthcare system will be the better off for it. The provinces are all trying to manage healthcare expenses which are out of control, and the federal government wants to impose its own standards, even though last night in the economic update there was nothing significant in the area of healthcare. For the federal government, it's a matter of out of sight, out of mind. It had completely forgotten about organ donation, but suddenly it has seized on the issue. And the Liberal and Conservative governments in the past systematically made cuts, thus increasing the deficits of the provinces and territories. So Bill C-210 is a good idea, but it is not the best idea. The federal government should think twice before interfering in provincial jurisdiction. So coming back to 210 itself, the federal government must support the provinces and give them the tools they need when and how they want. In this case here, the government of Quebec is asking that transfers be increased to $28 billion without conditions. when Ottawa tries to interfere in the healthcare sector, it is rewriting the Constitution. So I think this government should think twice about moving ahead with national standards. Now, I feel my colleagues will have many questions for me right now, but if time runs out, I'm happy to talk with them in the lobbies. But to the thousands of people waiting for a transplant, good luck. These are difficult times, especially with the pandemic and just before Christmas. Thank you very much, Madam Speaker. Have a wonderful evening.
Resuming debate. Reprise au débat. The honourable member for Calgary Confederation has the right to reply for 5 minutes.
Well, thank you, Madam Speaker. I must say that I am very pleased with what I heard this afternoon and also in the first hour of second reading just a few weeks ago. And I'd like to thank all the members who spoke on this bill. You know, from the very beginning, my goal with this bill was to avoid making it a partisan political debate. In fact, in the last Parliament, and this one as well, I have been genuinely touched by the multi-partisan support this bill has received. You know, from what we have seen so far, what I've seen so far is that Canadians should feel proud that when a sensible idea does come forward in the House of Commons, we can put politics aside and improve the lives of Canadians. And in this case, to save the lives of many who are waiting for that life-saving organ donation. So, you know, I guess my bill will go to a vote, and I am quite hopeful after what I have heard that it will be supported. I certainly hope so anyways. Just like it was supported unanimously in the last Parliament, of course, before it eventually died in the Senate when the election call in 2019 was called. So I will call on my MP colleagues, through you, of course, Madam Speaker, to please show your desire to improve our organ and tissue donation procurement system here in Canada and vote in favor of this bill. I am confident that Canada is on the verge of setting a new global standard in how to reach potential organ donors, and each of us in this House can play a role in that step forward. However, Madam Speaker, we do need to find a way to expedite this bill as it makes its way first, if it passes tomorrow, to the Senate, or first to the Health Committee, and then it comes back for final vote in the House here, and then off to the Senate. And I would welcome the support of all parties in the House in this regard, whatever we can do to expedite this process. Who knows, there could be an election call at any time, and that would once again kill this bill. It happened before, and it may happen again, and that would be a shame. I must thank the honourable member from Calgary Centre for graciously giving me his private member's bill time slot here today in order that I can get this bill through the process quicker. Believe it or not, I wasn't scheduled to be up again with that second hour, second reading of this bill until the end of January or even into February. So I do thank the honourable member from Calgary Centre profusely and sincerely. I know that he sees the value of this bill and the importance of getting it passed and implemented expeditiously. I also would like to thank many of my former colleagues on the Health Committee, in particular the member from Oakville North, Burlington, who was the parliamentary secretary at the time, and she has provided incredible support for this bill and has lobbied on my behalf within her own caucus. Along with the members from Coquitlam, Port Coquitlam, the chair of the Health Committee, and the member from Vancouver Kingsway as well, also a member on the Health Committee, and many members in my own caucus too. They have all gone out of their way to show their support for my bill and advocate for its swift passage. And that really has meant a lot to me. I also would like to thank the 20 members of Parliament from all the political parties in the House of Commons who have seconded my bill. You know, it really would be tragic if this bill were to die before it's fully passed into law yet again. And it is my hope that every one of my colleagues will speak with those that they know to help ensure the timely passage of this legislation. In closing, Madam Speaker, I have one final ask of my MP colleagues, through you, of course, again, that over the Christmas break, I implore all MPs to have a conversation with your family about organ donation, and please express your wishes clearly to them and find out what their wishes are. And even through this COVID-19 pandemic days, donating blood in Canada remains safe. Canadian Blood Services and HEMA Quebec have robust cleaning, infection control, and screening practices in place to protect all donors, staff, and volunteers. So please donate some of your blood during the holiday season. There's no greater gift than blood donation. Thank you, Madam Speaker.
The question is as follows. Mr. Weber, seconded by Mr. Atkinson, moved that Bill C-210, an act to amend the Canada Revenue Agency Act, organ and tissue donors, be now read a second time and referred to the Standing Committee on Health. Conformément à l'ordre adopté
Pursuant to the order adopted on Wednesday, September 23rd, 2020, we will not proceed with a recorded vote. Therefore, if a member from a party present in the House calls for a recorded vote or that the motion be adopted with dissent, to please indicate this to the chair, to the speaker.
I would invite a member present in the House to rise to indicate if the motion is agreed to on division or to request a recorded division. Seeing none, I therefore declare the motion carried.
Second reading of this bill. Deuxième lecture de ce projet de loi.
Accordingly, the bill stands referred to the Standing Committee on Health. The Honourable Parliamentary Secretary of the Government House Leader has a point of order.
Yes, Madam Speaker, I suspect again if you were to canvass the House, you might find unanimous consent to call at 6:30 at this time so that we can go into adjournment proceedings.
6:18. Greatly appreciate the fact that all of the information, all of the orders of the day have been dealt with, all of the work of the day has been dealt with. We don't actually need a motion to see the clock. Order. In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. I just want to remind members that there is still a little bit of work to be done in the House, so I would ask members to exit the chamber quietly so that we can continue with the little bit of work that's still left to be done. L'honorable député de...
The member for Mégantic-l'Érable. Thank you, Madam Speaker. I'm proud to rise this evening in the House and not to do so virtually, to be here in person. For me, it's an honor. And I rise to underscore the excellent work which the official opposition has carried out over the last few months to ensure that dairy producers of Quebec, they got good news this weekend. That is compensation, which they've been waiting for 13 months, finally have a payout schedule. Now producers know how much money they're going to get next year, the year after that, and the year after that. Madam Speaker, I'm very happy about that. How that unfolded was a little particular. Let's go back to August of 2019 when the Minister of Agriculture at the time made an announcement. She said she would compensate in the order of $1.75 billion dairy, egg, and poultry producers for losses incurred following trade talks on the Trans-Pacific Partnership and the European Free Trade Agreement. So that announcement was made in August. What happened in October? Well, there was an election. And after that, dairy producers did get a check. It was the first stage reflected in the announcement. And Stick with me. I'm trying to explain that there's a pattern unfolding here. So we've been waiting for 13 months, and during that time, every opposition party called on the government to provide details, deadlines, a payout schedule for the financial compensation for dairy, egg, and poultry producers. 13 months in which the government did not stop repeating something. It's all very well and good to send out a check right after the election or around election time, and then nothing. So suddenly we learned on Twitter that the Minister of Agriculture would make an announcement later on that day. And that announcement, after 13 months of pressure from the opposition parties, well, we just realized that the announcement would be about the compensation that would be paid out, and that the compensation would be paid out over 3 years instead of 7. So producers are very happy with that. But why the last-minute announcement? Well, as we saw in yesterday's economic update, the documents had been printed out, but they had simply forgotten to share the good news with the producers. So the Liberal government had to fix their mistake quickly. So Saturday morning, the compensation was announced for dairy producers. The problem, though, is that the government was not going to announce the compensation for egg and poultry producers. The government said that'll come later. So more waiting. No information on the payout schedule and who would get the compensation. There was no information at the time. And then, coincidentally, today, the Prime Minister said there would be a vote of confidence, which might trigger an election. So money's paid out. There's an announcement. More money's paid out. The checks will be in the mail soon. But this Liberal government is only interested in dairy producers around election time, and that's the problem. What about dairy processors? Nothing. There's been no announcement for them. So what I'm asking, Madam Speaker, is I'm asking my colleague, when is compensation going to come for dairy processors and egg and poultry producers?
The Honourable Parliamentary Secretary to the Minister.
Thank you, Madam Speaker. The government strongly supports supply management and is delivering on its commitment to compensate our supply managed sectors from the impact of recent trade agreements. The Minister of Agriculture and Agri-Food recently announced a substantial package that delivers on the Government of Canada's commitment to provide full and fair compensation for market access concessions made under the Canadian-European Union Comprehensive Economic and Trade Agreement, CETA, and the Comprehensive and Progressive Agreement for Trans-Pacific Partnership. A total of $2 billion in federal support will be made available to every dairy producer for the impacts of CETA and CPTPP, including $1.75 billion to be paid in the form of direct payments. Of this amount, $345 million was made available to eligible dairy producers in the 2019-2020 fiscal year. All eligible dairy producers who applied have received their payment. The government has also set a schedule to deliver the remaining $1.4 billion through direct payments to farmers over a timeline of only 3 years. Dairy farmers will receive, on the basis of their milk quota, cash payments of $468 million in 2021, $469 million in 21-22, and $468 million in 22-23. These payments will continue to be delivered through the Canadian Dairy Commission. These amounts build on $250 million CETA on-farm investment program, which has already approved 3,327 applications, and now dairy producers have greater certainty as to the level and timing of support as they adapt to the new market environment. The government is also delivering on its commitment to provide full and fair compensation to poultry and egg producers for the impacts of CPTPP. Up to $691 million for 10-year programs will be made available for supply-managed chicken, egg, broiler, hatching eggs, and turkey farmers. These programs directly respond to what was requested by the Poultry and Egg Working Group following the ratification of CPTPP, and will provide producers with targeted support to make on-farm investments that improve productivity and for market development activities. Program details will be designed in consultation with sector representatives and launched as soon as possible. Mr. Speaker, or Madam Speaker,
This compensation package will help dairy, poultry, and egg farmers make strategic investments on their farms and improve their operations to be even more competitive. Madam Speaker, our government remains committed to engaging the sectors on full and fair compensation for CUSMA. We also remain committed to support our processors of supply managed products for their market impacts. The government pledged to compensate supply managed farmers, and that is exactly what we are doing. Thank you, Madam Speaker.
The honourable member for Mégantic-l'Érable. Thank you very much, Madam Speaker, and I'd like to thank my colleague. It was a bit like rehearing the Ag Minister's press conference of last Saturday morning. And the details were in the economic statement, but at the very end of my colleague's speech, he mentioned compensation under CUSMA. So how long has this taken? Do we start counting today or as of Saturday morning? How many times are we going to be told that it's coming soon? Very soon there will be fair compensation for dairy, egg, and poultry producers. Madam Speaker, this government is just flying by the seat of its pants when it comes to compensation for producers and processors. Unfortunately, Madam Speaker, our entire agriculture industry is suffering because of it. The Honourable Parliamentary Secretary.
Madam Speaker, the industry has asked for clarity and certainty from the government as it relates to compensation, and we have provided just that. In August 2019, Minister Bibeau announced that $1.75 billion would be provided to compensate Canadian dairy farmers over 8 years. Between December 2019 and January 2020, more than 10,000 dairy farmers received a cash payment of $345 million. The government has now set a schedule to deliver the remaining $1.4 billion through direct payments to farmers over a timeline of only 3 years, giving dairy producers greater certainty as they adapt to a new market environment. The government has also announced $691 million for a 10-year program for Canadian 4,800 chicken and egg broiler, hatching egg, and turkey farmers. Collectively, this support will help dairy, poultry, and egg producers adapt to new market conditions by replacing foregone income, increasing producer confidence in the future of supply managed systems, and providing producers with the opportunity to make strategic investments in their operations. Through these investments, dairy, poultry, and egg farmers will be able to improve their operations and be even more competitive. If it will help them...
I'm sorry, the time is up. The honourable member for Edmonton Strathcona.
Thank you, Madam Speaker. I stand today to respond to a question that I asked earlier in the sitting. The Minister of Economic Development and Official Languages mandate outlines this government's commitment to Canada's official languages in minority settings, and calls for investment in infrastructure to support minority communities, including schools. So I rise today to address this mandate as it relates to the protection of French in Alberta. If we include the Université de l'Ontario Français, which is yet to welcome its first cohort of students, there are only 7 language colleges or universities in Canada outside of Quebec. And one of those is in my riding of Edmonton Strathcona. It is Campus Saint-Jean. And Campus Saint-Jean is the only French language university west of Winnipeg. It serves 800 Francophone and bilingual students from Alberta and across Canada, with a wide range of undergraduate, after degree, and graduate programs. Campus Saint-Jean is critical to the vitality of the French language in Alberta and in the west of Canada. Its education program trains future teachers for Alberta's and other provinces' primary and secondary French and French immersion classrooms. Without Campus Saint-Jean, Alberta would not have the qualified teachers it needs to serve its Francophone students, or those who, like my daughter Kelty, are enrolled in the bilingual programs in Alberta. Today, we are at risk of losing Campus Saint-Jean. In violation of the contract signed in 1976 between the Faculté Saint-Jean and the University of Alberta and the Government of Alberta, that promised adequate funding to operate, maintain, expand, and enhance the school, Jason Kenney's cuts to post-secondary education are threatening the very existence of Campus Saint-Jean. Unlike in Ontario, where the Ford government refused to fund the Université de l'Ontario Français, Alberta's government is failing to live up to its obligations. This has profound implications for the future of the French language instruction and vitality in Alberta, and as such, must be addressed by the federal government. Article 23 of the Canadian Charter of Rights and Freedoms guarantees that Alberta's Francophone parents have the right to have their children receive primary and secondary school instruction in French. The recent Supreme Court ruling in favor of the Conseil scolaire francophone de la Colombie-Britannique affirmed this right and more. It found that minority language communities must receive equivalent support to the majority language, not proportional support, as British Columbia has argued. The implications for Alberta are very clear. Unless Campus Saint-Jean is supported, Alberta school boards will not be able to meet the equivalency standard. In the case of Ontario, the federal government stepped up with a commitment of more than $60 million over 8 years to support its French language post-secondary institution and to ensure that Francophones in Ontario would have their minority rights protected. Will this government do the same for Francophones in Alberta, Madam Speaker?
The Honourable Parliamentary Secretary to the Minister of Economic Development and Official Languages. Thank you, Madam Speaker.
Member of Parliament for Edmonton, Strathcona. For support for the Campus Saint-Jean, I know she has been a vocal advocate for this institution, which shows the vitality and the success of the Franco-Albertan community. As we outlined in the speech of the throne, our government is firmly committed to supporting Canada's official language minority communities while also protecting and promoting the French language. We understand that our two official languages are an essential part of Canada's identity. Supporting Campus Saint-Jean is a fundamental part of both of these aims. En tant que la seule université francophone à l'ouest du Manitoba, le campus de Saint-Jean est un emblème de fierté pour la communauté franco-albertaine, offrant aux jeunes francophones une excellente éducation post-secondaire. Le campus Saint-Jean offre un accès à tous les Albertains et Albertaines et tous les Canadiens et Canadiennes qui souhaitent renforcer leur bilinguisme et leur lien avec le français. C'est pourquoi notre gouvernement a récemment engagé 3,7 millions de dollars pour soutenir le campus Saint-Jean dans le cadre de notre accord bilatéral avec la province de l'Alberta. Nous comprenons que le gouvernement fédéral a un rôle à jouer pour faire en sorte que cette institution vitale puisse continuer à fonctionner. But we cannot do it alone. Under the agreement between our two governments, these funds cannot be released without the government of Alberta providing its share of the funding. And unfortunately, the Conservative government of Jason Kenney has made Campus Saint-Jean one of the victims of its cuts to education. Our government has asked the Alberta government to reconsider. The Minister of Official Languages wrote to Premier Kenney asking that his government live up to their end of the agreement. But today, they remain silent.
To make matters worse, the federal Conservatives have also remained silent despite calls from the member for Edmonton Strathcona. No federal Conservative has condemned the cutbacks at Campus Saint-Jean. It's profoundly disappointing and shows how little the Conservatives care about the Francophone community in Alberta and protecting official bilingualism all across Canada. Our government cares about cooperating with other parties to support Campus Saint-Jean and ensuring that the 286,000 Franco-Albertans and the thousands of Alberta Francophiles and all Canadians in Western Canada have access to post-secondary education in French. Thank you, Madam Speaker.
Edmonton Strathcona.
Thank you, Madam Speaker. And I want to just make a point that the Campus Saint-Jean is more than just a vital French language post-secondary institution in Alberta and Western Canada. It is also the cultural, it is the socio-economic hub of the Francophone community in Edmonton. This government has clearly stated its commitment to new investments to help train, recruit, and attract teachers in immersion and second official language programs across Canada. But it has also promised to invest in infrastructure that supports minority official language communities. Campus Saint-Jean is critical to both of this. When will the minister provide an announcement on funding for Campus Saint-Jean?
The Honourable Parliamentary Secretary.
Post-secondary institutions like Campus Saint-Jean allow young Francophones to study and progress in their language and in their community. These institutions are crucial for Francophones from coast to coast to coast, since they help promote the French language by training all Canadians who wish to study in French as a second language.
I would answer my colleague directly. Our government understands the importance of Campus Saint-Jean, and we've already set aside $3.7 million to support it. We just hope that the province of Alberta and its Premier, Jason Kenney, and Conservatives here in the House of Commons will understand the vital importance of Campus Saint-Jean and show their support for a bilingual Canada.
The honourable member for Bow River.
Thank you, Madam Speaker. Appreciate the opportunity to participate tonight. Often we've heard the term for centuries called hewers of wood and drawers of water. Sometimes it's been used in a negative way. But I think in Canada we are phenomenal at it, of hewers of wood and drawers of water. That's our resource industry. We are experts at it. We are respected around the world for the technologies we've developed in this industry. I know my Liberal colleague will tell me how much they've supported the resource sector, but I've visited with alternate energy sectors in my riding. The wind turbines, we've had wind turbines for decades in my riding. We're into the second and third generation of them. Solar farms, the biggest solar farm in Canada is being built in my riding. Now, if you go out and visit those, you will find that one blade of a big windmill takes 200 coals, some great Canadian coal, to make one blade for a windmill. If you go and look at the components for solar, the metal, the plastic, it doesn't work without the resource industry and oil and gas to make those. So the resource sector is a great one to provide energy, but the other industries are complementary to it. For decades, we'll be using the resource industry in our country. So when we've got $1 trillion of debt, we've got unemployment, we've got an economy that's slowed down because of COVID, it's the resource sector that can drive this economy back to where we need to go. The energy sector is also the largest employer of Indigenous people in this country, businesses and workers. So the simple fact is we will continue to need the fossil fuel industry in the future for decades to come. But speaking of hewers of wood and drawers of water, we have another phenomenal industry. It's called the agricultural industry. As I talked to the minister in committee about agricultural workers, agricultural industry, this is an essential industry with essential workers. As she said, with the federal government and the province, it's an essential industry. So when we come to vaccinations, let's hope the government understands that the option for the essential workers in an industry that provides us food security is able to produce food that is distributed to the world to feed people. That essential workers in the agricultural industry are considered for vaccination if they so choose. Another part of the agricultural industry is broadband. Part of the challenge is the Liberal government has not quite understood a couple of things about broadband. Yes, they want to move it up. They want to do it sooner. But they keep talking about the last community, whether it's the East, the North, Central Canada, where it is. It's not the community for agriculture. It's the farm gate. The farm gate only may be a few kilometers out of town, but our agricultural industry is the most advanced in the world. The technology they're using is incredible. 50 down, 10 up is a minimum for our agricultural industry. The Liberal government doesn't understand they need to get to the agricultural industry. So, all of those things, the resource sector, to make our economy work, it is important. Thank you, Madam Speaker.
The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Madam Speaker. And, coming from the prairies and being very much familiar with the many issues that are facing our prairies, when we think of commodities, our farms, we think of our wonderful natural resources. The member opposite talked about wind power and maybe some difficult issues that he might be having with wind power. From Manitoba, I would think in terms of hydropower and the benefits of hydropower. And, we haven't forgotten about other natural resources. The TMX project is probably a good example. Today, there's well over 5,000 Canadians working on the TMX project. A project in which ultimately recognizes how important the industry continues to be. The difference is that, you see, we recognize the importance of having balance in terms of development, that you need to take into consideration our environment. Canadians expect us to, and this government will do that. The importance of consultations, in particular Indigenous community members, and the important role that they play as other stakeholders have a vested interest and need to be heard. The establishment of a process, and yet we can provide, through the establishment of process and those extra considerations, a path so that companies into the future will be able to invest with that much more certainty. And I think that is something that's really important when you talk about natural resource development into the future. And as I say, the best example that I can provide right offhand is the TMX, because of the number of jobs and the sense of commitment, and it's being done right, Madam Speaker. And on a side note, it's interesting to contrast. The Conservatives tried to give a false impression in terms of how effective this government has been, in particular in the province of Alberta. And the government of Canada has been there, working with Alberta, Albertans, and different stakeholders to ensure, even during this difficult time of the pandemic, where we're literally seeing thousands of oil industry jobs that are being supported in terms of whether it's wage loss subsidy, those that have not been able to go back, and we're talking tens of thousands of individuals, Madam Speaker, through the CERB program. But ultimately, we recognize very much so how important it is that whether it's Alberta, Manitoba, Saskatchewan, the critical role that the prairies play going forward. And one only needs to look at the wide spectrum of commodities and the demand that's out there around the world, the quality of our product, and of course, our natural resources. So, Madam Speaker, I appreciate the opportunity to be able to respond to the members' comments, because, as I say, as someone that has lived in all three of our prairie provinces, I genuinely and truly see the value, as I believe this government has recognized the value, and the actions that we have taken to date support those critical industries, because it is indeed in the best interest of all Canada when we do so. Thank you, Madam Speaker.
A member for Bow River.
Thank you, Madam Speaker. And I think he misunderstood me. We've been decades into wind turbines. We've been around for a long time in that. So we led the world in that a long time ago. So we have no problem with that one. It's just complimentary. But there's a couple of rights that we need to pay attention to today, and that's the freedom of speech. The Western Standard in my writing has gone into difficulty with the CBC. The government broadcaster is threatening legal action against the publication of my writing. This is wrong. We need freedom of speech, and especially in this time. So for the CBC to take legal action against the Western Standard, that's not right. We need freedom of speech. Or also, the freedom to exercise your religion safely and peacefully in a fundamental way is in every right of Canadian. So freedom of speech, freedom of religion are important, and we need to work to protect those rights, especially during COVID-19. Thank you, Madam Speaker.
The Honourable Parliamentary Secretary.
I'm sure that my friend from across the way can appreciate just to the degree in which we have a government, in fact, a political party as an institution that genuinely believes in freedom of speech. After all, it was Pierre Elliott Trudeau that brought in Canada's Charter of Rights. So, you know, I appreciate the comments that the member is saying, but would like to encourage the member to look at the larger picture in terms of just what it is and how not only this government but other governments have been there to ensure that freedom of speech. And many of those issues are in fact respected here in Canada. Thank you, Madam Speaker.
La motion portant que la Chambre s'adjourne est maintenant réputée adoptée.
The motion to adjourn the House is now deemed to have been adopted. Accordingly, this House stands adjourned until tomorrow at 2 p.m. pursuant to Standing Order 24-1.